Good afternoon, and thanks so much for joining us here on News Now. I'm your host, Christy Larson, and we do have our coronavirus task force briefing starting here in about 10 minutes. At least that's what it's scheduled for. If we do hear any updates on pushback or how soon we can see the president and his team, of course, we will let you know right here on our stream. So while we're waiting, what I'm going to do is put up a double box so that you can keep an eye on that press briefing, but also continue to listen into that update that's happening right now in Connecticut.
PE. The union fired back this afternoon and said that they're shocked by that statement. They said that's completely not true. Can either you or Josh speak to, what you know about workers having to use trash bags in nursing homes?
Yeah, I'll start with that, and then Josh can back me up. But these guys can go back and forth and point fingers and place blame. I'm here to solve problems. I'm in charge of the public health and welfare of all the people of Connecticut, including folks who work in our nursing homes, those incredible first responders. As you know, we have scoured the globe getting PPE. Every day, Josh and his team at Public Health are in contact with the nursing homes, doing everything we can to make sure that they get the protective gear that they need. And I think we're doing well on that compared to what I've seen in other places. And every day we're getting them more gear. And now FEMA is going to be getting them even more gear starting on May 1st. Nursing homes are private entities. They can go out and get the gear themselves, but we're out there getting it for them. And the unions, they look out for the public health and welfare of their workers. They can go out and get the gear and look out for their people as well. In the meantime, I'm going to take this on my shoulders and do everything I can to keep these people safe.
Yeah, John, just to be clear, we've received 2 reports of someone wearing a garbage bag. It's completely unacceptable in a healthcare environment. So those are obviously investigated when we hear about them. We don't have any evidence this is a widespread practice, and in both cases, the investigations yielded that was the employee's choice and that there was gowns available in that facility. So it could have been an issue of training. We're not entirely clear, but one was actually a food service worker, so not providing direct care. But if there are other instances, please ensure that they're reported to our Department of Public Health. We follow up and investigate all issues.
So Josh, these workers, I assume, were told that that's not acceptable. That's not something the state wants them wearing.
Certainly not consistent with best practices of infection control, correct.
Move along next to the Waterbury Republican American.
Thanks very much. Governor, I had a chance to speak to the state director of the National Federation of Independent Businesses. They represent a lot of small businesses, I'm sure you're aware. And they're concerned that whatever recommendations come out of this reopening planning, that there's a level playing field, that whatever happens when we open, there isn't a system that would somehow favor the big guys over the little guys. What assurances can you give to small business owners that have that concern?
Yeah, Paul. First of all, look at our Business Advisory Council. You'll see it is overwhelmingly small business. It also includes the head of the Restaurant Association, the Hospitality Association. We have a big focus on making sure our small Main Street businesses get an opportunity to get up and running as soon as we can do that safely. One of the reasons they're on that committee is we're asking them for their best ideas on how we can safely reopen. As you know, we never closed down, but it was just for pickup only in terms of those restaurants. And I think that's true pretty much around the rest of the country. But the question is really well taken, because you remember the PPP program coming out of the federal government. A lot of the big restaurant chains ended up grabbing a lot of that, those forgivable loans, and some of the smaller restaurants didn't get anything. And we're working to make sure that doesn't happen and to focus on those small businesses.
I also had an opportunity to speak to the president of the Connecticut Retail Merchants Association, and obviously they have similar concerns. And one of the things that members are conveying is, or at least some members are conveying, is that waiting to June 1st is going to be a real hardship, a real challenge or some of them. What can you tell them that will about when they might be ready to open? Is it possible that they could open before June?
Well, it's possible, but it's going to be based on the facts on the ground. I've got a business team and I got a scientific team. And I don't want anybody to think we're out of the woods. As I talked about the flare-ups around the world and the flare-ups around the country and the flare-ups here in Connecticut, this COVID crisis is not behind us. You know, that said, we are working with these local merchants to work with them to come up with ways that we can safely get their businesses reopened, not just for pickup, but also for people going in. And I think that testing, at least fever testing, and perhaps masks are going to be a big part of getting those stores open sooner rather than later.
The Connecticut Retail Merchant Association is also represented on the Reopen CT committee. We're happy that Tim Phelan, who's the executive director of the Retail Merchant Association, agreed to serve. So we look forward to hearing his voice and his advocacy on behalf of the members of the Retail Merchants of Connecticut.
Good point.
Okay, and just real quick, the Congressional Budget Office is predicting, I think, a 12% drop in economic output, I believe, for the second quarter. Do you have any projections on Connecticut? What we could expect for the Connecticut economy?
Well, I was talking to Melissa McCaw today, and it looks like our revenues will be down for the fiscal year compared to what we had budgeted previously, about 5%. As you know, that's about $450 million. New York could be down a lot more than that. Florida could be down because they rely a lot more on sales tax. So we'll see how different states have different impacts. I'm not confident, but at least because of the manufacturing base that we have here, I think we have enough of our industries that hopefully we won't be hit quite as hard. But that means nothing if you're one of the companies that were hit, starting in the service industry. So we take that very seriously.
Well, I'll add as well that there's going to be additional reporting that will have to be done on April 30th that OPM with OFA will be reporting out.
We'll move along next to Channel 3 Eyewitness News.
Yes, Governor, talking about the stages for reopening, I'm not sure where Georgia is in their stage, but they're going to be opening up early. Are you going to be watching what's happening there to see how it goes, as possibly for some guidance as to when we could reopen here, or is what's happening here in Connecticut not really comparable to what's happening in Georgia?
Well, I'm watching it very carefully. I thought it was premature. I thought opening those stores and businesses where you're least likely to be able to socially distance, like massage parlors, was the opposite of what my strategy is here. And secondly, I was sort of interested looking at the first day as they opened in Georgia. A lot of people did not want to go to that restaurant or to that facility that maybe was open. I think you're going to see the consumers using good judgment, sometimes even if the governor isn't.
Are there going to be things that you're going to be looking for like lessons learned as Georgia kind of starts to roll out?
Yeah, for one, just the nature of the consumer. I mean, I'd like to open up that small retail store, that dress shop, that toy store. And I'll be curious to see whether it's a big flood of people wanting to crowd in there because they've got a lot of pent-up demand. That would make me hesitate a little bit. Or if the consumer is hesitating and saying, I'm going to take a wait and see, then I think it's probably a more controllable situation with masks and social distancing, and I'd be more likely to be aggressive on that.
Move along next to Boceto Media.
Good afternoon, everybody. Since we're thinking about reopening Connecticut, Governor Lamont, are polls going to be open on election day? And what will be the restrictions considering the safety recommendations? Are you considering absentee ballots for primary or general elections? And also, my second question is, going back to the nursing homes, will the state of Connecticut fine those private facilities that are not complying with the safety measures to protect their workers? Thank you so much.
Yeah, I was just talking to the Attorney General and our General Counsel on the voting issue, first of all. As you probably know, we've pushed off voting now till August. So We'll see what the lay of the land is there. But I'm not sure that people over the age of 65 or 70, I think they may still be in a stay safe, stay home mode unless it's absolutely necessary. So I'd like to find alternatives, at least for them, to make sure they don't have to go to a polling booth. So we're working on that right now as we speak. Do you want to take the other question, Josh?
Sure. Yes. If there are issues at nursing homes, we investigate. If the investigation is substantiated, our Department of Public Health Commissioner has broad authority to issue fines or, in extreme cases, to revoke the license of a home as well. And so that is a constant area of focus for our Public Health Commissioner and the investigators there.
Move along next to the Day of New London. The Day of New London. News 8.
Josh, you've been investigating and looking at 2/3 of the nursing homes in Connecticut. What are you finding? Are they overall in good shape, poor shape, need more PPE?
Overall, they're doing well given the circumstances. A very stressful time, obviously, in those facilities. A lot of people working very hard in very challenging conditions, as they are around the nation and around the world. There have been some issues identified with best practices around donning and doffing PPE, proper cohorting and infection control procedures. But Barbara Cass has told me that the issues are not widespread, and where they're identified, additional trainings being provided every day by our DPH team. So there are learnings in some cases, but overall, generally, folks working very hard and under very difficult conditions.
Have you had to fine anybody?
Not yet.
Okay. And then also, the union is reporting deaths, and I know numbers are numbers. We haven't heard all the numbers, but they're saying the death toll coming out of the nursing home could be making up 50% of the population in Connecticut of the numbers, and they say they're being underreported. It's hard to calculate numbers, I know, but where do you see it fitting in?
So we'll be releasing the detailed breakdown on all the nursing homes with at least one case in tonight's press release. As of today, the number of deaths in nursing homes or from nursing home patients who were transferred out to hospitals and subsequently passed away represents 43% of the total deaths, so 768 deaths related to nursing homes.
Okay, and then one quick question for the governor. We have a lot of people in the salons, the barbershops, wondering if they can do one-on-one, do it safely. I know you've been asked this a lot, but people are wondering, can they get back to work with that?
Yeah, we're definitely taking a look at that. But if we could test the barber, that would mean a lot less contagious for somebody that he's barbering. If a barber had a N95 mask or a KN95 mask, that would be more protective, or at least just a surgical mask. Maybe a fever meter for the person who's coming in, just to make sure that they can't transmit to the barber. So there are a few different ways we can, get to a place where they can open up on a selective basis, and we're going to have more direction on that from the task force, I think, within the next week or two.
Move along next.
Thank you, Governor.
Move along next to Hearst, Connecticut Media.
Hi, Governor. Can you hear me?
Sure. Hey, Ken.
Thanks. It just, maybe I've been working too many hours, because it just dawned on me that I probably can't eat a plate of spaghetti with a face mask on. But this kind of relates to what you were saying on CNN today. I mean, truth be told, it looks like restaurants and bars are going to be the last places to open, it seems. Do you gather it that way? I mean, yeah, they're doing takeout, but a lot of them are having a hard time surviving.
No, Ken. That's one of the reasons I love Deirdre Gifford's idea for the restaurants, of get them part of our food supply chain so they can make meals and we can have those delivered, and we provide some commercial opportunity for them. The White House task force has sadly said that probably restaurants and bars will be further back in terms of how things get opened. But you could have an outdoor restaurant. You could have restaurants where the seats are further apart. We could have restaurants where perhaps the waiters wear face masks and even gloves. So there are ways we're trying to think, ways we can get back to work safely.
Thanks. And can I ask Kathleen a question, please?
Certainly.
There's this raging controversy around hydroxychloroquine, and I wanted to know if you folks have a protocol in place to either continue using it or not at this point.
Yeah, so there initially it was used as a therapy, as different types of therapies were being tried to see what would be efficacious. And what I heard this morning from our infection control physicians is that there's now been a small study that has indicated that it is not efficacious in the treatment of COVID-19, and we are no longer going to use it. So there's going to be new guidelines in our organization, and I'm sure others will look at these studies and the evidence, and will make those decisions appropriately.
And Governor, are you just going to let the hospitals decide for themselves on that, let the doctors decide?
I think so. You don't need the governor to get in the way of between a doctor and their patient.
Sure, thank you.
Hartford Current.
Hello, Governor. Are you concerned that the nursing homes, or at least some of the nursing homes, are not giving accurate information about the deaths and are frankly downplaying it? We hear about different deaths there, and then we find out later that they were COVID related. Are you concerned you're not getting accurate information?
Josh can better handle that, but I would say there's been a lot of discussion about what is a COVID related death. I think we've talked about that before, and many people die of complications related to COVID. And I know the task force, again, has a universal definition out there that says if found to be infected, if found to be showing symptoms, that will be treated as a COVID-related death, and they're fairly clear about that. Josh, perhaps the nursing homes are still coming up with to the definitions.
Yeah, I mean, I think in their defense, it's a complex thing to track it sometimes. They may send a resident to the hospital who might be sick, but maybe hasn't yet been tested for COVID. They get tested at the hospital. Perhaps they pass away at the hospital. How the nursing home keeping track of that sequence of events sometimes can have a time lag associated with it. But I think to the premise of your original question, Chris, although we don't have any immediate evidence that that's happened, as you know, the governor put in place an executive order yesterday, I think it was, or the day before, that added accurate reporting of data to the list of items that could be cited by our Commissioner of Public Health and fined if it's not being done properly.
Okay, and also, Josh, one follow-up. At one point we were getting information on the number of COVID patients who were discharged from the hospital, and then it seemed that we weren't getting that. In Stamford on this call, we just got anecdotally, we heard about 215. But can you get us comprehensive information on that on a statewide basis?
Absolutely. In fact, I can tell you right now. Just got to pull up the file. I'll get back to you, Chris. I'll send you the number offline.
Okay.
Move along next to Connecticut News Junkie.
Thanks for taking my call. So I wanted to know about testing of nursing home workers. Since visitors haven't been allowed in nursing homes, nursing home workers, are they able to get the test? Are we getting the testing that we need?
Just want to say thanks again for being here with us on News Now. We did get an update that President Trump's briefing did get pushed back to 5:30 Eastern Time. That's 2:30 here in Arizona. I have changed the title here on our stream, but we're going to continue to listen into Connecticut's latest update until the president and his team do step out again. That did get pushed back to 5:30 Eastern Time.
Up our overall testing capacity in the state.
And then I have a question for Kathy. How much health care are people delaying, and what is going to be the impact on the system? Are we going to see a second surge, not necessarily a COVID surge, but a surge from delaying of putting off necessary medical treatment?
Yeah, we are concerned about that, as I mentioned before, that because of fear of going to the hospital, and it's not just hospitals, any healthcare environment, people are putting off getting their normal healthcare, and people have chronic diseases. They have needs that have to be addressed. We're obviously not going to perform elective surgery or an elective procedure during this period of time on a patient, but people are perhaps neglecting the care that they truly need, and could create a surge and could create more prevalence of disease later on. So we want everyone to stay in touch with their physicians, communicate with them, and make sure that they are taking proper care of themselves, filling their medications. And if they need to seek care, they can seek care. As I mentioned this morning, our census for non-COVID patients exceeded COVID, and that's very important. We had to perform some urgent orthopedic procedures for injuries yesterday. So we still can take good care of patients, even though we're not doing elective, postponable types of procedures. So that's a public health message that I would like to get out to the community.
Fox 61.
Zania Maldonado, Fox 61. I have a question for Josh in regards to the executive order finding nursing homes $5,000 for not reporting infection data. Will nursing homes also be penalized for things like infection control and patient communication violations? Is there anything else besides reporting infections that nursing homes could be fined for?
Unmute.
Unmute, Josh.
Unmute. Josh, unmute.
Let me just say that there are other things that a nursing home can be fined for, and we're keeping a close eye on the situation because there are a lot of lives at risk.
Josh, want to try again? You're still muted. Try again.
We'll come back to him, Max.
Also then, right now the Department of Public Health is investigating these nursing homes, but Governor, would you possibly follow suit with New York in having the Attorney General's office investigating these violations?
My hunch right now is we're not there. I think we're just doing the investigations, and Josh and Renee, Commissioner of Public Health, we're in there. We're finding no major violations. We're very strict in terms of what the protocols are going to be, very strict in terms of what you got to do in terms of infection, very strict in terms of what you got to do in terms of hygiene, very strict in terms of what you got to do in terms of reporting. And if they don't get it right, then we'll come back and take another look.
Move along next to WTIC 1080 News.
Kathy, a question for you.
Yes.
When the chief executive uses the bully pulpit to even utter the suggestion that humans use household cleaning products to somehow heal anything, that's something my 12-year-old was laughing herself sick at this morning. What's the impact on the medical community when a person who is in that position uses that stage to present something that's absurd to everybody?
I just want to clarify the question. Is it that you want to understand how we would approach someone using non-approved cleaning products?
No, what's the talk in the healthcare community when you hear someone so powerful suggesting something so silly?
Well, I would certainly not advise for anyone in the healthcare community to give advice about using unacceptable cleaning products. There are ways, and if you can't get the traditional things that you purchase normally for your home, that you can research what exactly you can use and how to prepare that safely. I actually saw a segment this morning on the news about how to prepare a small cleaning product with a small amount of Clorox and water, and that you could use that for a week. So there is available information on what is safe and effective if you can't get the traditional products that you would use. But my advice would be to be very careful about using non-approved mixtures of cleaning products because they can be very dangerous.
Okay, sorry to drag
Add
you
to that
into
if
that.
I could.
Okay.
It's incredibly unfortunate when somebody in such a position of power with a bully pulpit makes flip comments like that about ingesting these disinfectants and cleaning products and Lysol and the such. It's absolutely wrong. It's dangerous. And I urge each and every one of you, don't even take it as a bit of humor or sarcasm. Make sure your kids know that this is something that's dangerous and should not be allowed.
All right, sorry to drag you into that one. Also, the nursing home numbers were due yesterday from DPH. Now you say they're coming in a separate release from the governor's office, I guess, tonight. Is there a particular reason for the delay?
Yeah, can you hear me now?
Yep.
Gotcha.
Yeah.
The delay is just the complexity of compiling the report. I gave a couple examples in a prior instance of having to triangulate between multiple sources of data with patients coming and going from nursing homes to hospitals, the different sources of data around death reporting. So it's just a very time-consuming, labor-intensive process, and given the importance of the numbers, the team just wanted to make absolutely certain they got it right.
Move along next to the Connecticut Mirror.
1199, the Healthcare Workers Union said today that at least some of these nursing home inspections were conducted by telephone. Is that correct?
Yeah, so there's yes. Although, as the governor said, over 2/3 of the nursing homes have now been physically visited for inspection as well. So both are happening on a daily basis.
Well, okay. When you first announced the nursing home inspections, I think the assumption was that at a bare minimum, you're going to have state public health workers walking into nursing homes and ensuring that workers had appropriate PPE and that there were basic protocols being observed about how to deal with contagions. So what is the purpose of a telephone inspection? What can you get done?
So it's being done via FaceTime. So you have the video. And so what they'll also do is ask the operator to walk them from where the patients are to the room where the PPE is stored while keeping the video running. So you can actually, through a video, a FaceTime session, you can actually accomplish a good amount. But they are sending people on site as well, Paz.
What's the breakdown? How many of these inspections are done via Zoom or other video conference versus having somebody physically present?
I'd have to get back to you on the breakdown.
I mean, one would think that part of an inspection would be to be able to converse with employees there on site and check to see, what is the general availability of masks and gowns and whatnot.
I think you're right, Paz. There's a timing issue. We got as many people as we can doing as many physical inspections as we can. As Josh said, sometimes FaceTime allows us to get to more nursing homes faster, but my goal is to have every single nursing home with a physical inspection so we can talk to people and find out exactly what's going on.
So what's your confidence level at this point as to whether or not you know what indeed is going on in those nursing homes?
Well, I mean, there's 215 nursing homes in the state, Paz, so we're working our way around them consistently as we find things or as issues are reported into DPH. They're all chased down and investigated, and that helps inform the order at which investigations are conducted as well. So, the team is out there every day chasing down any issues that come up.
And I'll let you go, but what does that team look like? How many people are on a team? And how long are they on site when they go to these places?
I can get you those details as well.
Thank you.
Move along next to NBC Connecticut.
Good afternoon. Governor, you said if the hospitalizations continue on this downward trend, in a week, we could be at phase 1 of the federal reopening plan. That would mean elective surgeries can resume. Gyms might be able to open under strict sanitation rules. So when you get your report from your task force, will you be considering opening anything before May 20th?
I think when we look at that tier 1 spot, we have an opportunity per the COVID task force that gives us some flexibility. So I'm going to wait and listen to what the task force says, see where we are in terms of infections and hospitalizations. But as you know, hospitalizations was key because that told us what capacity we had to make sure we could take care of people safely.
We've been hearing a lot about the possibility of a second surge this fall. I know you've set up several field hospitals. You also have the convention center set up. Will you keep all of that set up into the fall in case we do have another surge?
I think I'll talk to the professionals on that, but to tell you the truth, it makes all the sense in the world to me because I'm just looking around the world and I see what is happening. I see what the head of the CDC said. I see what Dr. Fauci said. They said, be careful. You could have a second surge, and it could be as severe as the first one. And I want to make sure that we have all the PPE we need, make sure we're prepared for that. We have the beds as well, which gives me a chance to say a thank you. That's to Raytheon Technologies, or as we say in Connecticut, the band formerly known as United Technologies. And they've just made a large donation of PPE, 455,000 KN95 masks, 325,000 surgical masks, plus coveralls to make sure that more people are protected, both in our nursing homes and broadly in our community. So I say to Greg Hayes and our friends at United Technologies, thank you there for what you did. I got to say, Kathy, Stanford Health is so fortunate to have you there. You turned the corner. I love the way you worked in fellowship with not just the Guard, but your fellow hospitals, made sure that we always had the capacity there during a tough time. And General Yvonne, give my best to the Guard. I mean, they did amazing work. I was there at Southern. I know those guys had recently come back from Afghanistan, and there they were setting up the field hospital. And a little bit of my heart goes out to the guys who were at Guantanamo now doing CCSU. Thanks, everybody.
All right, guys, thanks so much for being here with us on News Now. As you can see, we do have that press briefing that should be getting underway here in about 8 minutes. And President Trump had sent out a tweet saying that they had pushed it back to that 5:30 time. So again, we are about 8 minutes away. Just wanted to take a look side by side here for you. Our latest numbers of coronavirus, which have topped 886,000 cases here in the United States. But let's talk about some of the positives. We've tested 4.6 million Americans. So here's the total, 4,692,797. Let's talk about something else positive. 81,536 Americans have recovered from coronavirus, so that is great. Taking a look though, unfortunately, we do still have 124,000 people hospitalized in the U.S. and our deaths have succeeded and gone over 50,000 now. So a lot of those are coming from New York City, which we've been talking a lot about. New York City, New York actually has 16,646 of those deaths. So once again, that state has been hit really hard. If you do know anyone in that state, I know I reached out to my friend the other day. I encourage you guys too to reach out to your friends and your family members, people you know who live out there. I texted my friend and she said that she lives alone, and she had said that she hasn't seen anyone in person in more than 40 days. So it is one of those things that if you are one of those people who, like me, we do go into work every day because we're essential workers. My husband and I, we do get to see people in person. So we're going to set up a Zoom date soon so that she can continue to have people at least talk with her, even if it does have to be virtually for now. So President Trump, as you can see, is a little bit ways away, just a few minutes. So what we're going to do is we're going to hop things on over to one of our stations. They sent us a In This Together story. Let's play that for you while we're waiting. And as soon as President Donald Trump and his coronavirus task force team do come up on screen. Of course, we'll be putting that in full for you. So once again, this is from our sister station, WNYW.
From Fox 5 News, in this together, staying connected through coronavirus. A look at how you can work smarter from home, cut your own hair, see the best parts of the city from your couch, and celebrate in new and unique ways, all while keeping your family safe.
Hi there, I'm Ryan Christopher. And as challenging as this time has been for all of us, we've really seen some beautiful acts of kindness and hope in the tri-state. We'll be sharing some of those stories here with you shortly. But first, as we've been quarantining, beyond binge-watching shows and Zooming friends, you're probably trying to figure out how to give yourself a haircut without looking like Joe Exotic. But not to worry, here are some tips for haircuts at home. So let's start with the fellas.
So the few things that you need in order to do an at-home clipper haircut is you need the clippers, you need guards. This is really important when cutting hair because it gives you the ability to not cut too much.
Kristen Serafino is a celebrity stylist for some of Hollywood's biggest stars, but now she's lending her expertise virtually to coach people through haircuts at home. She recommends always cutting clean, dry hair.
So you want to take the guard, put it up against the head, and whatever hair comes out, that's the length that's going to come off. So if it looks like it's too much, then use a bigger guard.
Next step, section the hair to easily control desired length between the top, sides, and back.
You want to think of it as small sections versus going straight up the hair. So you want to take little straight up, and then afterwards what happens is the guard can create lines in the hair. So over the same section, make little V's. So you go up and then little V's over the same section, and that will eliminate any lines that the guard creates.
And if you're looking to trim the top, Kristen recommends cutting at an angle.
So hopefully you have the confidence to try it out in your own home. Well, someone else do it for you, of course. Doesn't look too shabby, right? Let's check in with Bianca Peters from Good Day Wake Up to see what she's got for the ladies. What do you got, Bianca?
Hey, Ryan. So I got to chat with one of NYC's top hair colorists, Carlina Ortega. She works at Rita Hazan Salon here in the city, and she's saying do not let that desperation lead you to box dye. She's suggesting try some of these DIY treatments at home first.
I would recommend using a hair concealer, a root concealer. I like Rita Hazan's root concealer. They come in about 5 different colors. It'll fold you over. You apply it. You can apply it at your hairline, your part, and they're temporary. It's easy to wash off.
And if your hair color looks a little dull, try a gloss for your specific hair color.
You put it on in between your shampoo and conditioner, and it'll make it nice and shiny and vibrant. Especially those blondes who can't get their highlights done.
And Carlina said show your hair some love during quarantine with these avocados.
Take a whole avocado, a ripe avocado, add some olive oil, maybe a little bit of yogurt, blend it in, make it nice and smooth, put it all over your hair, start on your ends or wherever it's the most dry, work your way up, leave it in for about an hour. After that, rinse, shampoo, condition, and your hair is gonna feel totally silky, totally amazing.
All right, well, through the outbreak, New York Governor Andrew Cuomo has really catapulted to the national stage for his leadership and his daily press conferences. And a few New Yorkers have showed their admiration for Cuomo in the form of parody videos.
You bring hope when I can't cope. I guess I'm saying I love you so.
That was YouTuber and native New Yorker Randy Rainbow with his spin on Sandy, performed by John Travolta in Grease. And I got a chance to catch up with Randy to talk to him about what inspired him to make the video.
It just came from the heart because, like most New Yorkers, I think, and many people around the world, I find myself just falling in love with him. I think it's because we have such a thirst and an appreciation for what he's giving us these days, which is leadership and guidance and civility and compassion and tight polo shirts at a time when I think we're craving it, and I won't say why.
And another person having some fun with the pressers is Missy Modell with her take on a Britney Spears hit. Modell, also originally from New York. She moved back from LA just recently before the outbreak, and I asked her about her love for Governor Cuomo.
My love for Cuomo has really become like my way of feeling anchored to the city. He's truly the voice of reason and the only person that's actually making me feel okay and safe in this situation. So that took a bit of a comedic role amongst my friends. I'd be like, oh my God, he's like kind of amazing. He's kind of cute.
Well, in 48 hours, Modell wrote the parody song and recorded it in the comfort of her own apartment.
What should I do?
But it's not all fun and games. Some people actually have to work from home. Crystal Young is here with some tips to make your workday a little bit more comfortable. Crystal, we're doing our social distancing here.
Yes, we are, and I think it's working. Well, I can tell you that if you found yourself working at home without a home office, you are not alone, but there are some things that you can do so that it isn't literally a pain in the neck.
It starts with the feet. You want your feet flat on the ground at a 90-degree angle. You want your chair at a level so that your knees are at a 90-degree angle. You want to be sitting in a comfortable chair that has a good cushion under your rear, as well as good lumbar support. People who are complaining of neck and back pain, recently working from home, they have setups that put their neck or back in sort of an awkward position, and they end up spending hours in that awkward position.
So I asked Dr. Charla Fisher, an orthopedic surgeon at NYU Langone Spine Center, to evaluate the at-home work area of 4 different people.
I like how Liz is sitting with her feet flat on the ground. Her knees and hips are at a 90-degree angle. Her back is nice and straight and well supported. I would add a cushion under her chair. I would like to see her keyboard more at lap level and using a separate monitor at eye level. The only issue I see is that her hands are a little elevated and she's looking down just a little bit. So I'm not a fan of people using an elevated chair like a counter seat or a bar stool. Ideally, their feet are going to be flat on the ground. The monitor is off to the side. And so as you can see, she's slightly twisting at the waist and slightly turning her head. So those 2 areas could cause her some pain. So what I would recommend is that she moves the monitor directly in front of her. So Nathan has a good setup in that he has a nice dining chair, a good table to work on with lots of room. His feet can be flat on the ground. Looks like they're crossed a little bit. He's got nice cushion under his seat, and the chair is well supporting his back. He could add a little lumbar cushion under his lower back if he's getting some pain in that area.
And then there's Joe, who has the most unique setup of all. He created his own table using an old door and 2 chairs.
It seems to be working for him because his feet are flat on the floor. His knees are at 90 degrees, or can be. He's sitting on a good, comfortable seat. His hips are at 90 degrees. His back is well supported. I would just move the monitor directly in front of him so that he's not having to look off to the side.
Dr. Fisher also points out this is the perfect time to use those teledoc services where you can actually just sit on your couch and talk to a doctor. I tried it a couple of weeks ago, thought it was super simple.
All right, thanks so much, Crystal. We'll have more from Crystal coming up in just a little bit, and that is so important, keeping your social distance while staying healthy.
Coming up, how couples are tying the knot through the pandemic. And one world-renowned fashion designer pitching in to make medical masks for our healthcare heroes.
Well, that's Long Island's take on We Are the World. Adam and Kristen Seeley from Farmingdale, they rounded up 70 artists across the island to perform, and everybody worked virtually from their own homes to record their parts. And the Seeleys say that their intention is to bring a little bit of musical joy to the current reality and to showcase how much talent there is on Long Island, and that video certainly shows that. But unfortunately for many musicians, they're out of work right now, some usually relying on gigs from events and weddings. And actually, according to the Knot, there were 845,000 weddings scheduled in the U.S. from March to May. Most of those couples had to call an audible on their big day.
We were supposed to be married April 4th in Kauai.
I cried every time we called every vendor. I was probably crying for the first 3 or 4 days.
Brides and grooms of all walks of life have had to put one of the biggest days of their life on hold.
This year in 2020, we have weddings in the Southamptons, New York City, Westchester County, and they've all obviously been impacted already in very different ways.
Tri-State events planner Lisa Antonecchia says that some couples are opting to still legally get married on their scheduled wedding day.
We're hoping and praying that you know, we can go to town hall, and if not, we have family members and friends that are ordained. So one way or another, we're going to get married.
Danielle and Peter have been able to lock in a new date, but not until 2021.
Take it day by day and breathe. It's okay.
Jessica from Long Island, along with her fiance Andrew, are also shifting plans for their big day in East Meadow.
We're paying the same across the board, but there was no penalties. We just picked a new date.
But like just about every other industry, the outbreak is making a financial impact on the vendors.
Most people in the event community are sole proprietors. They make their own money, they work for themselves, and they hire a big workforce throughout the event timeline.
This goes for DJs, bands, florists, and caterers. Chef Plum is a private chef in Manhattan in the Hamptons.
So it's really tough to see these guys who are really, really talented people in their craft kind of not have something to go back to. But I tell you what's really come together for it is it's amazing to see, Ryan, is how many of these chefs have come together to help other people, to come together to make food for first responders and things like that. It's really been uplifting to see at such a bad time.
The resounding advice to brides, grooms, and yes, their families too: keep calm and keep in close contact with your vendors.
How can we reschedule these events? And we want to postpone them. That is our goal. When can we get them back on a calendar so that we can have these glorious events for these people at the other end of this?
Well, Broadway is also looking to get back on its feet, but in the meantime, there are still some ways you can get your musical fix. That's because the virtual opening of Pride and Prejudice drew 150,000 viewers on streamingmusicals.com, and also Andrew Lloyd Webber's YouTube channel called The Shows Must Go On. You can find full-length musicals available for 48 hours, and one of those shows is Webber's iconic Phantom of the Opera.
Coming up, Crystal Young shows us the right way to sanitize. Plus, fun and unique ways you can throw a kid's birthday party while keeping your social distance.
Well, it has become a very familiar sound here in New York, clapping because we care. Every single night at 7 o'clock, people making some noise in support of our healthcare heroes. It's been a daily glimmer of hope, reminder of community, and that everyone is working so hard on the front lines. And we've seen such an outpouring of support for those doctors, nurses, and first responders, from food deliveries to even people making masks.
Yesterday, we coordinated the drop-off to Long Island Community Hospital.
Zainab Khan Loftus's husband is a doctor at the hospital, and after hearing of a mask shortage, she took matters into her own hands and reached out to renowned designer Naeem Khan. Khan, who is best known for dressing some of the world's biggest celebrities and creating lavish wedding dresses, he put his team to work to craft protective masks for frontline workers.
My sweet girls were like, so ready to help make these things.
And in one day, each of his seamstresses can make around 30 masks.
It took me a while to design these things. I didn't want to have the regular pattern. So there is a layer. So there are 2 layers, and within the layer, you can actually put a filter in there. And this way you can use your filter for much longer time. When I say a filter, I mean a surgical mask.
Yeah.
You take your standard surgical mask, bury it between the 2 cloths, and you can use it for, I think, a couple of days rather than, and you can wash it.
Khan and his team have crafted over 2,000 masks for various local hospitals.
And even the nurses, too, when they put it on, they're like, wow, this is comfortable, and it fits so perfect.
Normally planning every detail of an ornate gown, Khan has made it his duty to serve the doctors, nurses, and first responders.
It's an honor to be there for the community and for our hospitals who are in the forefront fighting this crazy battle that we are in right now.
And since he has started, Naeem Khan has donated over 5,000 masks to local hospitals. And something else that people are making beyond masks, hand sanitizer. And it's easy to make, but you might have trouble finding the ingredients. You're going to need 3/4 cup of rubbing alcohol, 1/4 cup of aloe vera gel to keep your hands nice and smooth, and if you want, a few drops of essential oils to add scent. The key is to whisk the solution together to turn it into gel. But whether you're making it on your own or finding it in the store, Crystal Young is here with some ways to properly sanitize. Crystal, I've been Lysoling my Lysol as of late.
That's one way to do it, Mr. Clean, but I will acknowledge that with all this information coming at us fast and furious about coronavirus, it's hard to know exactly what to do when it comes to cleaning and sanitizing, but I've got tips from the experts.
Now more than ever, we're cleaning and disinfecting. But are we doing it right? Armed with good products and information, you can.
We continue to see evidence that our aggressive strategy is working and working at a very high level. Nationwide, the percent of tests that come back positive has declined very significantly. Last week, roughly 38% of the tests in New York were positive. This week, that number is down to 28%. New cases in New York are down 50% compared to a week ago, and fatalities are down 40% over the same period. In Louisiana, the rate of positive test resulted declined from 25% down to 15% in the last 7 days alone. 18 states now show a decline in a number of positive tests in the last 7 days. So over the last 7 days, been very, very significant progress. Half of all Americans live in states that have now taken steps to open their economies. Just yesterday, Governors Gavin Newsom, California, Tim Walz of Minnesota, and Bill Lee of Tennessee announced additional plans to restart certain sectors. We ask every American to maintain vigilance and hygiene, social distancing, and voluntary use of face coverings. We're opening our country. It's very exciting to see. We have a lot of talent involved, from governors down to people that just stand there and help you with the doors. There's been tremendous talent involved and tremendous spirit from our country. The country is a great place, and it's going to be greater than ever before. I really believe that. I think there's going to be a tremendous upward shift. I spoke with Tim Cook today of Apple, and they have a good sense of the market, and he feels it's going to be a V. The V is sharply upward later on as we actually get it fully open. Today, I signed the Paycheck Protection Program and Healthcare Enhancement Act, providing $320 billion to keep American workers on the payroll. $30 billion of the Paycheck Protection funds will be reserved for small financial institutions, including those that serve minority and distressed communities, extending vital relief to thousands of African American and Hispanic American small business owners and their employees. The bill also delivers $75 billion for hospitals, so badly needed for hospitals. They've taken a very big hit. And medical providers in areas less affected by the virus. Hospitals and doctors should work with their state and local health officials on ways to safely resume elective medical treatments and care. Under the CARES Act, we're sending direct payments to millions of American workers. More than 80 million Americans have already received their payment, $3,400 for a typical family of four. $3,400. That's great. And you deserve it. The CARES Act requires that the federal government send out a notice of what benefits Americans are receiving. To fulfill the requirement, the Treasury Department is mailing a letter to me. It will include the amount, their economic impact payment, how it will arrive, direct deposit, check, or prepaid debit card, as well as a message to the nation letting each American know that we are getting through this challenge together as one American family. And that's what's been happening. The whole world is watching us. You have 184 countries out there that have been hit, and now it's probably higher than that. But they're all watching us. They're all watching, and they're calling, and they respect what we're doing so much. I spoke with the leaders of numerous countries today. They're asking if we can send them ventilators, and I'm agreeing to do it. We have tremendous capacity, now overcapacity of ventilators. We're filling up stockpiles for our states and for ourselves. Federal government has over 10,000 ventilators, and we could have a lot more if we wanted to do that, but we're helping Mexico, Honduras, Indonesia, France. We're sending to France. We're sending to Spain. We're sending to Italy, and we'll probably be sending to Germany should they need them. Over the last 3 years, we built the strongest economy and the most successful country the world has ever seen. Greatest economy the world has ever seen. Nobody's ever done anything like what we were able to do. And we will rebuild that economy. Our economy in the not too distant future, I really believe, with all that we've learned and all that we've done, will be just as strong and maybe stronger than ever before, even stronger than it was just 2 months ago. Some interesting note is that the FDA approved the first at-home COVID-19 test kit, just got approved, and Dr. Stephen, where is Stephen? Stephen Hahn, Stephen, is going to say a couple of words about that and some other things. I want to thank Stephen. The FDA has been incredible. They've been approving not only this, but they've been approving many things at a pace that's never happened before. And they're being very safe about it, as Stephen told me. He's told me very strongly. But at the same time, they're approving things at record numbers at a record rate, and it's really been helpful. Many tests are going on, many vaccine tests, and tests of every different kind. And things are happening, just like this event, things are happening very rapidly, and I'd like to have Stephen tell you a little bit about it. Thank you very much, Steve.
Thank you, Mr. President. I appreciate the opportunity to tell you about what's happening at the FDA. We have a team of more than 18,000 employees, including 10,000 scientists, doctors, pharmacists, and nurses. And they've been working around the clock because, as you probably know, many of the medical products that are being used for the COVID-19 outbreak are, in fact, regulated by FDA. The staff have been hard at work authorizing tests and other medical products. As part of these efforts to support diagnostic test development during this global pandemic, the President has asked us, and under his leadership, to actually cut down as many barriers as we possibly could to get medical products into the medical community, and we have done that, of course, recognizing the urgency of the situation. I do want to emphasize what the President said, that we are very much paying attention to safety and with respect to tests, validity, and reliability of those tests. And I think it's really important to understand how far we've come in just a few short months. The academic community, which I come from, the private sector, the government, we've come together to develop diagnostics for a completely new infectious disease. And it's really important. We've heard from many test developers, both in academia and in the manufacturing world. This normally takes years to develop. You've heard Dr. Birx talk about the fact that HIV tests have taken many, many years to develop. This has happened in weeks and months. We've been laser focused on working with both industry and academia to actually make this happen. To date, under our emergency use authorization approach, we've quickly reviewed and authorized 63 tests, both diagnostic as well as serologic, that is the antibody test. We've had several point-of-care tests, and that's important because those can be done in the emergency room or in a doctor's office, et cetera, and much more convenient for the patient. And this week, as the President said, we authorized the first at-home test by a company called LabCorp. This is a test where, under certain circumstances with a doctor's supervision, a test can be mailed to a patient, and the patient can perform the self-swab and then mail it back and get the results after that time, all under the guidance of a licensed physician. And we're not just letting up with these 63 tests we've approved. We are working with more than 400 test developers who are pursuing authorization for their diagnostics under our current policies. And under our regulatory approach, which is quite flexible, many other tests are becoming available. We have heard and have reported to us 220 labs around the country have begun patient testing using their own validated tests. This has allowed us to increase significantly tests around the country. I updated you earlier this week on serologic tests, these antibody tests that are used to detect natural immunity, and the FDA's approach to help make these tests available. While these are just one part of our larger response effort, they can play a role in helping move our economy forward by helping healthcare professionals identify those who have immunity to the COVID-19. And just finally, when it comes to therapeutics, we are leaving no stone unturned in finding treatments for COVID-19. You do know that we don't have any approved currently therapeutics for COVID-19, but we are actively involved with both the academic and the commercial and private sector to find those. 72 trials of therapeutics are underway in the United States under FDA oversight, and 211 are in the planning stages. So we expect to see more. This includes convalescent plasma as well as antiviral therapies. Work continues on vaccines, and 2 firms have announced that the FDA has authorized their trials to go forward, one of which we've mentioned here before. And finally, in response to the President's and task force request, we've stood up the Coronavirus Treatment Acceleration Program. We are leaving no stone unturned, as I said, and we're working around the clock to develop these therapeutics for the American people. Thank you very much.
Dr. Hahn, a question about antibody tests, please. It's a quick question, and it's timely because just about an hour ago, a subcommittee with oversight released some findings that the FDA doesn't have any review of the antibody tests that are on the market. There are no guidelines to tell which ones should be out there, and there's no way to test their accuracy. They're quite worried that these are junk tests on the market because they weren't reviewed before they were approved. Is that true?
So under our policy, we provided flexibility. What we've told manufacturers is that in order to market in the U.S., they have to validate their tests. They have to tell us that they validated their tests. And then in the package insert, they have to let people know, end users, labs, et cetera, that those tests were not authorized by FDA. We've authorized 4. As I mentioned, more in the pipeline. And these tests that have come in without any information to us but have been self-validated, as I mentioned at the podium a couple days ago, we are working with the National Cancer Institute as well as CDC to perform our own validation of the tests that have been sent to us. So we'll provide as much information as we possibly can. And there is transparency on our website about those tests and also the tests that we have authorized.
Thank you.
Thank you very much, Mike. Please.
Thank you, Mr. President. From early in this effort, President Trump has called forth a whole-of-government response to the coronavirus epidemic in America. And by that, the President made clear when he asked me to lead the White House Coronavirus Task Force, not merely a whole of the federal government, but a full partnership with state and local governments across the country. And today we renewed that with our latest conference call with governors all across America. We've met with them today specifically to speak about the progress that our governors are making, expanding testing across the country. And we were pleased to hear about the extraordinary and rapid progress that governors are making. At the outset of the call, where we had more than 50 of our nation's governors, we, of course, had Pete Gaynor of FEMA report on progress. More than 35,000 National Guards stood up, 5,000 active duty military deployed in 10 states. And we were also pleased to report that FEMA, HHS, and the private sector have coordinated the delivery of shipments to states around the country, including nearly 67 million N95 masks, 105 million surgical masks, surgical gowns, shields, gloves, more than 10,000 ventilators, and more than 8,000 federal field medical station beds. Beyond the report that we provided to the governors, we assured them that at the President's direction, this is one team, one mission. And we made it clear to the governors that we know we're all in this together. And the partnership that we have forged together really begins with mitigation efforts. It moves to making sure our healthcare workers have the support they need, but also testing is in the forefront of all of our minds. We're working to make it possible for every governor to access the existing capacity to enable our states to be able to reopen responsibly under the phased approach that the President unveiled 1 week ago. A little bit of context, you may recall that 1 month ago, all of the testing that had been done in America, 80,000 Americans had been tested. But as of this morning, 5.1 million Americans have been tested for the coronavirus. A quick reminder to our fellow Americans, and this was something from our scientists today at the task force. We reminded governors of this as well, that as testing increases dramatically across the country, cases will increase as well. But people should not be discouraged by those numbers. We are looking at very positive trends in hospitalization, in emergency room entrances, and we continue to see, as we've said at this podium every day over the last several weeks, we continue to see positive progress, not just on the West Coast, but even where the coronavirus epidemic has most deeply impacted in areas of the greater New York City area, New Orleans, Detroit, and elsewhere. On our nearly 2-hour phone call today with those governors, we heard of the progress governors were making in implementing the resources that we've been working to provide them, not just the medical equipment, but also, as you recall, that map a week ago that showed where all of the equipment is all across the country in all 50 states. Governor Cuomo joined us for the call today. He spoke favorably of his meeting here at the White House, Mr. President, and his recognition that testing is a partnership between the federal and state governments. As Governor Cuomo said today, he understood that the federal government works with national manufacturing and supply chain, and the governors deal with the labs to expand and implement testing at the state level. Governor Cuomo also explained how he's using his licensing authority as a governor to stand up the more than 300 labs that can do coronavirus testing in the state of New York, and we congratulated him for his leadership in that and urged other governors to use their authority similarly. In Tennessee, Governor Bill Lee told us that he's deployed the National Guard to stand up more than 20 drive-through test sites. They're testing 10,000 people a day, have already tested more than 130,000 people in Tennessee, and they expect to surge another 15,000 people in testing sites this weekend in Tennessee. Massachusetts is an area we're continuing to watch very closely as cases have not yet stabilized, and Governor Charlie Baker, after he thanked us, Mr. President, for the Army Corps of Engineers deployment of 4 field hospitals, he described how they have rapidly expanded testing all across Massachusetts. We commended him for that. In the beginning of March, he said they had just 1 testing site in the state of Massachusetts, and now, thanks to Governor Charlie Baker's team, they have more than 30 testing sites. Minnesota Governor Tim Walz reflected on the call today about the partnership he's forged with the Mayo Clinic, the University of Minnesota, and State Health Department. They're actually collaborating to perform 20,000 molecular tests and 15,000 antibody tests per day. And I'm looking forward to traveling to the Mayo Clinic in Minnesota on Tuesday of next week to learn firsthand from the governor about their efforts across the state to expand testing. Iowa Governor Kim Reynolds gave us an update, Mr. President, on her progress. She's literally tripling testing capacity in her state through a partnership with the private sector, with the University of Iowa and Iowa State University. She also launched the testiowa.com website, which actually creates an access point for people to fill out a questionnaire about whether or not their symptoms or circumstances would justify a test. She said in the first 72 hours, 150,000 people went to the test site to receive an assessment, and Iowa is now testing 4,500 people a day in their state. In Indiana, I spoke also today with Governor Eric Holcomb. They've tested 72,000 Hoosiers to date. They're adding drive-through sites. They'll have 10 drive-through sites established by the state of Indiana before the end of the weekend. And as other governors have done, Governor Holcomb last week opened up half of their elective surgery sites and hospitals across the state, and they'll be opening up the balance of their elective surgery sites next week. In Maryland, another area that we're watching very closely, Governor Larry Hogan expressed appreciation for federal support as he's continuing to scale testing. He had been in touch with the National Institute of Health, which is opening up its laboratories for Maryland to do testing, and we were also able to confirm to him that Walter Reed Hospital's laboratory capacity is available to Maryland. And in Utah, Mr. President, Governor Gary Herbert told us that he actually diverted 1,200 state employees to do contact tracing in their state. In the last 36 hours, 23,000 residents have also signed up for what they're calling their Healthy Together app. And they have 50 different testing locations across Utah and have tested 82,000 people in the state already. Other state examples, Mr. President, were just as inspiring. Governor Phil Murphy of New Jersey has forged a partnership with Rutgers University, working closely with the FDA. They've authorized a saliva-based test that is being deployed just at that site, that's expanding their ability to track what continues to be a very challenging environment in New Jersey. And Governor Mike Parsons of Missouri, Mr. President, also told us how they'd worked with Google Marketplace to create an online portal for more than 200 companies in Missouri who have repurposed their manufacturing lines to create medical supplies to meet their need within the state. And in Connecticut, Governor Ned Lamont spoke about positive trend lines in Connecticut, which has been really at the center of the outbreak in the greater New York area. But he also said they were hoping to double testing over the next week. Mr. President, that's just a sampling of what we heard today. And I know it's an encouragement to you, and I trust it's an encouragement to people all across the country, that at your direction we are implementing a testing strategy that is supported at the federal level, but it is deployed and managed at the state level. And we want to express our appreciation to every governor across the country that are standing up all of those labs that are available, that are working with us and our supply chain personnel to make sure that the reagents and the swabs and the equipment is there to be able to process the tests. And we're going to continue to increase testing dramatically in the weeks ahead. So we want to thank our governors for the progress that we're making on testing and for their role in urging their citizens to practice the kind of mitigation and social distancing efforts that are really making real progress. We're one team, one mission, that's to save lives. And because of all the efforts that have been made at the state level, and the strong guidance that's come from the federal level, because of the amazing healthcare workers across this country and our first responders, but mostly, I believe, because of the cooperation of millions of Americans who've put the guidance into practice. Their cooperation and their prayers have set us on a path where we are slowing the spread, we are protecting our most vulnerable. And I truly do believe the day will soon come when we will heal our land and we'll be able to reopen America and put this great nation back to work. Thank you, Mr. President.
Thank you very much. Mr. President?
Mr. President, is now the time for sarcasm?
Yep, I got you. All right.
And that's going to do it for the president and the task force team. Now, just a reminder, we are going to be clipping this on our YouTube side, but that FDA Commissioner, Dr. Stephen Hahn, said there are 72 ongoing trials for therapeutics to treat coronavirus, but so far none of those therapies have been approved. Here's a live look at those numbers again here in the United States. We do have more than 50,000 deaths here being reported and more than 889,000 cases across our states. But we continue to do more testing, and as you may heard from many governors across the states, they have also been doing a lot of still keeping those restrictions until that May timeframe. Many states starting to also, maybe on Monday, this was one I heard from Minnesota, since my family's there, they are going to be opening up some businesses that don't have interaction with customers, but they're going to allow them to be reopening on Monday. All right, what we're going to do next is play another story here for you. We've been getting a lot sent in from all of our sister stations. This one coming from the Seattle area, KCPQ. Now, they had a special interview with the Seahawks psychologist on coping with coronavirus. And so we're going to listen into that interview. Thank you again for being here with us on News Now.
You know, this is kind of an unprecedented time for athletes specifically, for high performance athletes, especially because they don't know when they're going to be going back out onto their respective fields. What would your message be to anybody that you were working with in terms of how to stay mentally prepared and in it on a regular basis?
Athletes and coaches on the world stage are highly skilled at uncertainty. They practice it more than most people. So they live a life that is high in passion and high in dedication to their craft, and they wrap their life around the mission that they're on. So in respect to how most of us are managing this time, it's a fundamentally different experience for them because they're good at managing uncertainty. They know that to manage uncertainty well, one, they love it, they look forward to it, they design their life around it, and two, they practice and they refine their skills, technical skills, mental skills, and physical skills, so that then when they get tested with moments of uncertainty, they can adjust eloquently. That being said, is that nobody is looking forward to not being able to do the thing that you love being able to do. And so the crisp advice is just a note that elite athletes are better at uncertainty than most people because they practice at it. And two is keep the sword sharp, stay on it, stay connected to all the areas in your life that you want to get better at. Write a plan for those and back up against it.
You're basically talking about two tiers. You're talking about the elite athlete, and then now you're talking about your ordinary Joe that is probably dealing with a lot. And I want to go both arenas, but let's kind of go the ordinary Joe route, in that a lot of people are dealing with stress and anxiety right now in many different shapes and forms. What would your advice be for them?
We are in war, and we're in war with an invisible virus, right? An invisible adversary. And the war is being fought on two fronts. The first is the front line and the battlefront. That space is where our medical providers and our first line folks are working to save us, right? The second is it's fought on the home front. And the home front is our internal home, our body. That is radical. And so how are we going to do that? Well, we need to bolster our immune systems. We need to make sure that we're recovering properly. And so in these moments of uncertainty, the key element is to recognize that the war will be met at one's immune system. And particular ways of thinking are more expensive. They're more costly to our immune system than other ways. Frustration, anxiety, worry, a relentless trying to solve something that feels unsolvable. Those are all expensive ways of using our attention. On the other hand, being clear about what's in one's control, having a clear plan to execute against, and thinking about what is good in this moment, even though that it feels like the sky is falling, like what is working right now that you can adjust with and pivot with and hopefully make something better come from it.
It's interesting. It's a great way of looking at it. It's also hard to tell that to somebody who is staying up at night and worrying constantly. I mean, is it hard have you noticed with certain people, it's hard to reprogram their way of thinking in that respect?
Changing thought patterns is a full-time job. So right now, what's happening for us is that we're learning about our ability or inability to manage uncertainty. And if you would have asked me 6 weeks ago, what is the number one challenge for people living,
All right, guys, as much as I wanted to check into this interview, I do see that we do have our Kentucky governor getting started for his briefing. So let's jump on over to that. This is live, which we always like to go to right here on News Now. So once again, Kentucky giving their COVID-19 update.
Very healthy. And before any comments that have recently been in the news, we have seen more calls to our poison control hotline. Remember, especially parents with young children, you're disinfecting now, and you should be more than ever before, but you got to be really careful with your kids. You got to be really careful with those cleaners. You got to keep them away from surfaces right after you've cleaned. I know that's asking a lot. You may be working from home. You may be doing NTI with your kids. I mean, there's so much that piles up, but make sure that you protect them to the full extent. What's the update at Ridgewood Terrace facility in Hopkins County? 56 positive residents, 13 residents have passed away at that facility, and 16 positive staff. We have not lost any staff at that facility. What's being done to contain the outbreak in the facility? Along with the many steps taken at Ridgewood Terrace and other long-term care facilities, we have now tested the entire facility, everybody. Ridgewood asked CHFS for assistance. A response team, including registered nurses and volunteer medical students from UK's College of Medicine to support certified nursing assistants, has been deployed to the facility. And there's the last question: how helpful have the strike teams been that have gone to the facility? We helpful. We hope. It's very, and once this virus hits these facilities and it reacts even differently in different people, it can be devastating. We want to do everything we can to help. Sometimes it's going to have a better outcome than others, and it doesn't mean anybody has necessarily done anything wrong. This virus is contagious and it's deadly, and we got to remember that.
What is our current capacity in case of a spike and need for hospitalization?
The question is, what's our current capacity if we had a spike in terms of hospitalizations? We're actually at a pretty good place on that. You know, I lay awake at night and I worry about a lot of things. And one of the ones that kept me up most nights was, you know, the spike where you don't have enough beds and you lose more lives because of that. And that's something we worked very hard to prevent. We still have plans in place, but right now we don't see exceeding our hospital bed capacity in Kentucky. And remember, we have 2 field hospitals across Kentucky. We have hotel options we can turn on within a week, and we have state parks that have been activated too. So originally with our plans and how I had us scaling up, I was still trying to find 20,000 more beds. Right now, we don't see a scenario where we reach what we have in hospitals, but we can significantly expand it beyond that with our current planning capacity.
The Vice President is now saying that the virus or the pandemic could be behind us by as soon as Memorial Day. Are you seeing any data that leads you to believe that's the case?
Our pandemic, COVID-19, won't be behind us by Memorial Day. At best, we are in a new normal where it is out there. We're able to do many more things, but the way we do them is dramatically changed. I think it's really important for people to know we will reach something akin to an old normal once we have a vaccine or a very effective treatment. But our lives are just going to look very different until then. You know, when we're not just healthy at home, we'll be able to be healthy at work, which will be the next step. But guess what? After work, we're just healthy at home. We don't get to expand our contacts beyond going to work and coming back because we're still trying to limit those to keep down the spread of this disease. And then when we're able to do a little bit more, it's still not the same. And we need to get ready for masks. I'm going to talk about this a lot more. But we're going to reach a point real soon where everybody in public and everybody at work is going to need to be wearing a mask. Once we're able to move into phase 1 of healthy at work, our number of contacts really grows, and that's going to make masks incredibly important. So again, life's not going to look the same in the near future. That doesn't mean that we're not all living a good life and can't live a good life, and that we won't get there, because we will. There's actually some kind of promising news out there on the vaccine front. But my goal is to be transparent and to be honest and to make sure that we know what we're doing so we can be strong and resilient and address it. What's the state's burn rate on key PPE? How many days of supply does the state have? And how is it aiming to stockpile in the event of a second surge? So our burn rate isn't indicative of the burn rate that's out there. That's of hospitals and nursing homes. What they do if they're participating in the state program is they report to us every day. And when they are crucially low, that's when we distribute what we have. Right now, it's our hope that we could help just in critical shortages that we would see in the state for about a month. Maybe even less than that on where we are. It would depend on what the surge is. But that's one of the reasons that we're going to require our healthcare hospitals systems to stockpile enough, whether it's a week or 2 weeks worth of PPE, to prepare for that surge before they start doing certain procedures. It's something that we've been talking directly with them. I'll take one more.
Governor Cuomo again talked about Senator McConnell's comments about the blue state bailout. He insinuated that Kentucky gets more from federal pot money than it receives, while New York puts in more money than it receives, saying that where's our money back? Where do you stand on this? Do you stand with some Kentuckians who say, look, East Coast governors, West Coast governors are being too hard on Kentucky, or that the senator maybe walked into this by using the term blue state bailout?
The question is on kind of back and forth between Governor Cuomo of New York and Senator McConnell. And I think it's in response to some comments that the senator said about not being in favor, at least now, of aid coming directly to states and local governments, but in mentioning maybe we should consider filing for bankruptcy. Let me start by saying Senator McConnell and I have had a very good relationship, not just now, but when I was Attorney General. And to date in this crisis, we've worked very well together. He has been very responsive to my calls, and we've had some good conversations. But on this piece, I disagree with him, as does every other governor in the United States. This isn't a blue or a red state issue. It's that if in the next CARES Act, state and local governments don't get direct relief, our recession will last longer. We won't have the dollars we need for teachers and firefighters and police officers. The basic services that people need to survive will be cut. Listen, in 2008 and 9, just in the midst of a recession, not a worldwide health pandemic, direct aid was provided to states, and it helped us get through. Surely we should consider doing it now. I hope the senator thinks about that and hears us and ultimately helps us get it through, because it's not a disagreement I want to have with him. I want his help. He is the Senate Majority Leader. He could do a lot to help Kentucky by pushing that through. All right, we're going to end tonight on a positive and a creative note, which is important on a day where we've had so many cases, but we know that people are giving up opportunities that they would have otherwise had, and a lot of those are for our young people who would have graduation or prom. So we got a video from Nally Markham, a senior at Powell County High School. She had heard my call to find creative ways to celebrate those things that we can't do in person right now. And she wanted to find a way for her and her friends to still show off their prom dresses and have a little bit of fun and hopefully, just give a little bit of enthusiasm and encouragement to those out there who may be missing what's an important and a big moment. I'm proud of these seniors. I'm proud that in the midst of what we're facing, they are still so positive. I hope that we learn something from their resiliency, and that shows you that Powell County's educators are doing a great job, as are the parents of these young Kentuckians. Thank you all. See you tomorrow at 5.
Hey, Team Kentucky. I hope you all are. Hey, Team Kentucky. I hope you all are staying safe at home and understand that your actions are saving lives. But just because we have to make sacrifices doesn't mean we can't have a little fun. So here's Powell County's virtual prom.
Kind of a fun little update from Kentucky, as they said they wanted to end today on a high note, and there's been a lot of virtual proms. I know John Krasinski even threw one, and that's definitely one that I even liked to watch. So if you are one of those people who know a senior in high school, please reach out to them and let them know that we're thinking of them during this time. They did miss out on some important parts of this time of their lives. So unfortunately, it's just something we do have to deal with right now. All right, let's take things on out to Los Angeles County, listen to their latest on COVID-19 here on this Friday.
We need to ensure that we remember those that perished, the 1.5 million that perished in the Armenian genocide. As a result, every year the Los Angeles County Board of Supervisors declares April as Armenian History Month. Instead of skipping this commemoration altogether, the Armenian community launched a fundraiser to honor the lives lost in the genocide. They set a goal to provide 1.5 million meals to Americans in need. They far surpassed this benchmark. and have raised enough to buy 3.3 million meals. May we all find ways to give back to our communities that are meaningful and personal. I know in many other ways, this time has been marked by a loss of stability and routine. Our residents have made immeasurable sacrifices personally, emotionally, and financially. Every one of us is eager to ease safer at home restrictions so we can return to a normal life. I'm immensely proud of our residents for adhering to these guidelines so far, which has successfully prevented a huge surge in cases. I'm grateful for the opportunity to share that we are developing a plan to slowly ease restrictions under the condition of some important prerequisites. This will not happen all at once, but in stages when our public health experts deem it appropriate and safe. We don't want to undo all the good we've done and accomplished so far. We are not yet on the other side of this pandemic, and we don't want to prematurely ease restrictions that could overwhelm our hospitals and unnecessarily put lives at risk. We've set 4 key benchmarks that will have to be achieved before we can begin to lift sustain our ongoing needs. This includes adequate staffing, testing, ventilators, and other medical supplies to handle routine care and prepare for any increases. Second, we have to make sure we have protections for people who are especially vulnerable. These are people who have underlying health conditions, are elderly, are experiencing homelessness, live in institutional settings, or don't have access to services. This is the same. Third, we must have the capacity to test, isolate, and quarantine people and have surveillance to prevent further spread. Fourth, and finally, we have to maintain physical distancing and infection control. It will be the county's role to provide businesses with educational materials and guidance to make this possible and to enforce compliance. Ultimately, we want to make sure that as many people return to work as safely and as quickly as possible. If we meet the guidelines I shared, we can prevent or limit the spread of COVID-19 when we loosen physical distancing measures. Until then, I thank you for your patience and your compliance. Your commitment to your health and the well-being of your family and neighbors has gotten us this far. It is in this same dedication that will help us rebuild LA County stronger than before. Now with that, I'd like to introduce Dr. Barbara Ferrer, our Director of Public Health, who will give you the numbers for today. Thank you.
Good afternoon, everyone, and thank you so much, Supervisor Barger, and to the entire Board of Supervisors. I feel very fortunate to work under your leadership, Supervisor, and I know I've benefited enormously from your strength and from your vision. To update you on our current status, I'm sad to report an additional 52 deaths today from COVID-19. 43 of these people who died are over the age of 65. And 34 people over the age of 65 who passed away had underlying health conditions. 7 people who died are between the ages of 41 and 65, and all of these people had underlying health conditions. The one person who passed away who was between the ages of 18 and 40 also had underlying health conditions. We don't have this information for the one case that's being reported today by the city of Pasadena. This does bring the total number of deaths to 848 for the entire county. One death previously reported was found to be from another jurisdiction. 91% of all of the people who have died in LA County from COVID-19 did have underlying health conditions. This demonstrates the need for people who have serious health conditions to remain at home, avoid close contact with other people as much as is possible, and at the very first sign of illness, we ask that you contact your provider. If you don't have a healthcare provider, please call 211 and they can make sure that you're connected with a provider in your community. For the 771 people who have passed away, where we have information on their race and ethnicity, 15% who died were African American, 18% were Asian, 1% are Native Hawaiian and Pacific Islander, 37% are Latinx, 28% are white, and 1% identified with another race or ethnicity. To those of you who are grieving the loss of a loved one from COVID-19, we're really completely sorry for your loss, and we wish you and your family peace. We're reporting today 1,035 new cases, and this brings the total number of cases in LA County to 18,517. These cases include 518 cases that were reported by our partners in the city of Long Beach and 293 cases reported by the city of Pasadena. I'm also reporting 100 confirmed cases amongst people experiencing homelessness. This includes 55 people who were sheltered and now are appropriately isolated, and their close contacts are quarantined. The vast majority of people who tested positive who are sheltered were residing at the Union Rescue Mission, and we continue to work with the mission to both make sure that folks are isolating and quarantining, but also to conduct additional testing of both employees and guests. We are conducting an additional 7 investigations at shelters, and here we identify both residents and staff who need testing, isolation, and quarantine. 4,211 people who were positive for COVID-19 have at some point during their illness needed to be hospitalized. This is 23% of all positive cases. Currently, there's 1,858 people who are positive for COVID-19 that are in the hospital. 30% of these people are in the ICU, and 19% are on ventilators. These numbers have remained very stable over the last few weeks. So although we've seen an increase in the number of cases, the percent of people that needed to be hospitalized and the percent of people in the ICUs and using ventilators has remained fairly stable for the last few weeks. We're currently conducting 293 institutional, we're currently investigating 293 institutional settings where there's at least one confirmed case of COVID-19. This is 7 additional investigations since yesterday. These include nursing homes, assisted living facilities, shelters, treatment centers, supportive living, and correctional facilities. The total number of confirmed cases in institutional settings has now risen to 5,339 people. This includes 3,847 residents and 1,492 staff. The large increase in the number of residents is because we have done a lot of testing in our facilities, and because of the increased testing, we've been able to identify many asymptomatic residents and staff who are positive for COVID-19. I am sad to report that 365 residents who lived in these institutional settings died from COVID-19, and this now represents 43% of all of our deaths across LA County. The majority of people who passed away did reside in our skilled nursing facilities. As part of our ongoing efforts to ensure the safety of employees and residents at skilled nursing facilities, we are announcing today that Dr. Davis will be issuing a new health officer order for all licensed congregate healthcare facilities. The order includes measures intended to reduce the transmission of COVID-19 at these facilities and to protect vulnerable residents as well as all of the employees. The order will require facilities to limit the entry to the facilities to only those people who need to work at the facility. This means that non-essential visitors and workers cannot come into any of the congregate living facilities. It suspends all communal dining and communal activities to make sure that there's ample distancing among the residents who reside there. Staff will be required to always wear surgical masks and to use personal protective equipment when it's appropriate. And residents will also need to wear surgical masks or cloth face coverings when they're outside of their personal room. The facilities will be required to follow all of the recommended infection control guidelines, both from the federal government, the state government, and the local government here, our public health guidance. The facilities are also, and this is new, they are required to conduct COVID-19 testing for asymptomatic and symptomatic residents and staff, and they will be working with the Department of Public Health to determine the frequency of that testing. I want to mention that beginning on Monday, in coordination with LA City and with assistance from the Department of Health Services, we will begin this process to make sure that we're able to test all of the residents and staff that reside in our skilled nursing homes. As we start this testing, facilities with the most severe outbreaks will be prioritized, but we will in fact make sure that there's testing available in every single skilled nursing facility in the county of LA. I'm also reporting 115 confirmed cases at some point in time at our jail facilities. 47 were among people who are incarcerated and 69 were among staff. The Sheriff's Office is reporting that today in their facilities, there are 28 inmates who are positive, 19 people who are incarcerated that have recovered, and 92 people who are incarcerated that are in isolation. 2,240 people who are incarcerated in the jails are currently quarantined. There are 93 cases in the state prison. 77 are among people who are incarcerated, and 16 are among staff. And there are 85 cases in the federal prison facilities. 82 of these are among people who are incarcerated, and 3 are among staff. 11 staff working in our juvenile facilities have also tested positive for COVID-19. We do post every day information by facility that includes the number of positive and suspect cases, as well as now, hopefully starting today, the number of people who have died amongst the residents and the staff. And you can see an updated report of all of our LA County cases on the Department of Public Health's website at publichealth.lacounty.gov. The Los Angeles County Sheriff Department today is reporting 61 positive cases among staff. 295 staff are still quarantined, and 612 staff have returned to work. The LA County Fire Department will be updating their numbers later today. And I want to thank Sheriff Villanueva and Chief Osby for tracking and reporting this data. There's over 108,000 people who have been tested and had their results reported to LA County Public Health Department, and 15% of people tested for COVID-19 have been positive. And I want to continue to encourage people who have symptoms to please get tested, and to note that this test only takes a few minutes. The information is confidential. It'll be released only to you and to your provider if you've designated a provider. The tests only take a few minutes, and appointments are available at almost all of the regional testing sites. So you can find the testing sites and make an appointment online at covid19.lacounty.gov/testing. In closing, Ramadan has begun, and I want to wish a happy Ramadan to our Muslim friends and neighbors who are observing. This is a time when people want to be with their faith community, their friends, and their extended families. Because it's really important to continue to follow the safer at home order, this prohibits gatherings of any kind. So we're asking you to please observe this month with the people in your household and connect to your faith community, your friends, and your extended family from afar, online, by phone, and using all the other ways technology is allowing us to stay in touch. I wish all of you in LA County a safe weekend. Thank you so much for what you're doing to slow the spread of COVID-19. And now I'm going to introduce Kevin McGowan, the Director of Emergency Management.
Good afternoon. Thank you, Dr. Ferrer. Kevin McGowan, the Director of the Office of Emergency Management and also the county's Emergency Operations Center. I wanted to share a few remarks today about our cooling centers. So as warm weather continues to arrive in Los Angeles County and we transition into summertime, we know that there's at-risk populations who might not have access to air-conditioned environments, and they might need some. So the county, in conjunction with our city partners, have activated about 10 cooling centers that are spaced throughout our county to provide emergency assistance if people can't have access to cooling. The emergency cooling centers are currently in operation starting today at 12 and going till 6 p.m. tonight, and then also tomorrow from 12 to 6. And we'll continue to reassess the need for cooling centers in the future based on the weather conditions. Our cooling centers are operated utilizing social distancing and safety practices that would be important for this pandemic. Information related to the cooling centers can be found on ready.lacounty.gov. That's ready.lacounty.gov. Or you can go to any of our county websites and access the information that's needed to find the closest cooling center to your location. With that, Ryan, we're now ready for questions.
Okay, ladies and gentlemen, if you do wish to ask a question, please press 1, then 0. Our first question will come from the line of Brian Carter with the LA Daily News. Please go ahead. Your line is open.
Doctor, thank you very much. For Dr. Ferrer, I wonder if you had a breakdown by percentage of the underlying conditions most at play in the county's fatalities and hospitalizations. I asked kind of in the spirit of a national study that was out the other day in the New England Journal of Medicine. And do you have any concerns about how particularly younger adults with underlying conditions would sort of, I guess for lack of a better word, reintegrate into society once these measures are ended, and any corresponding concerns about sort of false senses of security? And forgive me for tagging this one on, but I did want to ask, did you request the National Guard assistance at nursing homes? And that's it. Thank you.
Okay, thanks. Let me start with the request for the National Guard. We didn't request the National Guard, but we requested help, and the National Guard was great. So we did ask the state, to help us with staffing. The easiest thing for them to do was to deploy the National Guard, and we're extraordinarily grateful that they did. And they continue to provide us with support at the skilled nursing facilities through other staff, as well as I believe the National Guard is here for the entire week. So I want to be very grateful for the support and the quick response. We put in a request one day, and the next day the National Guard were being deployed. I don't have a breakdown for the people who are hospitalized by their underlying health conditions, nor for the people who have unfortunately passed away in terms of what exactly was the underlying health condition. We do document a whole range of conditions that we consider based on the science that may in fact have a pretty significant impact on your ability to successfully fight this infection. We are doing a more detailed record review just as part of our surveillance projects. So we should be able to get more of that information out. And we do pay attention to the many research studies that are also out there documenting which underlying health conditions seem to really cause really be cause of alarm, because people with those underlying health conditions tend to be at higher risk for serious disease. I do love your question about what should we be doing and what kind of advice should we be giving younger people who have underlying health conditions. I'm sure you've noticed that almost every day for the last 2 weeks, included in the number of people who have died that I've been reporting on, are people who are between the ages of 18 and 40. And these are, in fact, almost always people, not every single case, but almost always young people who do have underlying health conditions. And I also want to note that there's been a lot of discussion in the literature around young people with no underlying health conditions who have, in fact, shown up with blood clots and maybe even strokes. So I want to remind everyone, this disease causes a lot of damage. It's particularly harmful for those people who do have underlying health conditions at whatever age. but it also still causes severe illness and death among people with no underlying health conditions. And because it's so easily transmitted when people are in close contact with each other, I urge everybody who has a loved one or knows a friend or a family who has underlying health conditions to make sure we're doing everything we can to help people with underlying health conditions stay safe at home, not have to go out for shopping, not have to go out to get the essentials that they need to stay safe at home. And then I urge every person, if you are that person with an underlying health condition, such as asthma, such as any kind of pulmonary diseases, you need to be mindful that even if you're feeling well and your disease is under control, you are at high risk should you be infected for having serious disease. And we're going to ask you to take special care, stay home, stay away from as many people as you can. Even in your household, you should be isolating wherever possible from others by keeping your distance, because we don't want you to end up with serious illness, and we'd like to do everything we can to support you so that you stay healthy. I'll take the next question.
That question comes from the line of Alex Wigglesworth with LA Times. Please go ahead.
Go ahead.
Possibly you have your phone on mute.
Sorry about that. You already talked about this a little bit, but I was wondering if you were able to say how many nursing homes you requested the state to assist with, and where they're located, and was it primarily assistance for staffing needs, or was it help with testing or contact tracing as well?
Yeah, thank you. That's a great question. We requested assistance, and the National Guard were deployed at 4 different skilled nursing facilities. I don't know their names or their locations, but it was, in all 4 cases, it was around staffing. As we've identified staff that are sick and or staff that are positive with COVID-19, they need to stay out of the workplace for an extended period of time. And in places where there are outbreaks, that can often mean that there are dozens of employees that appropriately are not coming into work. So we do have staffing issues in all of the nursing homes where we've had significant outbreaks. But thanks for your question. We'll take the next question.
That comes from the line of Jackie Fortier, KPCC. Please go ahead.
Yeah, Dr. Ferrer, if you could please expound a little bit on what this asymptomatic testing will look like in nursing homes. I mean, how that's actually going to be facilitated.
Sure, thanks a lot. And I appreciate the question, and I also appreciate the fact that we've really changed our guidance. We used to just recommend, even in places where we were noticing that there were outbreak situations, that it was symptomatic people that needed to be tested, and it was people with symptoms that we needed to make sure they weren't coming into the facilities. With all of the recent both literature and even our experience here in LA County as we've expanded our capacity to test, it's become really clear that asymptomatic people are in fact both infected with the virus and capable of shedding the virus, and that means they're capable of infecting others. So in places where we have a lot of vulnerable people who reside, and that's our nursing homes, all of our long-term care facilities, it's really important to acknowledge sort of this new reality. And that means that we have to do testing at those sites of all of the people who are residing in those facilities and all of the people who are working in those facilities. And to date, what that's shown us is that there's a fair number of asymptomatic people at the facilities, both among residents and among the employees, who are testing positive for COVID-19. So where we have people that are now asymptomatic and positive for COVID-19, they still need to be isolated, and all of the close contacts need to be quarantined. And that's why, in fact, you've seen our numbers jump in terms of the number of positive cases at the facilities, because we are doing a lot more testing. And we will continue over the next couple of weeks to make sure that we're testing at every single site, and we're testing everybody who's there, all of the employees and all of the residents. We'll take the next question.
That comes from the line of Joel Grover, NBC. Please go ahead.
Yes, Doctor, could you just briefly address restaurants in LA County? I believe you said on Tuesday the county would soon start disclosing the names of restaurants that have had coronavirus outbreaks. When will you start disclosing those establishments? And do you believe there's any risk to the public eating takeout food, possibly prepared by someone infected with the virus?
Both really good questions. Let me start with the posting of information about the restaurants. So, yes, we're trying to work on a well-informed way for us to actually post outbreaks. And so, an outbreak is 5 or more employees at a restaurant that have tested positive for COVID-19. I want to note a couple of caveats here. One is just because there are employees that test positive in a workplace, as I've said before, doesn't mean that they in fact acquired the infection at the workplace. So one reason why we're going with the threshold of 5 or more, which is our outbreak, it's our outbreak definition in workplaces, is because we want to acknowledge that there's oftentimes, particularly now where this infection is so widespread across all places in the county, it's not always clear that, in fact, the outbreak site, the place where the transmission happened, was at the restaurant. There is not a lot of information that's known about the impact of being infected and preparing food. But you will note in our guidance from the very beginning, if you're known to be positive for COVID-19, we are very clear that you should not be preparing or serving food. And we want to continue with that message, which is why it's so important now that we know that there are asymptomatic people who could be positive, to make sure that, again, in places where there are essential workers, we're going to be able to, those employers are going to be able to help those employees get testing in a situation where you know you have positive cases already in your restaurant. In terms of, how safe do I think takeout is, I've said from the very beginning, I think it's very safe. I think the reason I say that is there's still all of our guidelines around, they're not really guidelines, they're directives around safety and food preparation, and those are still in effect. Just because it's takeout doesn't mean that there's been any ability for any of the restaurants or food processing plants or food preparing sites to not implement fully all of the infection control processes that are in place. So I do think it's safe. I think people can continue to safely pick up and take out from your favorite restaurants. We will be working again with all of the restaurants around making sure that they continue to implement all of the infection control processes, which when they're done well, do protect all of us, what we call, they're like universal precautions, and they protect all of us from the transmittal of other kinds of infections as well as COVID-19. But we'll take the next question.
That comes from the line of Annabelle Munoz, ABC 7. Please go ahead.
Hi, thanks for taking my question. The first one is regarding the new health order that you mentioned, Dr. Ferrer. Does that also apply to any sort of detention centers, jails, prisons? And then my second question is regarding a statement made by the president about the possibility of injecting disinfectant as it relates to COVID-19. He since said that he was being sarcastic, but it has prompted disinfectant manufacturers to issue warnings against this. So has the county received any increase in questions about this, and what is your message to residents?
Yeah, thank you so much, especially for bringing up sort of some misinformation that was circulating yesterday. Please don't inject, ingest, or even put on your body any disinfectants that you're using for cleaning purposes. It's completely inappropriate, and it's extraordinarily dangerous. That's not what those products are meant for, and there's absolutely no scientific evidence that indicates that they would either be safe or that they can help prevent you from becoming infected, or if you are infected, they're not a therapeutic medicine to help you get better. So I'm so grateful for all of the disinfectant companies for making sure that they also put out that message. People die from ingesting some of these products. So I really hope everyone understands if the president was being sarcastic, it doesn't really matter. The most important thing right now is that people have good information that they really shouldn't use those products for anything except for cleaning. And even now, you're going to read both on our websites and on other people's websites to be careful when you're cleaning that you don't inadvertently mix some products that really can't be safely mixed as you're doing your cleaning. Some of these products are harsh and they're extraordinarily dangerous. So thank you for bringing that up. And yes, we do want to make sure that the public understands that that information wasn't accurate, and please don't act on it. And your first question was, oh yeah, does the health officer, no, the health officer order really applies only to what we call long-term care facilities. I do want to note that we work very closely with the jails, with the sheriff's office, and with the Department of Health Services to make sure that there are similar controls in place in those settings to make them as safe as possible. That's particularly around infection control, quarantine, and isolation. But the health officer order is for long-term care facilities. So thanks for that question. We'll take the next question.
That comes from the line of Claudia Pashuta, KNS News Radio. Please go ahead.
Hi, thank you. I have a few questions. Will the order mandating testing be expanded to shelters? Also, on the new confirmed cases, do you know how much of that is backlog and how much is actual new cases being reported today? Will we be getting an update on the healthcare worker numbers? And any thought to expanding the testing for asymptomatic people to in-home supportive services workers and other caregivers working with high-risk people in their homes? Thank you.
Thanks, Claudia. I'm going to let Dr. Galley answer the questions about the testing for other workers. The question about, I'll start with, I think the first question. Let me just make sure I have it down. Can I? Sorry.
Expand the shelters. Oh, yeah.
So we are starting, I mean, there's over 350 skilled nursing homes in LA County. And that's our main focus right now. And I'll say why it's our main focus. It's because, as you note, 40% of our deaths are from people who are dying, who are residents in the skilled nursing facilities. So we've got to get out there, and we've got to get out there quickly and make sure we're doing everything we can to create a safe situation for both employees and for residents. There are some sites, and I think Dr. Galley could talk to this as well, some of the larger shelters where we've already been doing some testing, but it's not covered under this order. So I just want to be clear, this order, again, is for long-term care facilities, and that's a major focus because of the fact that we have a lot of outbreaks. As you note, you can see in our list of facilities where we're doing investigations. An update on the healthcare workers, that will come on Monday. So we try to do that every Monday. And then in terms of the new cases, those are really primarily all new cases. You know, as I noted yesterday, every day we have a few sort of backlog lab reports that come in, but we're at about 1,000 new cases being reported as positive every day. And as I noted before, once we increased our capacity to test, that was a number that I thought we would be at, and I would say that's the number we're at now. So in general, most of the week we will be reporting, I think, 1,000 new cases, and that's not because of the backlog. But thanks a lot, and I'll have Dr. Galley come up on the testing question.
Hi, thanks for the question on testing. While the current health officer order doesn't extend to the populations that were specifically mentioned, who are in correctional environments or who are homeless, this is absolutely going to be a core part of the strategy moving forward. So Obviously, the first priority is making sure that all people who are symptomatic get tested. After that, we absolutely need to work through in a prioritized fashion the strategy for priority populations, and then importantly, the operational rollout of how asymptomatic populations would get systematically screened through a testing environment so that they can know if they've been exposed or have asymptomatic COVID-19 infection. And we're actively doing that. We're grateful. There was a motion that was posted on the agenda a couple of days ago led by Supervisor Hahn and co-sponsored by Supervisor Kuehl to report back on a strategy for skilled nursing facility testing as well as testing among the homeless populations, and we're grateful to the board for their leadership as always on those motions. In terms of the vulnerable populations, the first priority has to be the skilled nursing facilities. That's where the majority of the outbreaks have occurred, and sadly that's where the majority of the deaths have occurred, and we need to make sure that there are adequate testing capacity that is in place at those institutional settings, and that includes both obviously for the outbreak as well as an asymptomatic screening approach. When you turn to the correctional environments, it's also equally important. Department of Health Services runs correctional health services in the LA County jails, and we are actively making sure that we have testing capacity in place so that individuals are either screened upon entry or that they're tested in a timely manner if they're in quarantine or isolation based on guidance from the CDC as well as other public health departments. And then we're also actively working on that prioritization among the homeless population. The first priority in that regard will be outbreaks in shelter settings or settings where there's a large number of individuals that are in a congregate living scenario. And so we need to make sure not only are the people who are symptomatic tested, but similar to the skilled nursing facilities, that there's a strategy and critically the operations in place to test all of the people who are in that setting, whether it's staff or residents. And then there's a variety of subpopulations after that first tier in terms of outreach to encampments, outreach in other settings besides those high volume outbreak shelters. And we'll be reporting out on that in the near future. We'll take one more question.
We'll take one more question.
Okay, that will come from the line of Dave Lopez, Channel 2 News. Please go ahead.
Hey, Dave.
Yes, good afternoon, all of you. Doctor, 3 quick questions. Has the nursing homes become, for lack of a better phrase, ground zero in this fight? If the numbers stay the way they have, regards to deaths and the number of new cases for the next 3 weeks, can we see some easing of the restrictions? And the final question is, how concerned are you this weekend? I mean, the sun is shining, it's hot, it's almost like a magnet telling people, come on, let's go out and have fun.
Thanks, Dave. Let's start with it's hot, and I don't want to stay inside anymore because I think we're all there. And it's, this is what we live, why we live here in Southern California, because we have such beautiful weather. So please feel free to go outside. You can go to your yard, you can go on your sidewalk, you could take a walk around your block or around your neighborhood. Enjoy the sunshine, use sunscreen. It's extraordinarily hot today, so make sure you're wearing a hat and you're well hydrated. But we do want to let people know that it's fine to go outside right near your house or at your house. It's not fine to go and drive to another county because you think that county has relaxed some of their restrictions and you're going to be able to do things there that you can't do here. We have asked you to please not do that. We don't need you to go out, get infected in another county, and then bring your infected self back here to LA County. And those other counties really are opening, and loosening their restrictions just for their residents and really couldn't afford to be overwhelmed by travelers coming in as well. So we're going to ask you to please not do that. But do get outside if you have a yard. I hope you can sit out there early in the morning or later in the evening. And again, I ask everybody, because it's hot, take care of people who are older, take care of people who are young, very small infants. Make sure that they're not getting overheated. And the last thing I want to say about the good weather is please do not leave either pets or people inside cars at all. during the hot weather, not even for a couple of minutes. It's extraordinarily dangerous. And if you witness anybody or any animals being left in cars, please call 911 immediately. In terms of our numbers, you know, we will be using, obviously, the number of new cases, what we see happening around hospitalizations, and what we see happening around deaths to help inform a decision about safely being able to go ahead and ease some restrictions and enter into recovery. We're now planning for recovery because we know we're getting closer. But so you're right, if we don't see serious spikes and we actually start seeing declines, which is what we're really looking for in the number of cases, but most importantly in what's happening in our hospitals and what's happening in terms of people dying, we'll feel a lot more secure that we can go ahead and slowly start implementing our recovery plans. And we're as hopeful as all of you that that day is coming relatively soon, but it's not today. You hear me, I reported a lot of deaths again today. As a reminder, COVID-19 is now the leading cause of death here in LA County. So we ask that you still work with us, that you stay safe, and to do that, you stay at home as much as possible. And then the first question was around our nursing homes and is this ground zero? You know, I don't know where ground zero is, but I do know that we have a tremendous concern with making sure that our nursing homes are safe. Most of the people who reside in our nursing homes need to be there for the excellent care that they're receiving, and they're unable to live independently. And the workers who work there every day are doing everything they can to give loving and skilled care to the residents. We just need to step up our game as the science has changed around the fact that we now know there's asymptomatic transmission. So I want to say we all have to do a better job, we all being on our side, of supporting both residents and employees at our nursing homes so that those can be the safe places they need to be. And that's going to depend a lot on our ability to do a lot more testing, which I want to thank Dr. Galley for her leadership. I want to thank the city for partnering with us on this. You know, that will start as an aggressive ability to start testing. We already started testing today, but this will be rolled out over the next week or two, and we will get to every single skilled nursing home facility, and we will do our very best to make sure that these are places of comfort and care for those that need that service. And now we're going to move to remarks in Spanish.
Good afternoon or evening, everyone, depending on where you are watching us from. My name is Pilar Arias. This is News Now, live streaming on YouTube, on fox10phoenix.com, and on coronavirusnow.com. Regardless of where you are watching us or how you are watching us, thank you so much. Happy Friday. I hope you are enjoying it. Those of us still working, whether at home or actually at the workplace, we made it. The weekend is here. Those of you needing help due to being laid off, furloughed, and the like, because of coronavirus times, hopefully you are able to get the resources that you need. That is why we are here. That is why we are streaming on YouTube for much of the day and on coronavirusnow.com 24/7. We want to provide you with the information, the resources, the facts, the things that you need to know to get the help for yourself and your family members and your other loved ones as well, your friends included, your neighbors, everyone in your world. Again, this is Times Square in New York City on a Friday evening. It's 4 o'clock here in Phoenix, Arizona, which means it's 7 o'clock there. They have not moved the tables and chairs. I believe it's mostly tables there in the middle of Times Square, right by those steps that say I Heart NY. I love New York, the iconic symbol. I have a t-shirt that says I love New York on it. It's one of my favorites for sure. But yes, a much different scene for the last several weeks now, pretty much the last month, ever since stay-at-home orders have been in effect. And we all know that New York City hardest hit with coronavirus. Matter of fact, I'm looking at the latest numbers from Johns Hopkins University, and it's saying of the 51,000 deaths here in the U.S., 16,646 of them alone right there in New York City. Absolutely, positively devastating for sure. Coming up here in just a moment, everyone, I'm going to take you out to New Jersey, where they had an update today, not too far away from New York. But again, happy Friday evening, everyone, and thank you for being here.
Good afternoon, everybody. Thank you for your patience, both in allowing us to move this to 3 o'clock today due to the White House VTC, which we'll come back to in a few minutes. But today, I think a lot of good content. I think Judy and Pat would agree with me, but it ran a little bit long. So we apologize for the fact we're a little bit behind. I'm honored to be joined by the woman to my right, who needs no introduction, the Commissioner of Department of Health, Judy Persichilli. To her right, another guy who's increasingly in need of no introduction, Communicable Disease Service Medical Director in the Department of Health, Dr. Ed Lifshitz. Judy and Ed, great to have you both. And the guy to my left who definitely doesn't need an introduction, State Police Superintendent Colonel Pat Callahan. Pat. We're also joined by Jared Maples, Director of the Department of Homeland Security and Preparedness, and soon by Chief Counsel Matt Placken. Let's begin with our daily update on the numbers and charts, and may these never just be numbers and charts. These are real lives we're talking about. First, today we're announcing an additional 3,047 positive test results, pushing our state total to 102,196. My monitor is out down here, Mahan. If somebody could get it plugged in would be great. But even as we cross 100,000, we must keep in mind that there are tens of thousands of New Jerseyans who had tested positive over the past 7 weeks and who have beaten COVID-19. Judy and Ed would agree with that. And sadly, we must report with the heaviest of hearts, 253 additional lives lost, meaning that we have now lost a total of 5,617 of our blessed residents to COVID-19 related complications. Bless their hearts. As we look at the curve of COVID-19 cases, it's still flat. And again, these are positive tests. And as we have said, we could take some solace in this, in that the curve is flattening. And by the way, it's flattening. I think positivities are ballpark around the same, Judy. And I know that what is not the same is we started from nothing. This country was not remotely prepared for testing, and we're now into the 90s in terms of sites you can get tested. And we've tested, I think, the 4th highest amount of any state in America. But we all also know that that isn't the complete view of the denominator. Absent universal testing, and Ed will correct the record if he sees that differently, we do not know the denominator, but that is gratifying, given the alternatives. And look at the curve as it was a month or so ago. However, the map that we've been showing you, okay, largely still good with our new color scheme. This map looks a little bit different than it did yesterday, and not in a good way. Several counties have slid backward, and if you could see, folks, the numbers in each county is the number of days it takes to double the infection universe in that county. And you've seen, unfortunately, a little bit backsliding. We cannot let that happen, folks. We cannot let that happen. Our most important weapon, the biggest weapon we have, you and me and all of us, is our ability to social distance, to stay at home, to stay away from each other. And by doing so, we crack the back not just of people who are infected, but we lower the hospitalizations, the ICUs, the ventilator use, and please God, the fatalities. I cannot be more clear or more plain. Everyone has a role to play in slowing the spread of COVID-19. We have to work together to lighten this map. We cannot ease up one bit on our social distancing. I am not in a position yet to begin fully putting our state on the road back. We need to see more progress and more slowing before we can begin those considerations. Please. And thank you. You've done an extraordinary job so far. Don't take your foot off the gas, please. In our healthcare system, as of 10:30 last night, there were 6,847 residents hospitalized for COVID-19. This is a decrease, Judy, from what we've been seeing, and I know you're going to get into this in more detail. Our field medical stations reported 98 patients. There were 1,933 patients in either critical or intensive care. That's about virtually unchanged, I think. And notably, ventilator use had a considerable one-day drop to 1,487 currently in use. Okay, you all can see how that chart works. And again, the numbers at the top, 1933, are folks in critical care, and 1,487 are the number of folks who are on ventilators. We saw 385 new hospitalizations yesterday, and this chart shows how we've seen ups and downs over the past few days, but the 3-day average trend line is generally moving in the right direction, which is down. And for the 24 hours preceding 10 p.m. last night, our hospitals reported 778 total discharges. Notably, if you look at the 3-day average, we see discharges exceeding admittances. And again, the yellow line are the folks who are leaving, and the orange line are the folks who are arriving. And the yellow line being meaningfully above the orange line is what we're hoping for. Sadly, of course, we know that there are those who are not being reunited with their families on the other end of COVID-19. The toll of this disease, in terms of the loss of life, remains staggering to all of us. So as we have been doing, I'd like to remember a few more of our neighbors who we have lost, and let none of us ever think of those we have lost as mere numbers on a graph. They were real lives, and they leave behind real families. First up, here is on the left, Jerry Genuino. For the past 2 decades, he served the families and children of Fairlawn, starting as a custodian at the Warren Point Elementary School before becoming a well-known and beloved bus driver. If you need to know anything about Jerry's commitment to the community, consider this story. And I told his widow this morning that I remember this story from last fall. One day last October, he was driving a group of students back to school from a field trip. On Route 208 in Wyckoff, he saw a truck that had caught fire. Jerry calmly pulled his bus over, extinguished the fire, got back in. By the way, the police hadn't even arrived yet, and proceeded to get his students back to school safely and on time. You talk about cool under pressure. Jerry was a star, God bless him. He leaves behind his wife, Mary Jane, with whom I spoke this morning, 2 daughters, blessed daughters, and a community that loved him. God bless you, Jerry. This is God love him, and that includes yours truly and legislative leaders and others in the background. I see the Attorney General there, Lieutenant Governor. This is Christian Aviles. He was only a senior at William Patterson University, where he was a mainstay on the dean's list. He was set to receive dual degrees in sociology and communications. He had a deep interest in public service and had interned for both State Senator Nellie Poe, and Nellie and I had an exchange this morning on Christian, and AFT Local 1796 President Susanna Tardy. He was also a talented artist and even had his work displayed, I think, courtesy of Congressman Bill Pascrell, in the U.S. Capitol. He was a very bright light that has been extinguished far, far too early. In his honor and memory, William Patterson University President Richard Heldobler has already announced his intention to have Christian's name added to the student memorial tree on campus. Christian leaves behind his mother, Anna, with whom I had the honor of speaking this morning, and his 2 siblings, Edwin and Angel. May God bless them all, and may God bless and watch over Christian. And finally, I wish to recognize James Jimmy Barbiera, the brother of one of my dear friends, the mayor of Paramus, Rich LaBarbiera. That's one of the reasons we should remember Jimmy, but certainly not the only one. We should remember him because he embodies the values of our New Jersey family: humor, decency, and love of family. His brother Rich called him simply the salt of the earth. Jimmy leaves behind his wife, Ula, again with whom I spoke this morning, and you can only imagine she is struggling, and his 2 sons, Johnny and Michael. In addition to his brother Rich, he's mourned by his brothers Peter and Anthony and sister Maria, among many nieces and nephews. Our prayers are with the entire LaBarbiera family, and Jimmy joins his mom and dad in heaven. God bless them all. 3 more treasured members of our New Jersey family gone. Let us use their memories to find the strength that we need to win this war against COVID-19. For them, we need to continue our social distancing and protecting ourselves and others when we do go out. We have lost more New Jerseyans to COVID-19 than we have in some of our nation's wars, and more than we lost on 9/11. And by the way, we remember every one of them with great reverence and prayerfully. And now we have thousands more for whom we will remember and pray for. Let's include every single person we have lost in the annals of our state's history. They cannot and will not be forgotten. For them, we will move forward, and we will come out of this unequivocally stronger than ever before. God bless them all. Switching gears, if I may. Number one, I had a very productive call this morning with Secretary of the Treasury, Steve Mnuchin, and that was a good call, and it was a good sort of beginning of a meeting of minds. As I've mentioned to you, we've got big money issues, and one of them is the first step of the interpretation of the CARES Act that was signed, I think, 4 weeks ago today. We have to make sure that we get what's rightfully ours. And I have mentioned to you the past couple of days that we had gotten assurances, but we couldn't find our way through from those assurances to the actual guidance that came out. And I want to give the Secretary a big shout out. We're not over the goal line yet, but we had a very productive call with senior members of each of our teams, and I thank him for that. And we will see where that comes out. But it was a very good step in the right direction, and I thank him for that. As I mentioned, Judy and Pat and I just came off of the video call with the White House led by Vice President Mike Pence. And I thought it was a good call, folks. I don't know about you all, but I would just a couple of highlights from our perspective. Lots going on with testing. You heard from Rutgers yesterday. Brian Strom was with us and I think presented that case extremely well. Again, another sense from our call today that Rutgers is not just a big deal for us, potentially testing-wise in New Jersey, but it is a national matter. Secondly, I thank the Army Corps, General Semonite, who was here earlier this week, who's a rock star, and his team, General Milhorn, Lieutenant Colonel Parks, gave them a much-deserved shout-out. And I brought money up. I have to bring up money in every conversation because we're running out of it. So not only was the call with Secretary Mnuchin a very helpful one, and God willing, that will be the first step toward a good resolution of the CARES Act, but I reiterated, as did several other governors, we need a big amount of direct cash assistance directly to states. And I thought the reception was a good one, but we have to be persistent and stay at this, because the choices, if we don't get it, are awful and almost beyond consideration. I echo again what I've said. Big shout out to Senator Bob Menendez for the bill, and he and Senator Cassidy from Louisiana, Republican by the way, have co-sponsored, which would envision $500 billion of direct cash assistance. That's exactly what the doctor ordered, and we will stay on top of that. Today we're announcing new measures to help our renters and homeowners feel more secure as we continue our battle against COVID-19. We recognize the anxiety that so many feel about looming mortgage and rent payments, especially with May 1st a week away. And I had a conversation, by the way, on this very topic this morning with another New Jersey icon, Steve Van Zandt. And I want to give Steve a shout out because he was expressing enormous concern about matters such as the ones that I'm going to refer to now. Throughout this emergency, we have been proactive in engaging stakeholder groups to seek solutions. We implemented prohibitions against anyone losing their homes to eviction or foreclosure. We have worked alongside mortgage lenders to implement a significant forbearance program. And we have worked through the Housing and Mortgage Finance Agency to protect 30,000 renters throughout the entire portfolio from rent increases. And we will continue to be proactive on housing relief. So today, first, I'm signing an executive order allowing renters to direct their landlords to use their security deposits to pay their rents, whether that be to make up for a shortfall or to pay it in full. Remember now, this is money that had been paid upfront to secure a lease, and during this emergency, renters should have the ability to tap this deposit to help them secure their place in their home. I wish to specifically acknowledge Assemblywoman Brittany Timberlake for her advocacy on this issue. Thank you, Brittany. Second, we understand too many renters are confused about their rights, and some landlords need more information on how to best adhere to the orders that we have previously put in place. Through the Department of Community Affairs, led by the extraordinary Lieutenant Governor Sheila Oliver, we are standing up a single online frequently asked question section. You can see it there in small type, and Mahan, maybe we can come back tomorrow and put this up in big Broadway lights, covid19.nj.gov/renter. So that's the new section, and that will be a point of reference for both tenants and landlords as to their rights and responsibilities. Everyone will have access to the same information, so there can be no more misunderstandings, and so everyone understands our expectations of them during this time. As we work on these issues, I wish to thank the New Jersey Apartment Association for their support and assistance, and for encouraging landlords to waive late fees in this emergency period. We are all in this together, tenants and landlords, and we can only emerge stronger when no one, and I mean no one, fears for their home or residence. For New Jerseyans fortunate enough to have the income to pay their rent or mortgage, please do so, as that allows us to best help those who cannot. And third, we are standing up an additional information page for homeowners taking advantage of our previously announced mortgage forbearance. And specifically, we want to make it perfectly clear to the lenders that as part of our mortgage forbearance agreement, that our expectation is for them to tack the forborne payments onto the end of the loan. Again, at the end of the loan, not at the end of the 90-day forbearance period. Again, that page is on covid19.nj.gov. We'll get you the specific name of that page post-haste. We recognize that federal rules allow for lenders to ask for skip payments up front, and we are pushing to have those rules changed, by the way. However, VA-backed mortgage loans are already having forborne payments moved to the end of the mortgage term, and this is the model that we should be pursuing for all homeowners. And as a reminder, if you are a landlord who has requested mortgage forbearance from your lender, we fully expect that you extend that relief to your tenants as well. Make sure there's some symmetry here. Thank you. On testing, I'll switch gears. We are now up to 95 locations across the state where residents can be tested for COVID-19. 30 publicly run or community-based testing sites can be found on our information hub at covid19.nj.gov and by scrolling down to the link for testing information. However, your primary care practitioner can direct you to one of the 65 other sites for testing. And as we noted yesterday, we are working diligently to continually expand testing across the state. We continue to press, as I mentioned earlier, our federal partners for the necessary waivers to open up testing for more individuals. We are working with great partners, Rutgers University in a big way, and our private labs to bring new testing systems and fast-tracked test processing into broad use. And again, to remind everyone, having a robust testing program in place is key for our ability to begin getting our economy back running. It's a very simple equation, and let me remind you if I can, public health creates economic health. It is in that order. Public health creates economic health. So the sooner that we have the testing that we need in place, the sooner we can give our residents the confidence that they will know to know that they will be safe once we begin down the road to that new normal. I want to say thank you to some friends, Angelo and Tina Koo, who are donating 1 million surgical masks today. They are en route, but we didn't want to sit on this news any longer. By the way, Tina and Angelo, I met independently when I lived in Hong Kong. Tina, who worked for me and with me, is a Homedale native. Angelo comes from a very successful and renowned business family in Taiwan, and then they met and have been married, I think, for 20 plus years. Our global community has stepped forward like never before to help us. And in this case, I thank not just Angelo and Tina, I thank the people of Taiwan for their continued support. The diversity of our state, and our nation for that matter, is one of our strongest assets. This is no time for folks to blame one group or another, especially our Asian brothers and sisters who have stepped up tremendously. And for those of you who follow geopolitics, I'm happy to say not only have folks in this country largely checked their partisan politics at the door to fight on behalf in this state of every single one of our residents, and in this country on every single one of our residents, but you don't normally get the likes of Taiwan and the PRC and Japan and South Korea and others, each to their credit, answering our calls for help. So I want to thank, again, I want to thank the Coups for their help here. Before I close, I'd like to give a few additional shout outs to some people across the state who have been doing great things in our communities. Over the past several days, I've reported on several young people who are really stepping up in their communities. So here's another young New Jerseyan who deserves our thanks. There he is. This is 14-year-old Josh Enberg. I got a son named Joshua. He's automatically in the Hall of Fame. Every Friday for the past 18 months, he has been volunteering with the Sparta Ecumenical Food Pantry, which serves over 3,000 families in Sussex County, up in your neck of the woods, Pat. Since many of the older volunteers who Josh works alongside have been taking rightfully and smartly extra precautions, the pantry has found itself shorthanded. But Josh has been stepping up his volunteering time to help fill the gaps. So to you, Josh, thank you for all you're doing to ensure that families who rely on the Sparta Ecumenical Food Pantry are being served. And I should note, and Pat knows this, that Josh's dad, Brian Enberg, is the State Search and Rescue Coordinator for the Office of Emergency Management and has been part of the team helping us build out our hospital capacity. So we thank not just Josh, but his dad and all the other folks out there stepping up in a big way. Speaking of which, here are 4 students from the LEAP Academy in Camden, a school I know well. Senior Joshua Ramos, Junior Alexandra San Vicente, sophomores Caterine Batista, and another sophomore and sister of Alexandra, Heidi San Vicente. They are part of LEAP's Fab Lab, and using the school's 3D printers, they're on a mission to create 1,000 face shields for our frontline healthcare workers. They're assembling the face shields at home using a kit developed by Fab Lab director Christopher McCrum and his colleagues Rafael Miranda and David Salas de la Cruz. They're already 150 face shields deep into their project, with 100 of those going to Cooper University Hospital and 50 to LEAP's own Community Health Center. And these students are going to keep going until the rest of their goal is met. So to everybody at the Fab Lab and to LEAP Academy founder, chair, and a dear friend of mine, Gloria Bonilla Santiago, New Jersey thanks you. And finally, I'd like to give a personal shout out to a team who none of you see, but without whose work these daily briefings would not happen. That's our tradition, production, and technology team, several of whom are behind the camera today. So here's my thanks to the team here at Trenton War Memorial, Bill Nutter, Mike Santoro, and Sidney Justice, and the folks from the Office of Information Technology, Jack Hensley, Sarah Casey, Roy Woods, Carol McKenna, and Chris Charkis. And to every one of you who continues doing what you're doing to halt the spread of COVID-19 so we can come out on the other side, bless you and thank you. But remember, this is no time for us to give up. Let's keep at it, and together we will win this. I mentioned, I think recently, my dad used to say, my late father, he used to say, remember, the Alpha and the Omega, the beginning and the end. And we got a beginning and an end to share with you before I turn things over to you, Judy, if that's all right. On the one hand, I'm proud to announce that our New Jersey family has grown. I received this picture from Kevin and Wendy Slavin. Kevin, of course, is the CEO of St. Joseph's Health and the chairman of the New Jersey Hospital Association, a good friend of Judy's. Here are Kevin and Wendy's son, Sean, and daughter-in-law, Emily, with our newest New Jerseyan, Rosemary Slavin. Everyone is safe and healthy, thank God. Welcome to our New Jersey family, young Rosemary. God bless you. But at the other end of the spectrum, and as I close, I must send my deepest condolences to a dear friend and a mentor of mine, our former governor, Tom Kean, who has lost his wife of 52 years, former First Lady Deborah Kean. As First Lady, Debbie Kean did not let the trappings of politics nor the pressure from the media change who she was. Throughout Governor Kean's administration and for all the years, frankly, before and since, she remained a quiet public presence, but was a strong private presence as a wife, mother, and lifelong friend. And even with all being governor entails, she remained focused on ensuring her husband did not forget that while he may have held our state's highest public office, his greatest responsibility was to his family. And that, in and of itself, is an extraordinary legacy. I had the honor of speaking to both Governor Kean and his son, Senator Tom Kean, earlier. God bless them both, and God bless Mrs. Kean's memory. So to the governor, to their children, Tom Jr., Alexandra, and Reed, and grandchildren, all of our thoughts and prayers are with you. God bless her and her memory, and each and every one of you. With that, please allow me to turn things over to the Commissioner of Health, a woman who needs no introduction. Please help me welcome Judy Persicelli.
Thank you, Governor, and good afternoon. Well, our hospitals are reporting 6,847 hospitalizations last night. That includes COVID-positive patients and persons under investigation. This is a 17% decrease from a high of 8,293 individuals hospitalized on April 14th. There are 1,933 individuals in critical care. That is a 6.6% decrease from a high of 2,069 on April 13th. The number of COVID-19 positive patients and persons under investigation on ventilators has decreased 12.8% from a high of 1,705 on April 14 to 1,487 last evening. 77% of the ICU patients are on ventilators. Although this is down significantly, on April 10th, 99% of these patients were on ventilators. As the governor has said, we need everyone to continue to adhere to social distancing measures to ensure that these hospitalization numbers continue to go in the right direction. Today, we're reporting 3,047 new cases for a total of over 102,000 cases in the state. And we continue to remove duplicate reports in the system. We continue to scrub the numbers and reconcile them not only with long-term care, reconciling them against the death certificates. So sometimes these numbers vary, but overall, we are still reporting significantly high numbers. Sadly, 253 new deaths have been reported to the department for a total of 5,617 fatalities. The breakdown of deaths by race and ethnicity are as follows: white, 53.5%, black, 20.1%, that is slightly down, and Asian, 5.3%, other, 4.9%. There are now 452 long-term care facilities in the state with COVID-19 cases. Our survey teams are continuing to inspect long-term care facilities. The team has conducted 30 inspections since last is 725. Of the 725, 244 residents have tested positive, and 91 veterans have passed away. Additionally, today, Cooper University, in collaboration with Cooper University Health System, we will complete testing of 16 long-term care facilities in the southern part of the state. In terms of lab reports, arriving to data from this morning, according to data from this morning, of the 7 labs that report to us, 185,329 individuals have been tested. 81,563 have tested positive, for a positivity rate of 44.1%. Earlier this week, I covered the importance of safely using cleaning products because of the increases in calls that we were getting at the Poison Center. As a reminder, follow the product's instructions closely. Wear disposable gloves to clean and disinfect. Use EPA-registered household disinfectants and ensure proper ventilation when cleaning. Keep these products away from children. And certainly, they should never be ingested or injected. When they're swallowed, many household products cause severe gastrointestinal symptoms. You may be repeatedly sick and even vomit. You may vomit blood. You may experience swelling of the tongue or lips or have burns to the esophagus. You may have abdominal pain and you may notice blood in your stools. Do not ingest or inject disinfectants. As always, I thank you for staying home, maintaining social distancing. Stay connected, stay safe, and stay healthy. Thank you.
Judy, thank you for that and for that reminder. And for all, just a quick follow-up. Counties in terms of positive tests remain the same group: Bergen, followed by Essex, Hudson, Union, Passaic, and Middlesex. Those continue to be the six with the most positives, and not surprising given that they're largely in that New York metro reality. Thank you for that and for all. Pat Callahan, anything on compliance, PPE, infrastructure, other matters? Thank you.
Sure. Thank you, Governor. Very briefly, overnight, Newark Police Department issued 83 EO violations and closed one business. In Clinton, 3 subjects were cited for playing golf on a closed golf course. In Elizabeth, 7 subjects were charged for congregating. They had been warned several times and continued to not socially distance and stay at a location. In another incident, a subject who failed to disperse threatened to shoot the police and was charged with terroristic threats as well as violating the EO. In Patterson, a barbershop owner was cited for remaining open. Also in Patterson, 5 subjects were cited who refused to disperse. And in Parsippany, a retail vape shop was open that did not sell other convenience store items that would allow them to stay open as essential, and that owner was subsequently cited as well. And just a good story that I think with regard to equipment, Governor, and ventilators. This morning before dawn, the commissioner reached out to me. She had heard directly from a respiratory therapist at a hospital that was in dire need of ventilators and specifically asked for non-invasive ventilators. The ones that you referenced yesterday, Governor, the 500, were both dual-purpose ventilators. So within a few hours, I was on the phone with that respiratory therapist, and shortly after that, 10 of those were delivered to that hospital. So I just pointed out as, one, the commissioner's accessibility. It's one thing to be accessible, but you have to act upon it, which I'm honored to be part of a team that is both accessible and able to act, because those are life-saving equipment, whether they be invasive or non-invasive. I deferred to the medical experts to tell us that, but it was good to be part of something that came together so quickly with such effectiveness. So thanks, Gov.
Thank you, Pat, and amen to that. Thank you, Judy, and thank you, Pat, both. We'll start over here with Brent. Before I do, just to say, tomorrow, unless Mahan tells me otherwise, we'll be here at 1 p.m. Tomorrow, right? So 1 o'clock tomorrow. Sunday, we will communicate electronically, or so-called on paper, unless there's a reason for us to get with you either in person or telephonically, in which case we'll let you know. And Monday is to be determined. We had a White House VTC today, which is unusual for Friday. I'm not sure if that replaced yesterday's or Monday's, so bear with us. Our preferred timing is 1 p.m., but those video calls are important and we need to be a part of them. And they're important for New Jersey. That's why we do it. So please bear with us on that. But at a minimum, 1 p.m. tomorrow. Thank you. Brent, you're up.
Good afternoon. There are far more many people with developmental and intellectual disabilities in group homes. Will they be tested too? 2, you put out a call for nursing home employees from other states or retirees to step up and help nursing homes here. Have they been deployed, and if so, how many? The state website says there are 141 patients with COVID-19 at psychiatric facilities, but 373 staff members, which is more than double. How is that possible? That seems weird. If one of the big reasons for the stay-at-home orders was to flatten the curve, does that mean it's time to begin lifting orders, albeit gingerly? And a new study shows more people hospitalized have underlying conditions much more than those who don't. What about just isolating them and letting others begin to reopen up?
Okay. A couple of things. Just on lifting orders, we're going to still on Monday discuss the broad principles of how we see, as I mentioned yesterday, how we see the sort of steps that we need to take in terms of the so-called reopening. I read a couple of quotes saying that we were refusing to think about it or talk about it, which is ridiculous. Here's what we're refusing. We're refusing to live. We had 253 people die today. We saw the heat map go the wrong direction. Positive tests are still going up. They're not plateauing or going down. Hospitalizations, that's good news. That is going down. Although Judy reminded me today, the ICU percentage of those hospitalizations is higher than we'd like. So we're not out of the woods yet. So with all due respect, Brent, this is not directed in agitation towards you. It's a fair question to ask. We're not there yet. We're not there yet. And I've got this does not benefit me or any of us personally to stand in the way if the facts suggest we should proceed. When the facts suggest we should proceed, we will proceed. I promise you. And by the way, we're spending an enormous amount of time, including gathering as many wise women and men we can in the state and perhaps beyond the state to give us the advice that we need, not just from a health standpoint in Judy's and Ed's side of the house, but from an economic development and reality standpoint. I think, Judy, these are largely, the group homes we addressed yesterday, I think, full frontally, but you may want to repeat that. That's obviously a major focus of ours, but in terms of both group homes, nursing homes, and also the anomaly I think you're pointing out in psychiatric hospitals between the number, as I understand your question, number of positives among patients with a much bigger number of positives among staff. And then the other question, Judy, is where's the underlying conditions reality stand now relative to where it may have stood recently?
We can start with the underlying conditions. I'm just looking for my sheet. But while I'm doing that, let's talk about what I call the vulnerable populations. We know we have 1,400 individuals in the psychiatric hospitals. We also know that some of the staff in the psychiatric hospitals move between hospitals, and we may be seeing some of the same phenomena as we've seen in the nursing homes. However, we have not done wide-scale testing in the psychiatric hospitals. It is considered a vulnerable population, and we do intend to do that. Same with the DD population. So that's 1,400 in psych. I think in their DD population, we have over 5,000. And I know that the Department of Human Services, in collaboration with Rutgers University, you heard from Dr. Strom, they are developing a plan that may be rolled out as early as next week to do wide-scale testing in the DD homes. And remember, long-term care, assisted living, probably about 75,000 individuals in New Jersey, over 100,000 individuals when you add in all types of group homes. But for long-term care and assisted living, it's probably around 70,000, and we will be laying out plans to, similar to the use case that we're doing in South Jersey, to test all residents and employees.
Judy, just for clarification, DD is developmentally disabled.
Yes, I'm sorry.
Folks, no, I just want to I meant to say this up front before I threw it to you. Rutgers was very explicit about this yesterday, right? Brian was very explicit about testing those homes, and I say the word homes because in some cases, as we mentioned yesterday, not in some cases, in all cases, these are their homes, and in some cases, for decades. So I just wanted to make that, add that point. You were going to hit underlying conditions?
Yeah, underlying conditions pretty much stayed the same. Cardiovascular disease, 58.4. Diabetes mellitus, 42.5. Other chronic diseases, 31.4. Chronic lung disease, asthma, emphysema, COPD, 19.5. Chronic renal, 15.6. Neurological disability, 15.5. Other category, 13.7, and cancer, 11%.
What do we miss there? Real quick, please.
Is it true that the majority of people who are hospitalized also have underlying conditions? And then there was the question about bringing other people in to help with nursing homes. Have they been deployed?
Yeah, depending what they're hospitalized for, it's not unusual for comorbid conditions. Would be something you would see every day. It's a matter of the extent.
And then the volunteer army, the matchmaking process is in fact happening, and
The
they are
matchmaking process goes on every day.
The Dolly Lee.
We are looking for people, individuals that want to work in long-term care. That's our biggest. That's our biggest push right now. And we have some ideas about different populations of individuals that might want to do that. So we'll be putting out a push next week.
Again, yet another push. I think it's covid19.nj.gov/volunteer, Mahan, right? That's the page. Mm-hmm. So we want folks to go there. Brent, I think if you, and we'll travel over here if we could, Matt. If you look at Judy and Ed, tell me if you disagree with this. If you look at elderly, if you look at folks with comorbidities, and you look at folks in long-term care facilities, those are the three big blows to our state overwhelmingly that we've taken. We saw Christian's picture, by the way, earlier, 22 years old. There are, unfortunately, folks, no one is immune from this. There are overwhelming exceptions, but I think it's fair to say those are the three big parts of our society that have been crushed. Please, Ian.
Governor, you said you are concerned about people of color and possibly Latinx people being overrepresented in COVID deaths in New Jersey. The Department of Health does not seem to have, or at least is not reporting, ethnic and racial data on the population tested. This is not required in the law you just signed, but shouldn't we just track this as well so we can make sure the testing system is not biased against these populations?
Is that it? In a perfect world, the answer is yes. I don't know that we've got, we're playing the hand we've been dealt. Ed, would you weigh in on that?
Sure. So when the doctor orders a test and the lab runs it, the lab can only report back the information they get from the doctor. When the doctor orders that test, they're not reporting what the patient's ethnicity or race or anything. They're just reporting the patient's name and that sort of stuff. When the lab then reports that data to us, particularly all those negative ones, we don't have that information because the lab never had that information. We don't have any way to tie a name together with anybody's race or ethnicity. A further investigation is done on those who are positive, and that's why we can pick up race and ethnicity on those, and we especially prioritize those who've had worse outcomes, such as deaths, which is why we know more about those sorts of people. But as far as knowing the total race and ethnicity of everybody who had a test ordered, that's just something that unfortunately is not possible.
So I like the, let me say this as a conceptual matter, I love the point. And so if you could somehow find that nirvana where you could scale up testing and have a rapid turnaround on the result and get that information, count me in. I just think it's going to be challenging. So let me ask Judy a quick question. Ed, thank you for that. I don't know that you've got it today. We know the profile, at least first cut of fatalities. You had at least a first cut, I think it was at hospitalizations the other day in terms of, do we have that updated since then or not?
I'm sure I have it. I don't have it today, but I'm sure I have it. But I do want to respond to testing. Part of our plan is to make sure that underserved populations have access to testing. So we'll be calling in the FQHCs. We're looking at mobile testing into urban neighborhoods. So you're absolutely correct. It is something we have to pay a lot of attention to, and we plan to do that. And when we put out our testing strategy, you will see that involved.
And the
question.
And the point I want to repeat, which I know you agree with, is that we do know, based on fatalities, that the African American community is 50% plus or minus more represented in fatalities than in the overall society. We've not seen that number yet, and again, I remain suspicious, and the number that Judy had mentioned the other day on hospitalizations was at least a beginning to square the circle with the New York City reality in terms of the Hispanic, the Latinx population. So something we're going to come back to as we get this more refined and more robust. By the way, it's one thing I think everyone has got at this point. It's not like testing will end sometime in May or June, and we got through this. Testing's going to be with us for a long time. So that's the bad news. The good news is we'll be able, over that long runway, to be able to make it much more robust and refine it. Elise, good afternoon.
Good afternoon. 2 questions. On rentals, your executive order allows the use of security deposits. Does that mean that landlords must accept security deposits, or are you simply encouraging the use of that? And secondly, have Operation Airbridge deliveries been a significant part of New Jersey's PPE supply?
I'm going to take the former with Matt Plotkin, and maybe Pat, you could take the latter. Is that okay with you? I think it's more in the category of encouraging, recommending, as opposed to mandating in terms of using the security deposit. Matt, would you correct the record or agree?
There's currently a statutory bar on using security deposits to cover rent, so this removes that statutory bar. It does prevent them, if they take it, if they accept a security deposit, from seeking another security deposit for at least 6 months after the end of the emergency or the end of the lease agreement, whichever is later. So that's how the order is written.
Pat, do you want to hit the Airbridge?
I will. I think to classify it as significant might be a bit of an overstatement, but as we've said just about every day, that we'll take everything we can get by any means we can get it, that we appreciate it, and it still is an ongoing process. I think Pete Gaynor responded that there's been 73 national Airbridge missions so far in the last month or so. So it's an ongoing process, Elise, and we, like I said, we appreciate every piece of PPE we get from it.
Colonel, do you have any idea how much you've received from Airbridge?
You know, we do have that information, and I could circle back with you on that.
Sure. Can we come back to you? Do you mind? Mahem, will you remember that? We'll come back and give you a specific count. John, you're going to close us out here unless I missed anybody. Thank you.
On testing, how do you view the role of antibody testing in getting back to normal, both antibody testing in hospitals and that would allow for apparently non-COVID and non-urgent care? And Governor, this week you talking about long-term care facilities, you said the standards and protocols, the unevenness is incredibly disappointing. Does that sentiment include the Paramus Vets Home that's run by the state? And on the discharge data, do you include deaths in the hospital as part of the discharge data? That it seems to be the case from some of the data the health department has sent us. And if you are including deaths in that discharge data, is that a fair figure to show people that it gives people the assumption that things are getting better?
Yeah, so things are getting better, but we slipped a little bit here, I have to say. So there's no question things are getting better when you look at hospitalizations, ICU, ventilators, and admissions. I will certainly let Ed and Judy address the question on antibody testing, if that's all right, because I will just say I'm not qualified to answer that. Listen, we have the VA has become a very good partner of ours over the past several weeks, and I think the jury is out. I'll come back to you on Paramus in terms of whether or not, again, I don't want to call out a particular facility, but we have to, they're in there right now with our teams, not only surging staffing, but helping us figure out, fair to say, Judy, how we can cohort and all the things that. And so I'm going to reserve the right, if I can, to come back to you, because I'd like to get their independent assessment, which is part of the reason they're there. They're there to first and foremost surge our healthcare worker force in those homes in Menlo Park as well, but as well to make an assessment. You want to say something, Matt, to that? Or?
I got a text that my last answer wasn't clear. By removing that statutory bar, tenants can instruct their landlords to use the security deposit, so it's not an option.
Do you all mind hitting antibody, Ed? Do you mind?
Sure. When you're looking for something, like to try to decide if somebody has COVID or had COVID, there's two ways you can do it. One is you actually look for the virus or pieces of it. That's that familiar swab test or the Rutgers spit test as far as that goes. If you get that back, you can be pretty sure that the person actually has COVID at that particular period of time. Then what happens is your body begins to respond to the infection. The way that it responds to the infection is it creates antibodies. Antibodies come at a later time, and exactly when it comes can vary just somewhat. So antibody tests become important to try to decide if somebody has had the disease before, much more important than trying to decide if they have it now, because they may not reflect that. Antibodies, when they're made, one of the things that you hope is that then they become protective, meaning you make antibodies. Antibodies are one of the things that prevent you from getting an infection again, and if you've made antibodies, then you might assume that you're immune from getting that infection again. So when people talk about antibody tests, that's what they're talking about. They're saying, hey, can we have this test now that will show me whether any individual has had this disease in the past and that they are therefore immune, and if they're immune, of course, they can go about their normal business and do everything else. That's what we would like the antibody test to be able to tell us, and that's what some people believe that it is telling them. Unfortunately, that's not actually the case. And it's not actually the case for a variety of reasons. The antibody testing that's out there now comes from a whole variety of sources, and exactly how specific and sensitive that test isn't clear. For example, it's not clear whether if you were infected with one of the more common circulating coronaviruses last year, because we do have those types of coronaviruses circulating all the time in the state, whether you might test positive for now and think that you actually had COVID when instead you had something but much less deadly in the past. Know for sure that just because an antibody test is immune, all these tests known as a false positive rate, specific, and basically with that 100 people actually had COVID, while those 5 in 100 people might test positive, to be roughly a 50-50 chance of antibodies as far as protection goes. At this point, certainly, no. Where it is useful is what you to move forward with as well, which is population, to get a sense in a broad population what actually happened in the past.
On discharge, whether in relation, the answer is yes, but there's an important for me. When we say the deaths that we report may not, and folks, so there's no hiding the piece.
All right, everybody, it looks like the end of that recording there got a little bit messed up, but that is A-okay because we've got plenty to show you here still on News Now and on coronavirusnow.com. Obviously, we're taking a live look at the White House. Again, I hope you all are having a fabulous Friday evening. My name is Pilar Arias. I would invite you to please follow and like me on social media so we can stay in touch even during non-streaming hours. So if you search me on Instagram, Facebook, Twitter, you will find me. Just type in Pilar, P-I-L-A-R, Fox 10. And I would be happy to follow you back. I appreciate it. All right, we're going to head to California next, but I would like to let you all know, so this is a coronavirus only related stream, right? Well, we do have some breaking news here in the Valley. Matter of fact, in Mesa, Arizona, not just my hometown where I was born and raised, but where I currently live. If you would like to get that information, I invite you to go to fox10phoenix.com. If you'd like to watch the live feed, I invite you to go to the Fox 10 Phoenix Facebook page where there is a live video there. Now, what is the breaking news, you ask? It's a helicopter crash off of Stapley and the US 60. Christy Larson has been in charge of the Facebook Live there, so just showing you the magnitude of News Now, what we can do, how often we can do it, and when we can do it. But again, we're going to go out to California now, listen in to Governor Gavin Newsom from earlier today. I am expecting Los Angeles Mayor Eric Garcetti in just a little bit, so when and if he comes up live, I will bring that to you live right here on News Now and on coronavirusnow.com. But again, thank you so much for being here, everybody. If I don't see you again before I head out for the evening and the week, I will definitely see you on Monday. But again, stay in touch via social media.
To address all three issues at once, and that is a partnership that we have formed with FEMA. Over the course of the last few weeks, we have been working diligently to create a framework for engagement with our federal partners to help support an effort, first in the nation, to take care of our seniors' most important needs, and that is their nutritional needs, to make sure that they are fed, to address the issue of isolation. We estimate that some 1.2 million of our seniors in the state of California live alone. There's over 5.7 million older Californians, but 1.2 million live alone, socially isolated, unable in many respects to cook their own meals, unable to provide the kind or be provided the kind of nutrition and support that they deserve. We've been thinking about what we can do, what more we can do with these extended stay-at-home orders, and the expectation that even as we begin to toggle back on the stay-at-home orders, that our seniors will continue to be a focus of our energies and our focus of consideration as it relates to making sure that they're truly protected in this crisis. And the expectation that our orders for our seniors may come later, they may lag. And so the need to be more aggressive, to be more focused, more supportive of our seniors has been top of mind. And so working with FEMA on ways to provide nutritious meals to our seniors, to get them delivered, but also to get them prepared. We started thinking about building a partnership with our restaurant industry, with kitchens, with our hospitality industry. It's been ravaged by this pandemic. And this has led us to an announcement today, a partnership, not just with FEMA, but now a partnership with cities and counties for a locally driven strategy to get our restaurant workers, our hospitality workers, to prepare and deliver nutritious meals to our seniors and have the capacity to not only deliver and prepare, but to pay for this endeavor. This partnership will allow for the ability for restaurants to start rehiring people or keep people currently employed and start preparing meals, 3 meals a day, 7 days a week, and have those meals delivered to our seniors all throughout the state of California. We will provide an unlimited number of meals, no cap in terms of that support, but there is an eligibility cap. For seniors, they must have eligibility in this frame. They must either have been at high risk of exposure to COVID-19, must be in a position where their economics are below 600% of federal poverty, must have already been impacted or exposed directly to COVID-19, or more broadly, have compromised immune systems. So there's a category in this frame, but beyond that, now we have the ability to have a locally driven decision-making to start employing workers and get these restaurants reopened and provide hundreds of thousands, if not millions, of prepared meals every day delivered to our seniors throughout the state of California. The reimbursements work along these lines: $16 for breakfast, $17 for lunch, up to $28 reimbursements for dinner. So $66 a day will be reimbursed. There's nutritious guidelines. I keep saying nutrition for a reason. We want to make sure that we are focused on locally produced produce. We want to connect our farms to this effort. We really want to focus our values throughout the state of California to get a lot of independent restaurants up and running again as well, and have a diversity of options, and make sure that what we're sending to our seniors is low sodium, not high fructose drinks or sugary drinks and the like. And so there's guidelines that we're putting out, and we're just very excited about this partnership. This partnership also can support local government because the generation of local sales taxes associated with these purchases actually could start generating revenue and support for the local economy. So it's one of those rare areas, this first in the nation partnership, where we're really addressing 3 problems at the same time in a very meaningful way. This program goes in effect immediately. And we're looking forward to local government, again, making the determination and the decision of which restaurants are eligible for participation. And we will work on reimbursements. We will work on making sure that we're supporting local government's share. We're providing 75% of the 25% of local government's requirement in terms of the cost of this program. So a very small percentage is borne by local government. The state picks up a disproportionate share of that. And again, FEMA in our federal partnership picks up the rest. The counties will identify those seniors that are eligible, and we continue to encourage people to do two things. The local level, if you're a senior and you believe you're eligible for this program, call your local 211, and that will be, I think, the perfect point of contact to begin the process of eligibility. If you don't have a local 211 in your jurisdiction, go to our covid19.ca.gov website, covid19.ca.gov website. I'm not naive that everybody has access to the internet or even the 211 call centers. So we'll be doing a lot of outreach in partnership with our county directors of our adult and aging services and with our cities to be very proactive in promoting this program and getting it up and running over the next days and weeks, and hopefully seeing this scaled throughout the state of California. This, we think, is a real opportunity for rural California as well. Some of our favorite dining spots that may be closed down, large number of seniors socially isolated in our rural communities, and begin to connect those dots. And again, it's not just about the meals, it's about a human connection. It's about someone just checking in as they're delivering those meals and making sure people are okay. And so it extends a wellness narrative, and that's something else I wanted to speak to as well today. We are expanding, significantly expanding our wellness and outreach efforts as part of our announcement today. We are working with the Department of Aging, and I'll ask the Director of the Department of Aging up here in a moment. She'll talk a little bit more about this program, but to build on existing supports of outreach for wellness and check-ins in the state of California and bring them to a whole nother level. We have, through their leadership, developed a wonderful partnership with Sacramento State and all of their students that are focused on the issues of aging, genealogy, and others that are going to be supporting this effort, along with United Airlines. And I just want to bring up United Airlines as a point of personal privilege, because United Airlines reached out to us and said, what can we do with so many of our call center takers, the folks that are on the lines, usually dealing with an overwhelming volume of calls about travel plans. Obviously, those individuals are not being utilized. I imagine you may be saying, well, send them over to EDD for unemployment insurance processing. No, we have 1,340 people that we already have transferred. An additional 350 we're supporting those efforts. We can talk more about that in a moment. But we thought they would be perfect because of how they're organized and positioned to be able to make wellness calls in partnership with Sacramento State and in partnership with the Department of Aging. So we just want to thank United Airlines. I love the idea that the folks that we usually check in to get our travel arrangements done or be checking in with our seniors and older Californians just to check in on their mental health and see what they need. In addition to that, we're working with CERT. I may have mentioned, I have in the last number of press conferences, CERT. And it's our emergency response teams. They're all throughout the state of California. They'll provide an additional 900 staff. So we're well in excess of 1,000 new folks that are going to be focusing in very deliberatively on these wellness checks. And we've actually created what we call a friendship line, 888-670-1360. You'll see that right on the screen. That's the line people can call just to check in, just to call to see that, well, not only check in by making that phone call, but know that we will have people checking in on you, checking in to see if they can be supportive of your needs. You just need someone to talk to. That's the line to call. You need someone, you know, to just listen for 5, 10, 20 minutes. You don't need anything in particular. You just need to get something off your chest. You want to share some thoughts, how you're feeling. That's the line. And so that's why we call it a friendship line. We've got a great partnership. That line has been up for some time with the Alzheimer's Association, and folks have been checking in for people, dementia and other needs. We just want to broaden that access, broaden its availability to a broader group of individuals. So I encourage folks that may be listening or watching to go to 888-670-1360. Make that phone call if you need a little bit of emotional support or just want to be able to emote and communicate with someone on the other line. And so that's the architecture of the framework of our announcement today. More supports for seniors, particularly those that are required to stay at home and are the most vulnerable to this disease. Also supporting our restaurants and our hospitality industry more broadly, supporting our communities in terms of the economic activity that this program will generate, and then making available this resource, this new army of volunteers and support staff to make sure we're doing wellness check-ins proactively and then creating a line where you can proactively reach out for some support, emotional support, and otherwise. That's broad strokes, but we have Kim McCoy-Wade, who's the head of our Department of Aging, that helped organize all of this and built these support structures, and Kim is here to talk a little bit more specifically about some of the program offerings, and of course we'll be here to answer any questions in a moment as well. Kim?
Thank you, Governor. And I'm here today to speak directly to older Californians and thank you for really being the heroes. You were the first to answer the call of our governor on March 15th to stay at home, and because you answered that call, you have driven the curve down and you have saved lives in California. And we are here, as you just heard, to reaffirm our commitment to serve you, to partner with you. We see you. We see the leadership that you have shown in staying home, in driving that curve down, being the first to go home on March 15th. We see the sacrifice that you older adults are making. You are not at your jobs, whether it's in healthcare or hospitals or the halls of Congress. You are teleworking. You are not volunteering. You're missing your halls of worship in this holy month. You're missing your grandchildren. We see you. We see you. And tragically, we remember all of those who we have lost. We will not forget you were not a number. We know your names. We want to hear your stories. We are joining with you and your families in grieving, and you are dearly, dearly missed. Looking ahead, we need to continue saving lives here in California, and we are moving with unprecedented innovation and urgency in these partnerships. We know we can't tolerate the inequity. We are very concerned in doubling down on some of the disparities we're seeing in Latino, Native American, Asian Pacific American, and African American elder communities. And we're so pleased to see the growing response to homeless elders moving off the streets and moving out of congregate shelters and into more like a home. We know we can't tolerate hunger. That's why we're so excited today by the partnership with our restaurants. We've been delivering more meals than ever in March, and it's going to grow even more in April and May thanks to these partnerships, with a win-win for every sector of our community. And as our governor just said, we can't tolerate loneliness. Loneliness is a terrible threat to our health and our community, and that's why we're so grateful that you all have made, all across the state, we're up to 1.7 million calls that we can count, and now with the Friendship Line, there'll be even more calls, even more connection, even more human connection. And we're equally committed to bridging the digital divide for older Californians, too. Living at home, in senior living, the digital divide also has to be bridged. Last but not least, I've got to give a shout out to the gerontology students who are really showing us that we're all in this together, all across generations, young and old, coming together to feed, to talk, to connect, to stay home, stay healthy, stay safe. I am so proud that California believes in a California for all across the lifespan. For that 8-year-old who has a learning challenge, who is at home, struggling with school learning, to that 80-year-old who's widowed, who's now living alone. We are here for you. We are all here for you, and so grateful for these new investments and new partnerships to continue this journey. Thank you.
Thank you, Kim. Thank you for your leadership and your team and support, and thank you for recognizing those family members that have been torn apart because of a loss of a loved one. Again, disproportionate number of our seniors vulnerable to COVID-19, and it's just an opportunity and a reminder, as always, to make this fundamental point. Even if you feel you're young and healthy and you are somehow not necessarily at high risk of this disease, I want to remind you There are others that you may love, family members, people in your direct circle of friends and relations that may be more vulnerable, but none more precious than our seniors, the folks that raised us, the folks that built our middle class, and the most precious resource we have. And so we are committed to their health, to their safety, and working through these new guidelines and these new partnerships. I think we have substantively advanced this cause. Again, the eligibility requirements will be put out at local and county level up and down the state. These are for people otherwise ineligible for other programs or not getting support. Meals on Wheels can only do so much. So this is a variant on the incredible work Meals on Wheels does, but at a huge scale that we think can make a huge impact in the lives of potentially millions of Californians, both on the service delivery side and on the recipient side itself. First in the nation, and again, deep gratitude to the partnerships, including the incredible partnership with FEMA and the federal government for allowing us to be the first to set up this program. Kim made a point about lives lost, and I appreciate that, as we do every day. At our press conference, we extend our condolences to those who have lost their lives over the last 24 hours. 93 additional people lost their lives compared to the time I spoke yesterday till today. We saw 5% more people test positive over the last 24-hour period for COVID-19. Again, those should be sobering and cautionary statistics as it relates to the desire that we all have to get back to some semblance of normalcy and answer the question of when that will happen. The good news in terms of the numerical statistics to which we, again, attach a lot of consideration in terms not only of our daily briefings, but more broadly in terms of monitoring our capacity to begin to augment and modify our stay-at-home orders, hospitalizations, and ICU numbers. Hospitalizations were flat yesterday, no statistical growth. Again, you saw yesterday's decline from the previous day. Today, we're seeing with that decline flattening. So some stability. We continue to say stability in our models, but particular stability in hospitalizations. That's good news. Accordingly, our ICU numbers, which were down yesterday, they're slightly up, but just 1%, which again is encouraging. I mentioned this yesterday that there were 4 things that happened all at once that we had not seen since the beginning of this pandemic, and that was not just hospitalization numbers down the day before, but also ICU numbers and those people under investigation. Good news is 3 of the 4 indicators showed a flattening or decline. Only the ICU numbers showed an increase. The number of PUIs for ICUs dropped slightly, so did hospitalizations. So again, some encouraging signs, but we're not by any stretch of the imagination in a position to say that those 6 indicators to which we make our determination about the future of our stay-at-home orders, that any new lights are yet green. We were able just 48 hours ago to make the announcement as it relates to scheduled surgeries. That was the first augmentation on our way to ultimately producing the kinds of augmentation that all of you expected, demand as it relates to our stay-at-home orders. But we continue to be vigilant in the other spaces, and we continue to monitor information as it comes in real time from all across the state of California. I'll remind you what I said yesterday and the day before. I recognize California is, despite it being a state, is many parts. And that means we recognize the incredible imperative and importance of recognizing regionalism and how local conditions are distinctive from one another. All the information I gave you, as I do on a day like this, is in the aggregate. Again, none of us live in the aggregate. And so, too, when we consider loosening of our stay-at-home orders, we will consider local conditions, and we will consider those things not only from the perspective of the spread of the virus, not only from the perspective of the number of deaths and trend lines, but also in terms of our broader capacity. What's the hospital capacity? What's the resource capacity from a physical perspective? What's the human resource capacity as it relates to potential?
Los Angeles Mayor Eric Garcetti is speaking live, and we are all about live here on News Now, so let's listen in.
Data summary that we have, a great way to look at the trends, look at the numbers, and even more depth than I have time to share with you each evening. So tonight's snapshot will offer a comparison to where we were a week ago to see where we've come, how many challenges we have, and what progress we have made. Today, the county reported 1,035 new confirmed positive COVID-19 cases here in the county, bringing our total confirmed cases to 18,517, a 6% increase since yesterday. 1 week ago, we had 567 new cases last Friday and 11,391 cases. We're doubling our cases about every 9 days. And even though we saw a backlog that spiked things up a little this week, we're staying consistent, seeing that curve beginning to bend again, and doing the work that we have together to make sure we slow the rate of increase of COVID-19 infections. In the city of Los Angeles, there were 428 new cases today, bringing the city of LA total to 8,450, a 5% increase since yesterday. By comparison, we had 241 cases last Friday in the city and 5,093 total cases. And as we add more and more tests, we'll see some of those numbers go up. As more labs come online, we'll see some of the backlogs or the new numbers come in. And we want more people to test, and we want to have a more honest number of how many cases are out there. And so we're seeing about 1,000 cases a day this week. We again are trending down on that bending of the curve. But the one statistic I always say that is perhaps the truest and by far the saddest is the deaths. That isn't something that is just about the number of tests. Somebody we've lost is somebody we have lost. And today that number was 52 Angelenos. That brings the total number of Angelenos who have fallen to 848, a 6% increase since yesterday. A week ago, we had 40 new deaths and a total of 495. So deaths, like our cases, are doubling about every 8 days. It's good progress from a week ago. When I stood here a week ago, I said deaths were doubling every 6 days. But we want to see that number continue to go up. And at some point, to see the number of deaths per day come down and hopefully one day be at 0. Each loss is incalculable. And I send my deepest condolences to every family that is still mourning and those that are mourning for the first time this evening. Families like the PGs. Bishop Anthony PG Sr.'s life was taken by COVID-19 on April 8th. He was the same age as me. He was just 49 years old. He was a devoted husband to Lavicia, the father of 7 children, but his flock was so much larger. He touched so many people in this city of angels, founding the Life of Faith Community Center in South LA, and he traveled the country to share his message of hope and humility, of care and compassion. The people who knew him best say there was no ceiling to his generous spirit, making sure that members of his congregation had enough food to feed their families and to pay their rent, accompanying single mothers to parent-teacher conferences so they'd know they weren't alone in bringing up their child, helping other pastors to strengthen their ministries so that faith could take even greater hold throughout the community, even outside his own church. The things we're doing to stop the spread of coronavirus are in his memory and the memory of each fallen angel in this city, in the honor of everyone that we have lost. I've been wanting to share some of the stories, and I understand many families have kept that grief private, but I think it's important to tell these narratives so that numbers don't overwhelm, but that we see this is about human beings who we have loved, who we have held, who we have known, and who have touched us. Each night when I report on these figures, I think of these families, of Bishop PG, the hundreds of lives that are cut short by this pandemic. We're acting today to prevent more hospitalizations, we're acting today to prevent more sickness, and we're acting today to prevent more needless deaths. And my job is not just to throw numbers at you without any context, but to turn these statistics into stories that make sense so they can be fuel for the work that you are doing to protect everyone. I want you to know that what we're doing is working, and we can tell by the infection rate. What we want is an infection rate of below 1 which is the number of people that are infected by each positive COVID-19 patient. When we started this, that R0 rate, that's a scientific term or a medical term of how many people each infected person reinfects, was probably above 2, somewhere around 2.5. When we instituted the Safer at Home order on March 19th, the city's infection rate was trending upward rapidly and was probably right there at about 2.5 to 2.6. Excuse me. But because we applied physical distancing and Angelenos continue to observe the public health orders, we've been able to get this under control, and I'm so proud of each one of you. Today, we're fluctuating at an infection rate of between 1 and 2. We won't be all the way home until we're under 1, meaning that each new case infects less than 1 new person, but this is really good news, and it's a product of your work. So while our cases and deaths seem to be stubbornly high, the data suggests that we're flattening the curve and just beginning to bend it back down. We don't want to just flatten that curve, we want to see it come down, and there's some initial data showing that. Making sure that our hospitals can stay below their capacity and are not overwhelmed like we've seen in other places. This is critical to this mission because there will be surges throughout this year and maybe into next year. You see, as we saw in the USC study, 96% of us probably have not gotten COVID-19 yet, so we're susceptible. And as we create the rules of the road to figure out how we can take steps towards reopening and recovering, we know there will be times we have to go back in. So as long as we can keep those numbers down, we can imagine what those days will look like and bring them to us at a sooner date. Across the county in our general emergency hospitals, there are now 1,205 beds available, including 963 acute care beds, 242 ICU beds, and an inventory of 1,215 available ventilators. And even though we have seen the most cases this week, hospital admissions offer a glimmer of hope. This is the number of people being admitted for COVID-19, and we've seen this begin to stabilize. This is one of the most important measures, and I haven't shared it with you each evening. I've just started getting some of those. But it's begun to stabilize. It now ranges between 200 to 300 new people a day going into the hospital. Based on the number of people that are healing, the number of beds that are becoming available, this is a good number for us to stay under our capacity. And I want to thank again our medical professionals and everybody working in our hospitals to ensure those patients get the care they need. When we've talked about flattening the curve, this is what we mean, doing everything in our power to prevent our hospitals from becoming overwhelmed, avoiding a devastating strain on our healthcare workers. And as you've heard me say each night, one of the other important tools in our fight against COVID-19 is aggressive testing. Last week, there were 30 testing locations, 7 days ago, across the city and county. This Friday, we're up to 33 sites. And across those city and county-run sites, last Friday we tested a total of 67,000 people. But today, we've now exceeded 106,000 people tested in those sites. That is an incredible mark, and we have the capacity to test 12,000 people a day. By next Friday, we estimate we will have tested 150,000 people in Los Angeles County through those centers alone. That doesn't include other tests being done directly by many providers. Simply put, we are adding more tests than cases to our county every single day. And I want to thank the amazing teams that have stood this up from the county and the city, our volunteers, our firefighters, and others that are laying down the foundation for reopening and recovery here in the Southland. In the United States, the COVID Tracking Project estimates there's about 150,000 tests each day in the United States right now. That we have the capacity in LA County alone to conduct 10% of all the tests in America, though we're under 3% of the population of America, is really an astounding testament to all of you. So take advantage of that hard work and get a test. Go to coronavirus.lacity.org/testing. And this surge in testing has made it possible for us to expand testing to any Angeleno with symptoms. Second, also to roll out high-capacity testing to some of our toughest and most vulnerable populations, from Skid Row, which we did this week, to our senior centers, which I'll get to more, and allowing our critical workers now without symptoms to be tested this week and going into, of course, next week. These are grocery store workers and pharmacy staff. These are folks working at hospitals, key city employees that are listed in each department's continuity of operation plans, along with shelter workers and LADOT and Metro bus drivers. You are the critical workers that are helping us get through this. Even if you don't have symptoms, get a test. We can offer that to you, and I hope next week we'll open that aperture to even more people who are working right now on the front lines and in essential businesses. These critical workers should contact your employer on how to get priority testing, and check it out again at coronavirus.lacity.org/testing. And we're not stopping there. Yesterday I mentioned that more than 30% of LA County residents who have died from COVID-19 were residents of long-term care facilities. And with the County Department of Public Health today mandating additional health measures, and I want to thank Dr. Ferrer, the Board of Supervisors, for the great order that I know is coming out as we speak and that they announced today. I want to build on that in the city of Los Angeles and enact a companion emergency order that further expands protections for residents and workers at our skilled nursing facilities. We estimate there's about 80 of them in the city of Los Angeles, and so my emergency order will require every skilled nursing facility within the city of Los Angeles to provide COVID-19 diagnostic testing for its residents, its employees, and contractors every month, administered by trained personnel. We believe this is the first city in the country to mandate that monthly testing. And additionally, operators of these facilities may request testing kits from our city's Emergency Operations Center if they can't figure out how to do it on their own. Please try to make those relationships, get that testing through healthcare providers in these facilities, but we are here to help you if that falls short. You can visit coronavirus.lacity.org/testing to help get that done too. And we also aim to offer them trained personnel and help you set up tests, because we want to protect the loved ones that we have in these facilities. We want them to stay safe, and we want the workers who care for our loved ones to be safe as well. And so we've expanded, as I mentioned, starting Monday, our mobile testing teams that can roll out whenever we hear about an infection. When we see a case in a facility, from 3 teams to 6 teams. And again, I want to thank the Los Angeles Fire Department for their help with that. While this order requires skilled nursing facilities to provide the testing, it does not compel any resident, employer, contractors to take a test. That's the law. But the city is committed to protecting workers who are protecting us and our loved ones, and keeping our most vulnerable folks safe that are dying disproportionately compared to the rest of the population. And if we can get this right, it is another step forward in the work that we can collectively do to see a day when part of our county and cities will reopen parts of our lives. Across the city, there are about 800,000 Angelenos who are over 60 years of age, and about 80,000 of them live under the poverty line. And even those who aren't under the poverty line quite often live on their own, can't prepare their own meals, don't have their own resources. And so we have focused from the beginning on expanding what we can do to make sure our seniors are fed. When we issued our Safer at Home order, the number of homebound seniors now has grown as well, and the number of those who don't know where they will get their next meal. So that's why my team has been working so closely with our city's Department of Aging to substantially increase the meals that we are providing our seniors. Last week, I announced that my Emergency Senior Meals program would try to double the number of seniors from 5,000, more than double, to 12,000, and ensure that 7,000 new seniors receive 10 meals a week for up to 10 weeks. Let me put that in perspective. We went from 5,000 seniors, 5 days a week, getting a single meal, 25,000 meals, pre-crisis, to trying to get to 120,000 meals per week. This is a Herculean undertaking, but we're up to it. And to get the job done, my team stood up a senior meals program hotline staffed by more than 130 disaster service workers, your City of LA employees, that took on a new job and rushed in to help. So far, they've fielded thousands of calls, and because of their work, we thought this would be maybe 2 or 3 weeks. In addition to the 5,000 seniors who now have doubled the number of meals they get, we've enrolled another 6,000 seniors just this week, so 11,000, close to that $12,000 goal. 12,000 person goal we have gotten to in just a week. This is in addition to a wonderful program that we've worked with Governor Newsom on, and I was so pleased to hear him announce that will help both our restaurants and homebound seniors. The FEMA reimbursement for ordering meals from restaurants for seniors. We're working out those details, and we hope to be the first big city in California to roll that out next week, adding even more to those 12,000 seniors who are receiving meals. Bottom line, we care about you. If you're a senior living in a skilled nursing home facility, or whether you're a senior just stuck at home, not sure where your meal's going to be, we are here to say we love you, we support you, we'll feed you, and we will protect you. And I want to thank every table who's our partner meal provider on the meals side, who is just doing an extraordinary job making the meals, employing people who were out of work, freezing those meals, and helping us get them delivered. And I want to thank the folks who have also been working on this from my staff, my Director of Operations, Mary Hodge, my Deputy Mayor for City Services, Barbara Romero, and of course Matt Johnson and Rick Jacobs, who are doing a great job raising funds, and my wife Amy, who has done an amazing job working on the details of this to make sure seniors in need are fed. Thank you all. If you need help, and we still have available meals, if you know a senior who needs help, make sure that they call 213-236-5226. Sorry, 213-263-5226. And I believe that's on a slide right now, so it's 263-5226. Or just go to coronavirus.lacity.org/senior meals, and we will get you signed up. Helping our seniors and our most vulnerable Angelenos stems from our core commitment to make sure nobody is left behind, nobody is forgotten during this crisis. We have to save lives, and we have to save livelihoods. And we have to do everything possible to support our families and our workers, our businesses, whose economic security hangs in the balance. Protecting our labor force and protecting our businesses are not mutually exclusive. It's going to require creativity and cooperation. And this week, we saw that spirit in a new deal between SEIU, the union that represents custodial janitors, and custodial contractors and building owners to keep thousands of janitors on the payroll. This agreement means that janitorial staff will hold onto their jobs, hold onto their income, their health care for themselves and for their families, as part of the state's work-sharing program, which allows these employers to reduce employee hours while maintaining their benefits, and ensures that those workers are eligible for unemployment insurance to make up for lost hours. This is a victory for everyone involved, for 8,000 unionized janitors who support their families here in Los Angeles, 20,000 across California who get to keep their jobs and health insurance, and employers will keep a trained, experienced, great workforce that they know and that already do an amazing job in our office buildings and hospitals all around the Southland. The state saves public dollars because janitors will only apply for their unemployment insurance to cover lost hours, not for their full wages. So it's really a win-win-win. Win for the budget of the state, which is in tough straits, a win for these employees, and a win for their employers. Let me turn to this weekend, because I know we've all noticed the temperature ticking up. Feels like summer is here. That's what life in LA is like. One day it feels like winter, and the next day it's summer. And I know what that does to us. Our primal natures want to get out. The vast majority of Angelenos, though, will be at home this weekend. And unless you're in a critical job, please stay at home. No matter what the temptations are, no matter how badly we want to go out, the beaches remain closed, our trails remain closed. You cannot play on playgrounds. You cannot go and have basketball or tennis or our golf courses. We need to stay at home. And we need to do this to keep everyone safe. We can't let one weekend reverse a month of work that you have invested in. But we know it's going to be hot. So that's why, in partnership with LA County, we are standing up cooling centers for many people who don't have any place to go. We're expecting some high temperatures, and even though it's under the threshold where we sometimes trigger these, we think during this crisis we should open them up no matter what. So in Baldwin Hills, in Lincoln Heights, in Panorama City, in Northridge and Sherman Oaks, you can find a cooling center. And if you want to know where those locations are, please go to emergency.lacity.org/heat. These centers opened today. They'll be open tomorrow from 12 p.m. to 6 p.m., and everyone coming to them is screened before entering. You're required to wear your face covering, so bring them. and must follow strict physical distancing orders. And I'm so grateful to the City Rec and Park staff, LA Public Library, LA County staff, and others who are helping oversee these facilities. As I mentioned, these temperatures are slightly below the threshold, but this moment is not ordinary. We need to all take extraordinary actions, and I hope this is one that can keep people not only safe, but cool as well. And let me be clear, these centers are only for the people who might not be able to survive the heat wave at home. So don't misread our abundance of caution. Don't go outside, don't gather with others, and put lives at risk. We're all in this together. From the beginning, we all have been. And it's in that spirit that I want to thank the Get Together Foundation, in partnership with Rockseller Productions and Councilmember John Lee, who I've known since we were both in 7th grade together, for producing Saturday's All Together Now concert event to benefit the Mayor's Fund for Los Angeles and the Angelino Fund, getting assistance to people for their basic necessities. This is going to be a great event tomorrow. Bring the support, the next round of the Angelino cards that we've talked about, and we're in the process of distributing the first round of cards that will help 45,000 Angelinos meet their basic needs. We've provided already $2 million in assistance to families this week, just over the last 3 days, with thousands of more families and millions of more dollars lined up for this coming week. And we know that people need more help. And so please donate. Go to mayorsfundla.org/Angelino. But tune in for this great concert, starting at 2 p.m. Saturday. Watch an incredible lineup, includes Jeff Bridges, Smokey Robinson, Carole King, Lisa Loeb, Tim Allen, Bobcat Goldthwait, and many others delivering performances that will take our minds off all the stress and all the tension of this moment, and also help support a great cause. Visit that website at All Together Now LA. That's alltogethernowla.org for more information, to tune in, and to help support a great cause. On this date and any other year, we would probably see flags and marches on the streets of Los Angeles. Each year we gather to commemorate the 1.5 million lives lost in the Armenian genocide. The fact of history that we recognize every year here in LA, but in this past year, in December, was finally recognized by the United States Congress as well. And while we could not march this year, our promise remains the same, that in the face of any denial, we will speak the truth, and that we will honor those who have perished in the name of justice. I'm grateful to our Armenian brothers and sisters who stayed at home today, but I want to recognize you and say that we are all with you today. And I'm grateful to everyone who is doing the same, staying indoors. And I know as we head into this weekend, we're going to be tempted to embrace the warm weather, but I can't say it enough. Stay at home. Beaches remain closed. Do not go to the beach. Public trails remain closed. Do not go hiking. Sports and recreation facilities, fields and playgrounds, skate parks and pools are closed. And there's a direct correlation between what you choose to do this weekend and how long this will take, and how many lives we will lose. So keep that in mind and do the right thing this weekend. If you go out and hit the beaches and the trails, the safer at home orders will last longer. More people will be sick and more will die. But if you stay home this weekend, our case numbers will drop, and it will stop the spread of this virus and be able to start reopening the city sooner. So if you made plans, it's a good time to cancel them. Because by staying home, you protect your neighbors, you protect your family, and you protect your city. And I know this is hard. I hate saying this every single day, because as the mayor of LA, and forget being mayor, just being a fourth-generation Angelino, I love this city so much. I want to be out there as badly as you do. But we know we show our love in many different ways, and your sacrifices are making a difference. And when we look back on this time, we will remember proudly what we all did together. So let's keep it up by staying safe, by staying healthy, and by staying at home. Have a good weekend, Los Angeles. All strength and love to you as always. I'll see you on Monday, but before that, happy to answer some questions. Thanks. First question, please.
Our first question will be from the line of Claudia Pashuta with KNX News Radio. Please go ahead.
Hey, Claudia.
Hi. I caught that you are still working out the details on how the governor's program to feed seniors through restaurants that's still being worked out. But I'm wondering if you can give us an idea of, a rough idea of how many restaurants might be able to participate and how they might be chosen. And then also, if you can give us an update on the impact that COVID-19 is having on the city's workforce, how many cases, how many deaths, how many isolated and quarantined. Thank you.
Sure. So let me start with our city workforce. We've had 2 deaths of city employees, 2 for sure, unfortunately, and our heart not only breaks for those families, but for a lot of city employees who knew these folks as well. And we've had other deaths of city employees' direct families as well, family members, even though they weren't employees. We have 189 confirmed cases and 305 people currently in isolation, as much as we can count. LAFD, our fire department, has 20 cases still, 19 sworn and 1 civilian, with 14 already returned to duty. And LAPD has had 75, including 59 officers and 16 civilians, and 33 of those officers have already returned to duty. And we have not had a death in either our fire or police department, which we thank God for. We've seen such terrible cases and numbers in places like New York. In terms of the meals program, we were consulted at the beginning of it, helped do some of the architecture of this with other big city mayors in California. So we just got the guidance today, and we're going to work as hard as we can to set that up in the coming days. So we don't have the details yet of how a restaurant would sign up, but I hope that it really can allow a lot of restaurants to go to a simple place. We're going to try to put together, if we can, a website that'll abide by what the state requirements are. And through restaurants and other providers like Every Table that are working here, we'll be able to allow seniors to sign up, get meals, and allow restaurants to know that they're going to have a steady stream of those meals. I also hope that we can continue to put out-of-work people to work in the delivery of these, because many restaurants don't have that capacity. That can be through some of our existing programs, existing companies like Postmates and Uber Eats and things like that, but also hopefully our taxi drivers and others who right now don't have a lot of business. So we're going to work those details out this weekend. Like I said, it's kind of a start date now for all cities to figure that out with the state. We hope to be the first one to launch, since we're already doing that with other senior meals. So hold tight. Maybe as soon as Monday or Tuesday we'll have the news on that. Thanks, Claudia. Next question.
Next question is the line of Alex Michelson with Fox 11 News. Please
hey, Alex.
Go ahead. Hi, Mayor, and happy Friday. That concert sounds like a lot of fun.
Yes.
I know, though, you're talking about the beaches. We're seeing pictures from Orange County beaches that are just packed today, despite all of what you and other leaders have been saying. Why do you think that message is not getting through? And if the beaches and other areas continue to be packed this weekend, what are you going to be doing in terms of enforcement?
So we'll have folks out there, whether it's police officers, we'll have our mounted patrol, horseback, others, with guidance. I was with the police chief. We're not seeking, again, to kind of bring the heavy hand of the law down, but we'll let people know that these spaces and places are closed. We ask people's cooperation. It is unfortunate to see that in Orange County, and I think it could be predicted that when we do this, these places are going to be overwhelmed, and a day or two of fun leading to weeks more of us being in homes and not able to go out simply isn't worth it. I convened a call this morning with the 88 LA County mayors that I'm a part of, and together with Mayor Robert Garcia, we talked about everything from how do we march together to opening up, and was pleased to hear all the beach cities in LA County saying, look, we're talking to the county, we're speaking with public health, we're talking to the supervisors, but there wasn't a single mayor who said we should be opening that. And I know there's been petitions and other things, but we can't just react to petitions and signatures. We have to look at the evidence of what this causes. And there's a few places around the country and around the world that have done that, but I'll always tell people it's not till 2 or 3 weeks later that you're going to see the spikes from these things. So people might say a day or two, look, hey, we opened it up, wasn't any worse. Remember, people's infections spread over a period of time. People go from the beach and bring that back to their household. People will go shopping and pass that on to people who are shopping, not even knowing that they have it because they're asymptomatic. It's just playing with fire. And so they're not going there despite our advice, because our advice has been in LA County, not only advice, but our dictate has been that these are closed, whether it's Santa Monica, Malibu, Los Angeles. And the police chief was talking to me about, he drove up even outside of LA to look at all those beaches. And sure, once in a while you'll see one or two people. Those people need to be reminded and brought out, but then there's stretches that are a mile long with nobody there, which is proof that of the tens of thousands, even hundreds of thousands of people who could be there, this is a very small minority of folks, and we'll make sure there's a presence to remind them what the order is in LA County. That's the purpose of this press conference and this briefing as well, to let people know, no matter how badly you want to be out there, this is not a weekend that you're allowed to go to the beach, not in LA County. Thanks. Next question.
Do they get arrested? Do they get fined? Like, what happens to them if they
no, people comply. We haven't had any strong issues with people not complying once we find them. So we put a presence. We never go straight to that. If that develops and becomes a bigger problem, obviously they could be. But that is never how we lead. That's never step 1, 2, 3, or 4. Just as we have with businesses, we could have gone into businesses that were still open the first day and arrest or fine or do all sorts of things. We didn't. And 99% of the time we got what we needed. And that 1% of the time we had to do that with businesses, and we keep that on the table too if people refuse to abide by the law of these county and local city orders. But we haven't had to do that because people do obey and do respect the law when they come there. Thanks, Alex.
Thank you.
Next question.
Next question will be from Rosa Ordez with KNBC Channel 4. Please go ahead.
Hi, Rosa. How you doing?
Hello, Mayor. You talked about skilled nursing homes and that you're mandating additional health measures. Now, I know the National Guard has stepped in, and this is a question from my colleague, Patrick Healy. Sure. The nursing homes are the hungrier tiger of the group here, unfortunately, and the National Guard is stepping in. Is there a need for more resources from the National Guard to go to more nursing homes, and what is the role of the National Guard?
So we will take help wherever we get it, and it's great to see the National Guard helping out there. We need trained medical professionals. Some of these homes have them, and so it's a matter of training them, connecting them with a source to get tests, and like we're doing with our order here in the city, just mandating that they need to do this for employees and for residents to make tests available and to do this at least monthly. Hopefully, if we expand tests even more, we can do that even more frequently, because this is really about protecting those lives. So they're coming in to help with that. We also have doctors and medical personnel from the United States Naval Ship Mercy leaving the ship and going out. We've had some patients come in, but it's wonderful to see those trained personnel from the Navy going and helping out as well in Los Angeles and in Orange County. I spoke yesterday with the Secretary of Defense, Secretary Esper, and he said we remain, here to help. I know that it looks like the Comfort will be leaving New York, but we have no plans to have the Mercy leave here. It's a great asset to have, whether we need to surge beds, whether we need personnel to go out from there, or whether we need to bring people in. So they're helping with those sorts of medical tasks. Taking people's temperature, where we have testing capacity, they can help with that. And we have, of course, the 6 surge teams starting Monday, building on the 3 that we already have. And now with this mandate, we also do have backup for nursing homes that don't have access, can't figure it out, don't know where to get tests, where we feel like we can confidently help the number that are in LA City and hopefully inspire that across LA County too. Thank you.
Thank you, sir. Appreciate it.
Got it. Next question.
Our final question of the night will be in Spanish, and it comes from the line of Abel Alamillo with Telemundo 52. Please go ahead.
Hola, Abel.
Hola, Alcalde. Regarding the partnership announced today by Governor Newsom on the Home Meals for Seniors program, do we know which type of restaurants can benefit from this partnership? Are we looking more at possibly fast food restaurants or more of these small business-owned restaurants?
No, we hope that it will hit, especially those mom and pops, because fast food restaurants have been able to stay alive during this, but we know for so many of the mom and pop restaurants, these are the ones who had to lay staff off, who have closed up, who aren't getting the regular meals. And it's a good, generous amount that FEMA is willing to reimburse. It's 75% from FEMA. The state will kick in 19%, and 6% we will have to pay for at the local level, whether it's the county, cities, other local government. But this is a great model. It's the first time FEMA has done this. And I believe, too, that we won't just be looking at seniors. There's other folks that have pre-existing conditions that FEMA is willing to reimburse. So again, it's brand new. We're looking at how the final negotiations got worked out, but the intention is that this is for every restaurant that can build this capacity, that wants to participate in this, and we hope that that really is a shot in the arm to help so many of our small, locally owned restaurants, not just national chains, to stay alive, get through this, provide some good help, and be there for when we reopen. I'll say that in Spanish as well. Gracias por la pregunta. Este nuevo programa del gobernador Newsom es una oportunidad no solamente por los restaurantes grandes nacionales, pero también por los restaurantes locales, los dueños locales y las empresas pequeñas que están en Los Ángeles. Estos restaurantes están sufriendo, la mayoría de estos están cerrados, pero este programa da la ayuda a nuestras personas de tercera edad y asistencia a estos restaurantes, sus empleos, y pueden proveer más trabajos durante esta crisis. Gracias al gobernador Newsom por este programa, y Los Ángeles es nuestra esperanza a ser la primera ciudad con un programa funcionada. Y tenemos una fundación con la expansión de nuestro programa de las cenas por las personas de tercera edad que existe ahora y que nosotros estamos expandiendo ahora. Pero con esto es una oportunidad por nuestros vecindarios, nuestros ¿cómo se dice? Negociantes pequeñas y otras personas que están parte integral de la economía local. Gracias. So with that, I'm going to go to Spanish again to everybody out there. Stay home. I know it's going to be hot. If you're worried for your health, go to one of the cooling centers. Everybody else, I promise when we get to the beaches and the trails together, I'll be the first one waving at you, leading the way, and celebrating. But we'll get there sooner if we continue to stay at home and stay safe. God bless you all. And with that, I'm going to switch over to Spanish for my address for the evening. Muy buenas tardes, Los Ángeles.
All right, everybody, we're going to take you, actually, we're going to stay in the state of California, our neighbors to the west, and go back out to Gavin Newsom's news conference from earlier today. Again, this is not live. Pilar Arias signing off for the day, for the week. I will see you all Monday. Please stay safe. And most importantly, stay healthy. Look after your loved ones. I'll see you soon.
We can't tolerate loneliness. Loneliness is a terrible threat to our health and our community, and that's why we're so grateful that you all have made, all across the state, we're up to 1.7 million calls that we can count, and now with the Friendship Line, there'll be even more calls, even more connection, even more human connection. And we're equally committed to bridging the digital divide for older Californians, too. Living at home, in senior living, the digital divide also has to be bridged. Last but not least, I've got to give a shout out to the gerontology students who are really showing us that we're all in this together, all across generations, young and old, coming together to feed, to talk, to connect, to stay home, stay healthy, stay safe. I am so proud that California believes in a California for all across the lifespan. For that 8-year-old who has a learning challenge, who is at home, struggling with school learning, to that 80-year-old who's widowed, who's now living alone. We are here for you. We are all here for you. And so grateful for these new investments and new partnerships to continue this journey. Thank you.
Thank you, Kim. Thank you for your leadership and your team and support. And thank you for recognizing those family members that have been torn apart because of a loss of a loved one. Again, disproportionate number of our seniors vulnerable to COVID-19. And it's just an opportunity and a reminder, as always, to make this fundamental point. Even if you feel you're young and healthy and you are somehow not necessarily at high risk of this disease, I want to remind you there are others that you may love, family members, people in your direct circle of friends and relations that may be more vulnerable, but none more precious than our seniors, the folks that raised us, the folks that built our middle class, and the most precious resource we have. And so we are committed to their health, to their safety and working through these new guidelines and these new partnerships, I think we have substantively advanced this cause. Again, the eligibility requirements will be put out at local and county level up and down the state. These are for people otherwise ineligible for other programs or not getting support. Meals on Wheels can only do so much. So this is a variant on the incredible work Meals on Wheels does, but at a huge scale that we think can make a huge impact in the lives of potentially millions of Californians, both on the service delivery side and on the recipient side itself. First in the nation, and again, deep gratitude to the partnerships, including the incredible partnership with FEMA and the federal government for allowing us to be the first to set up this program. Kim made a point about lives lost, and I appreciate that as we do every day. At our press conference, we extend our condolences to those who have lost their lives over the last 24 hours. 93 additional people lost their lives compared to the time I spoke yesterday till today. We saw 5% more people test positive over the last 24-hour period for COVID-19. Again, those should be sobering and cautionary statistics as it relates to the desire that we all have to get back to some semblance of normalcy and answer the question of when that will happen. The good news in terms of the numerical statistics to which we again attach a lot of consideration in terms not only of our daily briefings, but more broadly in terms of monitoring our capacity to begin to augment and modify our stay-at-home orders, hospitalizations, and ICU numbers. Hospitalizations were flat yesterday, no statistical growth. Again, you saw yesterday's decline from the previous day. Today, we're seeing with that decline flattening. So some stability. We continue to say stability in our models, but particular stability in hospitalizations. That's good news. Accordingly, our ICU numbers, which were down yesterday, they're slightly up, but just 1%, which again is encouraging. I mentioned this yesterday that there were 4 things that happened all at once that we had not seen since the beginning of this pandemic, and that was not just hospitalization numbers down the day before, but also ICU numbers and those people under investigation. Good news is 3 of the 4 indicators showed a flattening or decline. Only the ICU numbers showed an increase. The number of PUIs for ICUs dropped slightly, so did hospitalizations. So again, some encouraging signs, but we're not by any stretch of the imagination in a position to say that those 6 indicators to which we make our determination about the future of our stay-at-home orders, that any new lights are yet green. We were able just 48 hours ago to make the announcement as it relates to scheduled surgeries. That was the first augmentation on our way to ultimately producing the kinds of augmentation that all of you expect and demand as it relates to our stay-at-home orders. But we continue to be vigilant in the other spaces, and we continue to monitor information as it comes in real time from all across the state of California. I'll remind you what I said yesterday and the day before. I recognize California is, despite it being a state, is many parts. And that means we recognize the incredible imperative and importance of recognizing regionalism and how local conditions are distinctive from one another. All the information I gave you, as I do on a day like this, is in the aggregate. Again, none of us live in the aggregate. And so, too, when we consider loosening of our stay-at-home orders, we will consider local conditions, and we will consider those things not only from the perspective of the spread of the virus, not only from the perspective of the number of deaths and trend lines, but also in terms of our broader capacity. What's the hospital capacity? What's the resource capacity from a physical perspective? What's the human resource capacity as it relates to potential surge if there's a new outbreak and an increase in the spread of the virus? If one city opens, are we recognizing that people will start commuting into that city and then go back home into their city. We have to consider all of these things in total. And again, that's part of our larger effort with those 6 specific indicators that we continue to update on a daily basis. And I will update you as soon as we have more clarifying news as to, again, answering that question of when. We don't debate dates. We only are guided by indicators, and the indicators that will ultimately allow us to reopen safely, judiciously, and very, very thoughtfully. So with that, we just wanted to, again, announce some very good news in terms of this broader program and the new procedures we put in place with our local partners. We look forward to supporting mayors and county leaders in this project as we grow and as we expand it. We continue to recognize the importance of addressing the needs of those socially isolated and their mental health needs, and that's what this friendship line was all about. And I just want to thank all the partners that came around the table, of course, the last few weeks to help put this partnership together so that we can make the announcement we did today. Just one final point before I open up to questions. As we do, we always want to ask before I end, and that is to ask you if you are willing to help and support not only the causes we announced here today, but more broadly, the cause I think that unites all of us, and that's the cause of contribution. Just a few days ago, we announced the CaliforniansForAll.ca.gov website, CaliforniansForAll.ca.gov website. I told you we had over 20,000 people call in that first day. Over now 26,000 of you have filled out the application and have begun the process of contributing and volunteering in your community. I just want to thank all of those that have done so and extend a heartfelt expression of appreciation. I hope others will continue the same. One final point, and then I will turn it over to questions. Also just want to thank everybody that helped organize a program we announced, seems a week ago, maybe it was a week and a half or so ago. We talked about care for the caregivers and the importance we're placing on taking care of our caregivers, particularly those that are supporting our seniors in assisted living, skilled nursing facilities, and the like. We announced 2 programs. The stipends, $500 stipends that we're providing, these cards that we were distributing to thousands and thousands of our healthcare workers. And I announced those numbers a couple days ago, an unprecedented number of people that will be getting the benefits of those stipends. But I didn't mention the number of people that got the benefit of our hotel rooms. The hotel nights and the need to decompress, to take a shower, to change, to not have to stay the night in your car or at a friend's house because of the commute. The folks that truly are on the front lines, we wanted to help them. Just remarkably, in a very short period of time, the state has already procured 56,000 room nights that have been completely 100% reimbursed. 56,000 room nights to truly manifest the phrase care for our caregivers. And I just want to thank the team that helped organize that program. And I just want folks to know we are following through on that. It's scaling. Some 19,000 people now have filled out applications. We're trying to turn them around like we are so many other applications in real time. But thousands of people have taken advantage of it, and we hope thousands more will in the future. Not every one of those that inquire for the benefits of this program get 100% reimbursement. Again, we grade the complete contribution from an individual and the state based upon income. But the 56,000 number is 100% reimbursement. Thousands others are paying a small percentage. People with higher incomes also getting the benefit, but on a sliding scale. So I just thought that was important to update you on so that you know things that we announced. We just want to keep you connected to not only the cause, but to the progress, and know we are holding ourselves accountable to progress in that space as well. And by the way, that includes progress we made that I announced last Saturday, Project Room Key for our homeless, and we continue to get more and more rooms every day, more and more people off the streets, out of congregate facilities, into those housing units as well, those temporary hotel units as well. And again, I just want to thank our partnerships in that place for continuing their vigilance and hard work. With that, happy to answer now any questions.
Don Thompson, AP.
Good afternoon, Governor. You said lifting the stay-at-home orders for seniors will likely be slower. Do you envision it being based solely on age, like it was at the start of this whole thing for those over 65, when they were told to stay home? Do you expect it to be a combination of antibody and other virus testing? And on the cost side, you're saying millions of Californians could benefit from this. The per diem be $66 a day. Is there an estimate for the cost of this? And given that they might stay home longer, how long do you expect to have to provide these meals, until they can leave their homes again, or is there an envisioned timetable here? And if you could expand on the cost factor a little bit as well on who's picking up this FEMA 75%, it sounds like, and then 75% of the state picking up the local government's cost, if I understood you correctly. Thanks.
Thank you. Yeah, no, and I appreciate it. Thank you for the question, and you answered at least one portion of your question very accurately. 75% reimbursement, the 25%, there is a local share of which we're picking up 75% of the 25%. I know these numbers can sound confusing, but it's a relatively modest share at the local level. And as I said earlier, if we start seeing significant sales of food, we'll see sales tax generation at the local level that should more than offset the local costs if we get this program to scale. Eligibility, again, it's all about eligibility, but the universe of those eligible is certainly in the millions. That said, the number of meals, 3 meals per day per person, even if it's hundreds of thousands that take advantage of this, just in weeks, you'll see millions and millions of meals part of this program. And so that's the framework of eligibility that we laid out earlier. And again, we'll make that very, very public. COVID19.ca.gov website. You'll see more information. We're going to localize it with these 211 call centers, working with cities and counties that will be making more information available so we can get people to take advantage of this program. But it is, as you suggest, for the duration of this crisis and our orders. To the extent that our seniors remain our most vulnerable population and those with compromised immune systems, we are going to be, yes, particularly sensitive as it relates to any augmentation on our stay-at-home orders to protect those that need most protection. And so I think it's just an honest statement, not surprising, I think, to anybody that we would suggest the first orders to begin to augment and modify the stay-at-home are not likely to be our seniors. It certainly won't be people congregating in large events, in large crowds, mixing. I think, again, all that is sort of driven by common sense, and that is a big part of what we're doing. Yes, data, yes, health focus, but also a little bit of common sense as well.
Leila Fadel, NPR.
Good afternoon, Governor. On Wednesday, you said you wanted medical examiners in the state to look back to as far as December for deaths that might have been COVID-19. Is this a directive being sent to these offices, and what do you hope to learn by searching for possibly earlier deaths?
Yeah, let me ask, in fact, just because they're here, Dr. Galley is here, who worked with Dr. Angel, that initially started to engage in these conversations some time back. They could talk a little bit more about those specific conversations and talk a little bit more specifically about why they felt it was important to begin to claw back with a little more forensic understanding of when we can mark a moment where this virus came to the state of California and why that's important from an epidemiological perspective and in terms of informing our strategy and our next steps. So Dr. Angel will come up as our health director and explain a little bit more about those conversations.
Thank you for this the question. It is very important, and as we look forward to really understand what happened at the beginning of this whole process. As we heard very recently, an investigation of additional cases in Santa Clara demonstrated an earlier case. That was because the coroner at that point, as they were doing their investigations, had noted that an infection could in fact have been associated with the case that was seen. At the state, we are also looking very carefully across and matching our cases with the reports that were coming from coroners to make sure that we are not missing any example cases that are related to a death. If that death has not been identified as being related to COVID-19, we are investigating that further. Likewise, if we have a death associated with COVID-19, we're looking to see if a case it was reported earlier in that individual. As we move forward, we will continue to be very thoughtful about what could have happened in the past, and we'll continue to work with our local coroners to understand more about the progression of COVID-19 in our communities.
And as that information is forthcoming, you'll either report it directly or we'll report it out appropriately. Next question.
Univision, Sacramento.
Hello, Governor. We're at the end of the week and just a few days from the new month to start. And our undocumented viewers still don't know when they're going to get their disaster relief assistance money. I know the website says that the date of the distribution will be mentioned by next week, but people want to know a date now. I know some of them don't have money to eat nor to pay rent. So can we have a date when this money is going to be given to them? And can you also give us a criteria of who will be getting priority for the assistance and who will be left out? Thank you.
So the CBOs will make that determination at the local level. Again, $5 million on a regional basis is the minimum contribution to CBOs throughout the state. You'll see substantially more supports for those with higher density of population that are eligible. Again, individuals and families are eligible, and we'll do our best to broaden this program, working with philanthropy, not just with my colleagues in the legislature who have been incredibly supportive of this program. I just want to remind you, and I also want to compliment very publicly the Asian Caucus and the Latino Caucus and the Black Caucus for their support of this effort, for their urging of the creation of this program. As you know, we've been sued in this program. We're doing everything our best to make this work and to get this information out in a timely basis. The website made the indication about next week for a reason, and we are very eager to get a specific date out, as I know you are eager to distribute that date. When I have it, I will provide it for you, and we are in real time trying to get that information out as quickly as possible. But we just announced this a few days ago, and now we are reorganizing at the local level all throughout the state of California to put in all of the points of contact and prioritization and get all that information out as quickly as possible. So anticipate we'll be answering that question, I hope, as early as Monday of next week.
Brody Levesque, LA Blade.
Good afternoon, Governor. This is actually the same thing in two parts. I got a press release from Senator Weiner's office today, and I'm going to quote part of it. He's talking about the fact that neither the federal government nor state government is collecting data on the pandemic's direct impact on the LGBTQ community. And in general, the senator's saying that the community is being ignored. And as to go with that, before the pandemic struck, a disproportionate amount of the LGBTQI community are on the gig economy. The AB5 legislation basically killed their jobs, and now there's questions being raised as to whether or not you are willing to suspend the law or to work with the Assembly to rework the law coming out of the pandemic on the other side and even right now currently.
I respectfully, I'm not sure those jobs were killed, but I appreciate the broader concern. Let me speak to the broader concern. On April 28th, those PUAs, talked about PUIs a moment ago. These are the pandemic unemployed assistant grants that are coming from the federal government. Will start being distributed in the state of California. Every 24 to 48 hours, we'll turn around those checks as soon as we get this system up and operationalized. As you know, those are the individuals that otherwise are not eligible for unemployment insurance that are in that workforce. Independent contractors, gig workers, but also those that are self-employed. And so that system is being architected. We announced that very prescriptively about a week or so ago, and we are going to hit our target date, and I'm confident we'll be able to turn around those checks. By the way, within, again, 24 to 48 hours. The traditional UI process is about a 21-day process. So we'll be even more successful at turning this around quicker. As it relates to the LGBTQI issues and making sure that we're breaking down data, that's very important to me. For the life of me, I hope people aren't accusing even my friends in the legislature not deep sensitivity and deep compassion and concern for the unique needs of the LGBTQ community. It's been a big cause of my life and a big reason why I'm able to answer the why question. Why am I even interested in public service? It's one of the reasons I care deeply, because I care about all communities that have been impacted and oppressed and disproportionately are struggling because of race, ethnicity, and sexual orientation. And so I have Dr. Angels here, who's also made this the cause of her life, and she perhaps could talk a little bit more specifically about what our data collection does look like and what it will look like as we march forward into the future.
Thank you so much for that very important question. Absolutely, inequities or lack of access to care across the spectrum of our populations is of primary concern, particularly in the face of COVID-19. Our LGBTQ community also deserves and needs to have that data to understand and for our communities to be able to act and respond accordingly. This data can be difficult to collect through our current standard mechanisms of reporting because this is information that is not necessarily reported regularly. Very much like the data that we're collecting around race, ethnicity, these are things that we're looking very carefully at and looking at ways of improving our system so that we can get this information into the hands of people who can take action on it, ourselves and our local county authorities as well. So we'll be reporting back to you for methods that we're coming up with that. And again, thank you for your question. This is incredibly important to ourselves as an administration and as a state.
Next question.
ABC 7.
Thank you, Governor. California saw a significant increase in its testing numbers this week as compared to other states when adjusted for population, going from a ranking of 48 last week up to 27 this week. What accounted for the increase specifically? And if California continues to improve its testing, will the state be more likely to be one of the first to reopen?
Yeah, I think if we are able to substantially increase the testing, it's still not good enough. We need to do a lot more. 494,000 plus tests have been conducted to date. We want to see multiples of what we're doing on an average day into the future. We have been very, very specific about those goals, almost on a daily basis. And for the purpose of emphasis, repetition, let me continue to remind you and others of what those goals are. We averaged about 2,000 tests a day through the end of March. We hope to be averaging 25,000 tests a day by the end of this month. We're well on our way of achieving that goal. We're north of 16,000 a day as I speak. We are making progress for one reason. We took responsibility and we took initiative. Took responsibility for not doing enough in those first few weeks and started to recognize we needed to change the way we approached this issue. We put together a task force led by some of the top people we could find in this space that happen to reside in this state, but some of the top in the country, folks, researchers and scientists, folks in the front lines from our medical institutions and research institutions and private sector. They put out a framework of new goals April 14th. Their goal was 10,000 tests a day. We were able to exceed that, and their goal was 25,000 at the end of the month, and I'm confident we'll do the same. Just 2 days ago, Dr. Galley came up here and talked about the need to get to 60 to 80,000 tests a day. Why 60,000? Well, we're working off the basis of 152 tests per every 100,000 individuals. If you assume 40 million Californians, plus or minus, that's about 60,800, roughly 60,000. We think we can go north of 60,000. That's why the 60 to 80,000 range. I mentioned 2 days ago that with all the instruments that we have in the state of California today, if we were at full throttle, everybody operating without consideration of supplies, reagents, tubes, RNA extraction, swabs, we can be running today at 95,000 tests. So it gives you a sense of our capacity. But again, supply constraints continue to limit that. I mentioned 24, 48 hours ago some of the supply chain improvements, some swabs that came in from the federal government that are quite literally being distributed as I speak today, 90,000 that we announced yesterday. We hope to see another 250,000 swabs next week. That's for specimen collections. I mentioned the partnership with Abbott, 1.5 million serology tests that we procured that will be distributing to 130 sites in the state of California. I mentioned 2 days ago the specific partnership we announced with OptumServe for 80 sites, mobile sites, end-to-end sites that are being distributed in rural parts of the state and to inner cities in this state, and how those are being distributed in real time. And the partnership with Verily, that's the old partnership with Verily, subsidiary of Google, to do 6 additional sites to focus again on socioeconomic disparities and make sure we're truly testing California, broadly defined, not just parts of California, and those that somehow have the privilege of getting ahead of the line. So we're democratizing testing. We lifted the threshold of who could be tested, not just symptomatic, went further than the CDC guidelines. We're one of the first states to do that. And so forgive me for the long-windedness. I think it's just important to remind people where we are in the testing. The answer specific to your question is yes. If we can broaden the testing, that's the indicator number 1. We announced on Wednesday that we are prioritizing more testing, provides more capacity not just to trace individuals that may have been exposed or contracted the disease, but to begin to isolate and quarantine them, as well as begin the serosurveillance, the broader community surveillance that all of us look forward to in the antibody space, but with caution always. That we need to be careful about the promotion in that space. That's something I have been cautioned directly about, and it's something I want to just extend a point of caution and consideration to all of you as well. So all of those things together sort of stack up to a frame where, yes, we believe more we can do in this space, much more than we're currently doing. Yes, the quicker then we can start connecting more green dots in those other indicators that we laid out on Wednesday.
John Myers, LA Times.
Governor, you've sent the National Guard to 4 senior nursing facilities in Los Angeles County over the recent days. Can you talk about that deployment, talk about what the criteria are for deployment to additional sites, and talk about what you hope them to do and why, what prompted you, how big of a crisis you think that is? No,
I appreciate it, John. The issue of our seniors, and it's the topic today, and it wouldn't be fully discussed if we didn't bring up our skilled nursing facilities, our assisted living centers. I'll just remind not you, but others, that we have 1,224 skilled nursing facilities in the state of California. We have an additional 7,461 facilities that are licensed outside of the SNFs that we also have to organize around. It's a remarkably large system, imagine the largest anywhere in the United States. We have hundreds of thousands of patients in that system and tens of thousands of staff. As you know, and you have been doing some outstanding reporting in this space, we have seen flare-ups in terms of the total number of positives, not just patients, but also staff members all throughout the state of California, not just in Los Angeles County, but in rural parts of the state in particular, Tulare County being one of the hot spots of concern. So forgive me the long-windedness, but the answer to your question is the reason why we deployed on Sunday, Monday, the National Guard and those medical teams was to help support the efforts to isolate, conduct tests, and to make sure that we're sharing best practices and protocols within the system, particularly for those sites that we identify as more acute in need. How do we identify those sites? Well, we're doing daily check-in calls. It's not an exaggeration. Old-fashioned calls to all 1,224 skilled nursing facilities. Those happen every single day. Regionally, they're done, and there's a check-in. And we're checking in on staff. We're checking on a number of positive patients and checking in to the extent possible on these deaths. And those death numbers, I know, are important to all of us, and we're trying to do our best to provide them. You saw some of the numbers we put out just yesterday. So we have a strike team that we've doubled. We hired 600 nurses, and we got them retrained to help provide even more support and staffing. We have temporary staffing agencies that we've contracted with to help us on surge staffing. We prioritize testing at our skilled nursing facilities, and we've prioritized some PPE. And I say some because it's not nearly enough, nor, by the way, is the testing. But the good news, more testing, prioritization to the SNFs will continue. More PPE prioritization into our nursing homes will continue. But the National Guard is part and parcel of these larger teams that we've assembled, working with our infectious disease teams and working with our partners at the CDC that are also part of this larger ecosystem. Final point, we're also working with the Navy, the USNS, and some of the personnel on that ship to also come into the community to be redeployed to help also support these efforts. So what was a simple question, forgive me, became a more complicated answer, but it's a profoundly significant issue. One of the first points of guidance we put out, executive orders, was in this space. And right now, John, and for others that may be watching, as of yesterday, I'm getting the new numbers today, forgive me, we'll be putting them out later. But as of yesterday, there were 522 facilities of all the licensed facilities that at some point in time had a patient that was infected with COVID-19. Just over 2,700 patients and staff, patients and staff, have the virus that we're currently monitoring within our licensed system. So 522 sites yesterday, over 2,700 staff and patients that we're monitoring. Some very concentrated, some not so much. More testing will provide more clarity, more transparency, and of course, with those death numbers, 119, 420 that we put out yesterday, we'll be getting more contemporary stats on that. And forgive me, final point, again, I owe you specifics and transparency. We are currently providing information on all of those 7,461 licensed facilities under Department of Social Services. Of those sites that have 6 patients or more. We're also working hard to get into those smaller sites where there's maybe just 1 or 2 patients. Don't be patient, because none of us should be. I'm not. But when that information is available, we'll also be providing that. But there are HIPAA issues there. There are patient privacy issues, particularly in that space, that we all should be concerned about. But again, transparency is the priority, and we hope very soon to be providing even more of a picture in that space as well.
Final question, Theo Douglas, TechWire.
Good afternoon, Governor. Thanks for taking my question. Last week, you discussed the check-in app or initiative, and Secretary Julie Su discussed the new app to assist people filing for pandemic unemployment assistance. Can you elaborate on those 2 initiatives or apps and what companies worked with the state to develop them, and let me know when check-in went live and who at the state uses it?
Good. I'm going to get you the company's name on those apps. We'll provide that for you. I see folks behind the camera that are making notes, and so we'll directly get that information to you as soon as we pull that down. I just broadly want to make this point about apps. I kid you not. I said this a few days ago. I said, this, it's a treasure trove, California. This is what we do best. And we provide platforms, but we also have so many folks mashing things up, using open data, using proprietary data, and putting up apps, all these new APIs every day. And it's very enlivening and exciting. The problem is it's a wealth and it's an abundance. And so as soon as we're close to pulling the trigger on a particular tracing app or even a symptoms app, someone presents us another technology that then raises questions of consideration on why that may be better than the other. We're very close to making a more formal decision on the tracing app and platform, or at least a number of them that have the ability to cross-pollinate information, as Google and, as you know, Apple are helping advance. Also, as it relates to the symptom check-ins. We have another app we're putting out very soon, more broadly, that is beyond just even UI, which I'll probably talk about Monday, but this is a space that I know you write about, and it's space we talk about, and it's a space that will be, I think, being more, well, we'll more formally be rolling out what we believe are the best decisions for the vast majority of Californians that we'll certify very, very shortly. Forgive me again for the long-windedness of that. But I want to just, again, not ask for any forgiveness from members of the public, just gratitude I want to extend for all of you, all 40 million Californians, for allowing me the privilege once again of saying that there were no increases in hospitalization. That's because of you and your incredible work. You've practiced physical distancing. You've taken seriously the stay-at-home orders. I know people are feeling very anxious. I said this yesterday. I'll say it again. We're walking into some record heat this weekend, and people are apt to want to be able to get outside and at least get out, perhaps even on the coast and other parts of the state. We've been putting up a lot of new information, working with Caltrans, working with state parks about what's closed, what's not. The overwhelming majority are closed. I just caution you, if you're going to get in the car and make a long drive and expect to find parking to go to a closed beach, it is very unlikely, and I want to encourage people to do their best through this difficult weekend where your temptation is higher to want to experience our natural beauty, just to, again, consider the impact of those decisions, not only on yourself, but on the rest of the state and on the rest of society. And continue, again, to do your best to practice physical distancing, wear face coverings where appropriate, and continue to do justice to this moment. I hope next week, I don't want to get ahead of myself, but I hope next week we can start seeing some of these other indicators start pointing in the direction of green, and we can make those announcements. And I'm confident if you do your part, we will commit to doing our part to taking your good work and bringing into a health frame and a public safety frame, and that will help me help move this cause forward, beginning to loosen the stay-at-home orders and get this economy back up and get many of you back to work into whatever semblance of normalcy the new normal will provide over the course of the next few months, as we all look forward to the moment where we have herd immunity and or a vaccine. And so I want to, again, thank you all for great work. Continue to do what you've done that got us to this point. And if any of you want to volunteer, go to that californiansforall.ca.gov website. Take care, everybody.
All right, that wraps up Governor Gavin Newsom's daily briefing for us. Unfortunately, the sobering number, 93 people in California, did die as a result of COVID-19, but there was also some good news. He announced a partnership with FEMA and local governments. Restaurants are going to be paid to be able to feed senior citizens, some of our most in need in the state as well. It's going to be 3 meals a day, 7 days a week. Some good news there, Bobby.
All right, guys, just want to say, just want to say thanks so much for being here with us on News Now. We do have more stories coming your way right here this Friday. And coming up next, we do have an interview with KTVU, Fox 2 San Francisco. One of the country's leading rheumatologists addresses that false hope hydroxychloroquine is fueling, and the risks of this creating for his patients. He also talks about a new FDA warning against using the drug to treat COVID-19. So we're going to be playing that interview for you right here on News Now.
Hi, everyone. I'm Andre Senior at KTVU Fox 2 in the San Francisco Bay Area. We're looking into COVID-19 and the possible treatments for it. We continue to do that. And we're joined now by Dr. Stephen Soloway to talk a little bit about that drug, that much talked about drug, hydroxychloroquine, that we've heard so much about from President Trump. So here to talk to us more about it is Dr. Soloway. Doctor, first of all, we've had some late updates in that the Food and Drug Administration Friday warned against using hydroxychloroquine to treat COVID-19. Give us your thoughts on that.
So hydroxychloroquine, which the chloroquine family of drugs, are originally anti-malarial drugs. In the past decades, because of chloroquine resistance, those drugs are no longer used to treat malaria by and large. We in the United States, in the field of rheumatology, give hydroxychloroquine or Plaquenil. We give this to all of our lupus patients, 100% of them, because it is proven with scientific data to reduce lupus flares, reduce thrombosis or blood clots in lupus patients, and lower cholesterol in lupus patients. And interestingly enough, for decades, the mechanism of action of how it did this in lupus was not known. It was only discovered in the last 10 or so years to how it even worked in lupus. Now, chloroquine, which we would often use as a substitute if a person cannot tolerate, because of, say, nausea, vomiting, or diarrhea, if a person couldn't tolerate hydroxychloroquine and they had a lupus rash, we would try to switch them to chloroquine. Well, in my practice in the last 7 years, I have not been able to obtain chloroquine for anybody, so it's not available in this country, at least not as of 3 months ago, to my knowledge.
And so why is that exactly, that it's not available in this country?
It may not be available in any country, frankly, I don't know, but hydroxychloroquine, which is available to every one of my 500 lupus patients and my rheumatoid arthritis patients who have nodules, which are the two indications that I use it for, all of those patients have never had a problem getting the drug. But now, half of the patients are telling me they can't fill their prescription because their pharmacist or somebody else has told them, you should give up your drug so that we can give it to coronavirus patients because it's going to save their life.
Does that seem right to you for pharmacists to be telling people this?
No. The patients that are already on it, those people have the rite of passage. It's their drug. It's the way of their life. And before those people became stable with their lupus or their rheumatoid arthritis, these people were on the path perhaps to disability or even death. You know, once you get side effects or problems from lupus or rheumatoid arthritis, the minute you hit the hospital, now you hit a whole new domain that you don't want to be part of. You want to try to avoid the hospital. You want to avoid whatever bacteria is floating around there and so on. Oh, I apologize. The phone is ringing, sorry. So you want to avoid going to the hospital if you can. So I feel that stopping a routine drug for a patient with a serious disease is just a bad thing to do. Now, if the drug were made and manufactured in the United States, we could probably ramp up production. But the drug's not made in the United States. We rely on 10 different countries to get this drug to the United States. Israel donated, I believe, 5 million doses from Teva, T-E-V-A. It's a pharmaceutical company that makes generics. They were one of the larger donators of drugs. It's my understanding that the United States government has 18 million doses of the drug on hand. It's my understanding that the one trial that was done in France on 30 individuals who have had coronavirus received the drug, and of the 30 people, and I want to clarify certain points as I tell you this. So 30 people with coronavirus in France actually received hydroxychloroquine or Plaquenil, and one of the patients died, 3 or 4 of them went on ventilators, and the other ones did well. Well, so first of all, there's no control arm, so it's not a valid study because we have no comparison. However, I will say that if one person died out of 30, that's 3.3%. And the touted death rate for the coronavirus is only 1 to 1.5 or maybe 2%. So 1 out of 30 is, if they studied 60 people and only 1 died, then you'd have the expected death rate, but they only studied 30 people. So now I want to go back and clarify a couple of things. In the population of lupus patients, the patients receive 200 milligrams of the drug twice a day. Prior to lupus treatment, when the drug was used to treat malaria, it was used on weight-based dosing, 5 milligram per kilogram, which at that time, people were receiving 600 milligrams a day, not 400 milligrams a day. It's my understanding that the coronavirus patients who received the drug received a 6-day course starting with 600 milligrams and stayed on the 600 milligrams for several days and then went to the 400 milligram dosing towards the end. Now, in my practice and in the practice of several colleagues of mine in rheumatology that have tremendous lupus populations, we consider the drug to be universally very, very, very safe. So because it's so safe, I applaud President Trump for saying, why not try it? What have you got to lose? Now, I've heard other people say, gee, you know, the death rate's higher, you need to check the heart and so on. Well, in practicality, at the 400 milligram dosing, we don't do that. And we don't have any people dying from Plaquenil toxicity or getting severe side effects.
But I did want to ask you, the FDA did say they've received reports of adverse effects in people from poison control centers dealing with serious heart-related adverse events and death in patients with COVID-19. So is this even safe to treat people if we're seeing this and the FDA is issuing this warning?
So I don't know if I can trust that information. I've used the drug personally more than anybody at the FDA has used the drug. And after 30 years of treating lupus patients and having 500 patients taking this drug on a regular basis, year in and year out, only having needed to do the screening ophthalmology exams to check the retina, because if you have retinal deposition of the drug, you have to stop the drug to prevent blindness. The case reports of cardiomyopathy or muscle weakness from hydroxychloroquine toxicity are few and far between. So they are known to exist, but they are known to exist so infrequently that it'll be discussed at a national meeting if it occurs 3 times in 2 years in the whole country. And this is out of, I want to say, 2 million people, perhaps, I think, have lupus in the United States.
So, but with this push from, we heard the president push this, could this be a problem with hydroxychloroquine and the effects of COVID-19, or could it be some underlying issue if you have COVID-19 that's maybe adversely affected when you take hydroxychloroquine?
So I would say that the patients who have COVID-19, who are already sick in the ICU, who come in with pneumonia or respiratory distress, we already know that they can get cardiac toxicity or cardiac muscle toxicity, myocarditis, muscle disease of the heart. We know that that happens with COVID-19. Now, we know that that is reported with hydroxychloroquine. However, of the millions of people in the US that take the drug on a regular basis for lupus or some rheumatoid arthritis, we just don't see these side effects. So I find it very, very hard to believe that the drug, which is probably safe enough to be in the water, and we joke about that as rheumatologists, that the drug is safe enough to be in the water, how it's killing people. So I think it's the COVID that is killing the people and the COVID that is causing the heart damage. But we don't do any cardiac monitoring in the field of rheumatology for patients who take this drug. And why somebody would implicate this drug, maybe they have an ulterior motive. Maybe they just don't want this drug to be used because they don't like the president or something. I mean, that's a little bit of a conspiracy theory on my part, but I think the one thing I can say about this drug from 30 years of using it on enormous numbers of people is that I don't see any side effects from it. In fact, when the major side effect of the drug that used to occur when people took 600 milligrams a day for malaria was skin rash. There's a rash called erythema multiforme, and it's a skin rash. It doesn't kill people, but it's a rash, and it's a very annoying rash, and it has to be treated like a condition. But that would be the side effect I would look for in COVID patients getting this higher dose of hydroxychloroquine. I'm so used to calling it Plaquenil, so excuse me if I say Plaquenil.
That's fine. I think that you've done a good job of calling it both names so people who are watching this can understand why you're saying it. But the other name you're using is the actual pharmaceutical name, not the brand name, is what you're saying, correct?
Yes.
So I got to ask you. So what do you want people to know as they're introduced? Everyone's watching the news. They've heard it from the White House. The use of hydroxychloroquine to treat COVID-19. What do you want people, the public, to know about using this drug in connection with COVID-19?
Okay. I want people to know, in my opinion, this drug does not cure COVID-19. This drug does not treat or mitigate the symptoms of COVID-19. And this drug is extremely safe to take no matter what disease you have, unless you're allergic to the drug.
And remind me again, remind me again, who are the people that you're prescribing hydroxychloroquine to?
All 100% of my lupus patients, unless they had an allergy to the drug, which is very, very rare, at least in my patient population. So all lupus patients in the United States are supposed to be on hydroxychloroquine. And I use it selectively in rheumatoid arthritis, but in particular, I use it in rheumatoid nodulosis, because bad rheumatoid arthritis patients, you know how they have like an egg on their elbow? So that would be a rheumatoid nodule. And the rheumatoid nodule, which is it's seen as a poor prognostic indicator, and it's seen in severe cases of rheumatoid arthritis. The mechanism of action of how and why people get nodules is different than the rheumatoid arthritis itself, because the drugs that make the rheumatoid arthritis better sometimes make the nodules larger, but Plaquenil happens to shrink the nodules. So it's a good drug to use in rheumatoid patients with nodules. So I don't use it because we don't need it really in rheumatoid arthritis. We have better drugs.
I want to ask you, we've heard about hydroxychloroquine and chloroquine. What's the difference?
They're derivatives of each other. So practically speaking, there's not too much of a difference.
So now we're seeing this change here, this information from the FDA warning not to use it. Are you feeling that we're heading in the right direction in terms of this? Because I have seen other doctors who say, yeah, we're treating our patients with COVID with this. I've seen this, and I'm like, well, maybe they know what they're talking about. But you seem very certain that that's not the case.
Okay, so let me make my case.
Mm-hmm.
So I'm an old man, pretty much, and since I was a child, I got vaccinated against measles, mumps, rubella, and now people get vaccinated against hepatitis B. People get vaccinated against shingles. There's vaccines for any virus you can name, and the point I'm trying to make, there's no cure. Viruses aren't curable, okay? The only virus known to man that has a cure happens to be hepatitis C. And hepatitis C is a whole other topic, but there are special characteristics about that virus where the antiviral drugs cure it, completely eliminate it from the body. And after 30 years of using HIV drugs, what they call antiretroviral drugs, finally, they're starting to get some people to have no detectable viral load in their blood. However, if we look at viruses as a whole, we've never had a penicillin which came along and it just stopped bacteria in its tracks. So throughout history, measles, mumps, rubella, rabies, parvo B19, chikungunya virus, Zika virus, Coxsackie virus, herpes, shingles, human papilloma, which causes cervical cancer from genital warts from the virus. None of these things have treatments. They all have vaccines. So to think that an anti-malarial drug is going to cure a virus is really trying to shove, not push or put, it's trying to shove a real big square peg into a real small round hole. It can't work. What I've seen, read, and understand is that because of actions of Plaquenil, I do believe that it probably will prove to reduce viral shedding as long as it's administered to the right patient population at the right time. And that's what needs to be studied. Because if the timing can be worked out from an exposure to when you're shedding the most, perhaps you can prevent people around you from being as susceptible as they would have been prior. But to think somebody is going to have the virus and take the pill, it is impossible, absolutely impossible. Anybody who thinks that it saved their life was saved by God. They got lucky.
All right. Dr. Stephen Holloway, thank you for providing your insight into this. 30 years of prescribing this medication to people with lupus mostly, and you're sharing your insight into what you think you could do. I really appreciate you sharing a few minutes with us and giving us your insight into this drug that we've heard so much about.
It was great talking to you. Thank you very much.
All right. Hi, everyone. I'm Andre.
Many restaurants have been forced to shut down, and for La Mezzaluna in Princeton, it's no different. But even though the doors are closed, the owner is still preparing food inside, not to be sold, but to be given away to those who truly need it. Here's Bill Anderson with tonight's hero.
I'm also from Italy, and thank God I live here because this country has been giving me a lot in the last 23 years that I live here.
Hello, my name is Michael Moriello. I am the owner of La Mezzaluna restaurant in Princeton, New Jersey.
He's positive. He's humble. Talking to Michael, you'd have no idea that the coronavirus has created an economic struggle for him, his family, and his employees.
William and I, we don't have a job.
He's just way too focused on helping others.
Since we closed the restaurant in March 19, William and I decided to not just look around the world what's going on, and we decided to do something.
Like many businesses on the normally busy Princeton streets, his restaurant remains closed. But walk in the kitchen, and there they are.
We are cooking for the community, for many families they are in town and they lost their jobs right now and they can afford a meal in the evening. So we try to help them and to prepare food for them.
He's cooking and donating hundreds of meals to families and organizations, as well as local medical staff.
Some fish, some barramundi with some mango chutney.
And not just some basic meals, restaurant quality meals.
It's not just like selling the restaurant, it's meals that we eat too. Most of the times, whatever we prepare for them, it's our dinner too for me and for my family.
Now, I had to point out that it's impressive that he's cooking meals for people who lost their income at the same time that he lost his. He just shrugged and said he has faith.
I'm sure that we're going to come back stronger than before. We're going to be back soon.
He, of course, didn't believe he deserved the hero label and actually explained it by sharing a story from his homeland.
Some doctors were retired, and they were called for emergency to fill in and help these sick people, and they got the virus and they died. They dropped everything, they went there, and they lost their life. To me, those are the heroes. We're cooking, we're taking a little risk. It's nothing compared to what these people are doing.
It's a strong example of his humility, but we appreciate Michael nonetheless, for goodness sake. I'm Bill Anderson.
All need to be wearing masks outside of our homes right now, like Jenny Joyce was just telling us, but finding one isn't always easy.
Yeah, hard to get your hands on one these days, so a local police officer decided to pick up a new hobby, sewing. And now she's making masks for workers just like herself on the front lines. For goodness sake, here's Bill Anderson with tonight's hero.
I just feel like in times like this, if you can do something to help, you should. I am Jenna Fici, and I'm a police officer at the University of Pennsylvania Police Department.
Service to others is not unusual to Jenna Fici. You can even argue that it's the family business.
I have an older sister, 2 brothers, and a father, all in law enforcement.
And that's just her immediate family. Her relationships are strong, which inspired who she is, but it also means she sees the struggles of first responders in a way that most of us never will.
We got more than enough necessary equipment to, go outside and do our jobs during this pandemic, but I have friends and family in law enforcement who their departments weren't so lucky, so I felt compelled to do something about it.
So after her own days on patrol, she took on an additional challenge. You didn't know how to sew?
No. I actually went out, I got a sewing machine, I brought it in my house. My family was like, you don't know how to sew, and I was like, well, I'm gonna learn.
And she did learn. She learned fast. How long ago was that?
2 weeks ago. I have made over, I want to say 500 masks.
Check out pictures all over social media, and you see her hand-sewn mask on the faces of grateful people throughout the region.
I donated to Penn Presbyterian Hospital of the University of Penn, Upland Borough Police Department, numerous districts in Philadelphia Police Department.
Now, several people sent us messages saying that they believe that Jenna is a hero. She's appreciative, but feels like she's actually donating to the heroes.
I think the real heroes are the medical workers, the nurses, the doctors. They're the ones on the front lines of this whole thing, just doing what I can to help.
And so many appreciate that help. And that's why, agree or not, to them and us, you're a hero. I'm Bill Anderson.
Stuck at home, it can be easy to forget. There are countless people sleeping on the streets, not far from where you are.
And during this pandemic, help can be far and few, which is why a church is ramping up its efforts to make sure someone's looking out for them. For goodness sake, here's Bill Anderson with tonight's hero.
I think most people are caring and considerate about it. They just don't know. They don't see it. I'm Tom Fry with St. Miriam's Blessing Bag Program.
Some of our hero stories you truly can't understand unless you see it.
It's an emotional thing. You go down there. I mean, I come up, I got to decompress for a couple minutes because I can't believe there's so many people sleeping like that.
There is a world of difference between upstairs at 8th and Market, downstairs at 8th and Market.
I saw Tom's signature truck early and joined his daily ritual of giving what they call blessing bags to the homeless.
You got some food over there, right?
Something he's been doing for years, but during this pandemic, the need is staggering.
We used to do maybe 1,000 bags a month before coronavirus. Now we're doing 1,000 a week, and we can't keep up.
People struggling before are now without the help that some would provide on the street. Businesses that allowed them to use bathrooms are closed. Add the fear of congested shelters, and this is what most will never see.
Before work, lunchtime, after work on the way home, and then we go out at night.
Volunteers from his church, St. Miriam's, join in putting together the bags and handing them out, but it only took a minute to see how much need there truly is.
I got you. You're in the back, brother. Yep, help yourself.
Well, Tom hates the camera and didn't want to do the interview, but he said that helping people is more important, and he hopes people who see the harsh reality will also step up and help.
We need protein, such as like tuna fish cans. We need Vienna sausages. We need fruits. Non-perishable is what we're looking for. Something that will substitute when they can't get meals and it's not going to go bad on them.
This is every day for Tom and St. Miriam's, but he says he's no hero.
Just somebody that cares. Look, I'm a week away from being homeless, half the time of the year anyway. So, I see what they go through. I know what I struggle to go through in a week, and I hate to see people like that.
Being a helping hand and a voice for the voiceless is why hundreds every day believe that Tom Fry is definitely a hero. I'm Bill Anderson.
Well, they already
But let's begin with a look at the latest numbers announced earlier by Dr. Ferrer. County by county look at the numbers. L.A. County now has more than 18,500 confirmed cases, 848 deaths. Riverside now over 3,300 cases, 112 dead. Orange County with more than 1,800 cases and 36 deaths. President Trump has signed a nearly $500 billion stimulus package passed by the House yesterday. Most of that money will go to help small businesses. California Governor Gavin Newsom today announcing a new initiative that would help both seniors and struggling restaurants. The program allows local restaurants to provide meals for older adults. The program would be funded largely by the federal government. Let's begin, though, with Dr. Barbara Ferrer, LA County's Director of Public Health. Dr. Ferrer, thank you for all that you have done during this time.
No, thank you, and I appreciate the opportunity to be on the show with you tonight. Thanks so much.
All right, the biggest question that you're asked every day, everywhere you go, but let's begin with it because it's on top of mind everybody. When are we going to get out of this thing? You're the one that's actually going to make that call. I know you're not going to give us a specific date, but are we talking weeks now? And what does that potentially look like? What kind of businesses might open up first?
Yeah, thanks so much, and that is top of mind, and it's top of mind for us as well, so I appreciate the question. It's definitely weeks. We're well on our way to both doing the planning that we have to do in order to get to recovery. We're well on our way to slowing the spread and in ways that are meaningful and allow us to make sure we're not going to overwhelm our hospitals and our healthcare system. And we're well on our way to coming up with what I think will be a roadmap that allows us to slowly start relaxing some of the restrictions that have been in place that really are meant to help us, again, reduce the number of people who could spread infections to other people.
Dr. Ferrer, in your comments this afternoon, you brought up the topic of asymptomatic or pre-symptomatic carriers. New England Journal just put out an article an hour ago, Asymptomatic Transmission, the Achilles heel of current strategies to control COVID-19. What are we to do with asymptomatic carriers? This is about testing. What's our plan?
I think there's two parts to it. I think testing is really critical, being able to expand testing. Right now, that means doing a lot more testing in our institutional settings where we're seeing the highest rates of people actually dying from COVID-19. And we have to be able to test everybody who's caring for our most vulnerable. That includes healthcare workers, people who are working in our nursing homes, as well as the residents that are staying there. But I do agree. Understanding now how much spread could be happening by asymptomatic people leads us back to the initial premise, which is we all have to assume at any moment in time we could be infected and infecting others, and others around us could do the same. They could be infecting us. And the fact that we now know for certain that you could have no symptoms and not even go on to ever develop symptoms and still be positive for COVID-19 and be able to pass that along to someone else means we have to redouble our efforts, even as we're talking about a recovery phase. That means making sure that people are as far apart as they possibly can be, even when they're doing when more businesses are opening up. It still means you can do a lot of distancing in workplaces. It means making sure we're all wearing our face coverings. It means for sure that we're able to expand testing where we need to expand testing so that we acknowledge that at some point it's going to be important for workers who may have had an exposure to somebody with COVID-19, for them to be able to be isolated and quarantined, and at some point they may even need to be tested.
When you talked about businesses, I know you've also talked about the idea that some retail businesses may be the first ones to do this. Sort of paint a picture for us, if you will, of what the next few weeks are going to look like. We have May 15th as a target date that you've set. What's it going to look like?
Between now and May 15th, we have some work that we need to do at both the Public Health Department with our partners and all of the other county departments under the leadership of our board and chairperson, Catherine Barger. But I also think there's work that our businesses need to do to get prepared for the relaxing of restrictions. No matter what, we're going to continue to issue health officer orders that are going to require that as businesses open, they're adhering to all of the physical distancing requirements and infection control protocols. So now would be the time for businesses to start thinking, what would that mean in my place of work or my place of business? How would that work? How would I limit the number of people that can be in a building at the same time? Because again, we're going to want to keep people as far apart as possible while getting as many people back to work as possible.
Speaking of far apart in buildings, the CDC director yesterday said that there have been no cases of out-of-door transmission. Doesn't that give us the opportunity to open up parks and beaches and of course, maintain our distancing there?
You know, I haven't seen those studies that with all certainty are saying that there's no transmission out of doors. We do know that when people are in very close contact with each other, they do transmit. And knowing all that, you know, the name of the game is still, you know, keep your distance even when you're out of doors. So we will be, again, as part of the planning process, looking at making sure that we're attending to our physical and our emotional well-being as part of the recovery plan. And I do agree with you. In the near future, we need to be able to open up some places and spaces where people can actually go and enjoy all the beauty that we have here in LA County, but we have to do that in a responsible way, and we have to make sure as we're doing it, we're still keeping our distance.
Let's talk about the issue of nursing homes. That was your big announcement today. Real changes for what nursing homes are going to look like. Talk to us about some of the key points.
I think one of the key points is to make sure that everybody that's working in a nursing home and everybody that's living in a nursing home will in fact be able to get tested and tested on a regular basis. There's about 350 skilled nursing facilities throughout LA County, and we need to make sure that everyone who's residing in a nursing home and everyone who's working in a nursing home are as safe as possible. The best way to do that right now is to introduce the capacity to test everyone. And that's what we're working on. We have a plan with the Department of Health Services to start immediately doing testing at every site, starting with those facilities that have the most number of people who are now positive for COVID-19. But in the next couple of weeks, we'd like to have made sure that we've been in every facility. We're partnering with the city as well on this, so that we're testing, because this was, again, the issue about asymptomatic people being able to transmit the infection. Nursing homes are doing everything possible to control the spread of infections by using sort of the common sense approaches we had introduced back in February. Make sure that symptomatic workers are not coming into the facility. They were doing temperature checks and they were doing symptom checks. But now we find out that unfortunately, asymptomatic workers can transmit. So we're going to need to go ahead and retool and take that into account so we can quickly identify who's positive and move them into isolation.
Well, we want to talk more about the issue of testing with Dr. Ferrer. We also want to talk about your efforts to keep LA's homeless population safe. That is a complicated issue. And joining our conversation when we come back is Supervisor Catherine Barger, the chair of the LA County Board of Supervisors. We're also going to talk about the stimulus bill that was just passed. What does that mean for LA County and the Southern California more broadly? And with thousands of people already rushing to Orange County beaches, what's being done to keep residents safe at home at one of the hottest weekends in months? Could LA County beaches soon be open? Stay with us. More people working from home means less personal grooming is going on, apparently. Unilever says lockdowns have cut into demands for its personal care products like shampoos and deodorants. The company says people were likely to spend more time at home, more time cooking, but the nesting idea means less occasions calling for the need for personal care products. Our guests joining us today are two people that always look good. The supervisor, Catherine Barger, chair of the LA County Board of Supervisors. And we welcome back Dr. Barbara Ferrer, LA County's Director of Public Health. The big question that we started off with in the first segment with Dr. Ferrer was, when can we get back to some sense of normalcy? Supervisor, this is the big question, and you've got 4 benchmarks that are looking into this issue.
Well, and I have the 4 benchmarks thanks to our amazing Dr. Ferrer, who really is leading the charge in terms of helping us do this in a way that's going to protect public interest and public health. So it's obviously capacity, making sure that our hospitals have the resources they need and that they're protected. It's about testing, and tracing, making sure that we have the capacity, protecting our most vulnerable population, making sure we have in place what Dr. Ferrer talked about in terms of the skilled nursing facilities, and then ensuring that whatever we do, we can maintain social distancing and incorporate the use of masks into whatever we do moving forward when we begin to open back up.
I mean, when we talk about testing, the governor has talked about the fact that he wants to have 60, 80, maybe 100,000 tests a day in California. How does something like that work? Is everybody going to be getting tested, whether they've had symptoms or not? What are you looking for? What are you preparing for, Supervisor?
Well, again, and I was listening to what Dr. Ferrer said. Right now, we're prioritizing those that are dealing with our most vulnerable population, and that's going to be those that are symptomatic and asymptomatic, now that we know that it can be spread without showing symptoms. So we're going to prioritize, and Dr. Ferrer works very closely with Dr. Christina Galli, who you had on and who talked about this, and they're going to bring forward the protocol. But obviously, the need to expand is going to be something that is going to be in play, but we're going to do it in a very methodical way, addressing those that are the most vulnerable.
Dr. Ferrer, I'm wondering, how do we know if we're doing okay? Do we have a set of criteria once we start to open up that you are going to be following, that we can follow too, that let us know we're making a go of this?
Yeah, I think that's a great question, and we do have criteria that we need to follow. We follow it now. You know, we look at the number of new cases, and we look at how long it takes us to double the number of new cases. Now, some of that now is, you know, really an artifact of the fact that we've expanded testing. But once we start reaching a plateau on the number of tests we run every day, then that becomes a pretty reliable benchmark for us. But the most important benchmarks are going to still be how many people are in the hospital, what kind of services they need when they're in the hospital. We can't run out of ventilators, and we can't run out of space in our ICU units, where the most critically ill people are going to be taken care of. And for me, you know, I need to see that our death rate starts coming down. You know, I've talked a little bit this week about the fact that, you know, COVID-19 on a daily basis is now the leading cause of death here in LA County. Right. We're averaging about 45 people losing their lives. So, you know, we need to make sure that we're bringing that number down.
Supervisor, all this costs a lot of money. I mean, and it's expensive for the county. We just had this big stimulus bill pass in Congress yesterday, some $500 billion, but not any of that really allocated to local governments. What do you need going forward, and what do you make of the stimulus?
Well, to me, it's a two-part question. First of all, in this last package, they did include billions of dollars. I think it's $20 billion or $25 billion for testing. So right now, the immediate need is for us to build up in the area of getting people back to work. Next round, obviously, we're going to be looking at a stimulus package that's going to address the fact that we're estimating about $1 billion is what we will have lost. 25% of our sales tax is gone. For this short period of time, estimated between close to 75% down on sales tax. So we're going to have to address that, because those are direct line services like social workers, our first responders, and but first and foremost, I want to get the money to build back up an infrastructure that will let us basically try to go back to whatever the new normal is.
Right. It's going to be another big issue is it's going to be hot this weekend. LA beaches are closed. Orange County beaches, Ventura County beaches, some of those are open. Earlier I asked the mayor of Los Angeles, Eric Garcetti, so what happens if Angelenos start showing up to the beaches? Here's some.
I mean, from our perspective, you know,
what happens to them?
No, people comply. We haven't had any strong issues with people not complying once we find them. So we put a presence. We never go straight to that. If that develops and becomes a bigger problem, obviously they could be. But that is never how we lead. That's never step 1, 2, 3, or 4. Just as we have with businesses, we could.
So basically, I asked him, will people be arrested? We had a bit of an audio hiccup there, and he said, you know, that's not what they're looking to do. But Dr. Ferrer, I mean, is there any instance that if somebody's out in the ocean that they're going to get coronavirus? You know, I mean, what is the fear? Why do you think these other counties are okay with this and you're not okay with this?
You know, first of all, we're the largest county, you know, in the whole state, and we have 10 million people who live here. And even though we have a lot of beaches, we can, as you all know, our beaches can get extraordinarily crowded on hot days. So the issue really for us is that there would be a lot of people who weren't in the same household who'd be in close contact with other people. And we just can't do that right now. We really do need to keep ourselves apart, to stay home as much as possible, to do that isolation from other people who aren't in our household. For a bit more. That's the science is telling us that. I mean, as you've all seen, we haven't seen any decrease in the number of new cases here, and we've seen an increase in the number of deaths. Yeah. So we still have to really adhere to the physical distancing, and that's the fear that we have of opening our beaches too soon.
All right, well, coming up, Supervisor Barger, Dr. Ferrer will be back to answer some of your questions. Stay with us.
So let's do this. I'm going to start with one leg in front of the other, arm out to this side. I'm going to lift over like a rainbow, T. I'm going to twist down, twist up, and have a seat. Again, rainbow, T, twist, untwist, and release. Don't forget to do your other side, and a few of these every day, and you will look and feel great.
Our thanks to Grace Wang of Grace Anatomy Pilates for recording that quarantine workout tip just for us. Every night we feature a different workout tip right here. We bring back into the conversation Dr. Barbara Ferrer, Supervisor Catherine Barger, to answer some of your viewer questions. So let's put this question up right now. If a sneeze or cough can expel droplets contained in COVID-19, Dr. Ferrer, can heavy breathing during jogging expel droplets? Also, I walk for exercise. I worry I'll walk into the droplets as joggers go past me with no masks on.
You know, it's a very good question. These are what we call pretty big droplets, these respiratory droplets. They generally fall to the ground very quickly. So if you're outside, it's not like they're lingering in the air. But it is possible if you're in close contact, again, you know, you're like 1 feet away from a person, and they've come by you and they're breathing very heavily or they're coughing or they're sneezing, that you in fact can get some respiratory droplets, you know, on yourself and on your body. It's really why we say, even if you're outside and you're getting your exercise, you know, as much as possible, you know, keep your distance from other people.
Right.
You certainly, if you're in a congested area, we do suggest you wear
those
your
facial
cloth
covering.
face.
Right.
Yeah, wear a cloth face
Stay
covering.
6 feet. There's a lot of mask police out
Another
there.
question quickly. This is for you, Supervisor. Since there are multiple locations conducting horse racing without crowds safely and with established protocols in place, why has Santa Anita not been allowed to race behind closed doors?
Well, we're working on that now. They submitted a new proposal, and obviously one of the issues was bringing people in from the outside and not being able to ensure that they would not transmit if they brought it in from the outside. There's 750 people that live on site at Santa Anita right now. So we've got their proposal. Dr. Ferrer is looking at it with our council. And again, I always err on the side of public health, but they've addressed some of the concerns that were raised the first time around. So we'll look at it.
Our final question comes from Conrad Kawaguchi. No question. Kudos to Dr. Ferrer, Supervisor Barger, and Dr. Galley, providing LA County with the updates every day. Don't know how they do it. Thank you for what you do. Thank you for being with us. We really do appreciate it.
Thank you, guys.
We'll be right back with Billy Bush after
Thank
this.
you. I want to, thank
Extra, continuing its series, Celebrity Questions on Coronavirus. Today, it's DJ Khaled's turn.
Where did it come from? What is it? Because we want to make sure this can never happen again.
Yeah, DJ Khaled, that's kind of frustrating, right? We've known for years that there's going to be potential pandemics, viral infections. Coronavirus or COVID-19 is this year's pandemic. A few years from now, there might be another one. So it's really important that we don't forget this experience and we continually prepare for the future pandemics that may come.
Joining us now is Billy Bush, the host of Extra right here on Fox 11. His house almost looks as nice as DJ Khaled's. That's
almost. All kinds of stars asking questions tonight, from French Montana to Adam Rodriguez, and they're all just giving him a chance. At the end of every interview, we let them ask a question to Dr. Dorian, and everybody's got questions and things that they can't quite connect. So that's we'll do that tonight, as well as Doc Antle. Okay, Drew, it's Friday. We're going into the weekend. You're a huge Tiger King fan. Yeah. Doc Antle drops 2 major news breakers tonight.
Okay.
I'll give you one of them.
Give me.
One of them.
Tell me.
Okay, one, he claims that Joe Exotic is actually a Texas oil silver spoon kid.
Oh, really? Interesting.
What?
Interesting.
Like, did you have him as everything other than that? Like,
absolutely. Why wasn't that in the documentary?
Yeah.
I can't believe it. This guy's like, are you kidding me? Joe Exotic is this? And then there's another major claim, but it's pretty interesting.
Explains where some of the money came from.
He's got all these incredible trucks and things and lots of equipment, but that was one of the 2.
He's got quite a background behind him too.
Yeah, Doc.
Quite a lot.
And so, if you look at the Britney Spears MTV VMAs, I mean, when she had the tiger on stage and then they put her with the snake around that legendary shot, Doc Antle was the handler.
Oh, wow.
Taking care of he's had a big run. He did Ace Ventura, I believe.
Okay.
And
he's an interesting story.
Hollywood stuff.
All right, Billy, that's coming up on Extra in just a few seconds. Dr. Drew and I will be back Monday at 7. I'm back tonight at 10. And then The Issue Is with Kevin McCarthy tonight at 10:30. Have a great weekend, Billy. Have a great weekend, everybody.
Good night.
Thanks. See you guys.
Just want to say thanks again for being here with us on News Now. We have more interviews and stories coming your way. Well, there's no doubt about it. When we emerge from coronavirus, it will be a different economy, a different country. From the 80s oil crisis to today's pandemic, one expert is sharing his 40-plus years of experience for everyone. Our very own Fox 10 Phoenix's Carrie Lake talks with Stuart Adam about 401ks, opportunities you could take, and of course, the market.
I'm so pleased to be joined by Stuart Adam with Adam & Partners. He's got more than 4 decades of experience in investments and the markets and the world markets. And Stuart, you've lived through more than one crisis and crash in your lifetime. How does this one compare?
Well, they're all different. This one is really unique because I think it's reasonable to say that, we basically shut down 50% of the planet right now, okay? And it's hitting on the 2 areas that create the most fear, health and investment, financial insecurity. So you've got both of those, plus you've got job security issues, and people live, which is human nature, in the position of fear. and this has just really compounded it, and it's anxiety raising, it's overwhelming. But you have that in all the scenarios of all the different crises. But this is pretty unique.
You know, it's interesting that you say that it's based on fear. I think there's a lot of fear whenever it comes to investing your money, because you're thinking, is it going to go away? Am I making a smart investment? And now people are looking at maybe their retirement or a little bit of savings they had and thinking it's going to completely be zapped if it hasn't already. Is it too late to make emergency moves with your investments since we're so far down the line in this?
No, I mean, there's no need to make emergency moves. I think what we've got to be careful of, and which we've seen, is when fear is present in individuals or in families or whatever, it triggers a reaction, you know, which is, I'm going to lose everything. So what you got to do is you've got to get yourself in that position, if you can, where you're not in reactive mode. And that comes down also to your own personal situation of like, okay, you know, sit back, let's see where this is all going, because everybody's looking for the answer. When's the virus going to be done? Where's the vaccine going to be? And they're just barraged with information that it's very difficult to see through the mist, the fog, the information to pick a direction. And we're just really going to be teaching people how to invest and deal with the unknown. And it's very hard. It's like going through an earthquake. You know, when you go an earthquake, there's nowhere to go, right? Everywhere is like this. It was the same with this situation. It's people are saying, well, where do I go? What do I do?
You hear the President Trump saying, we had the strongest economy in decades going into this. This happened. We are going to bounce back. We will bring this back. Is he being optimistic and kind of a national cheerleader, or do you think that that is a real possibility?
Well, I think it's difficult when you're a leader of a country anyway. You have to create the optimism and hope that this is going to come forward. I do believe it will, because I think the world, and particularly in the United States, we're very creative, energetic. We adjust very quickly. I mean, if you just look at how people are adjusting to this now they understand how serious it is. They've taken it on their own bat to, you know, do the distancing, wear the masks, etc. You see takeout restaurants that were sit-down restaurants. I mean, we're very adaptable, and we will continue that way. But initially, it's like, well, what do we do? So is he optimistic? He can't be anything else but that. He has to be. Because if he wasn't, it would be really not a good place to be, would it?
Yeah.
So it's, you can see by the way the government and the Federal Reserve have responded. And you look at Europe, you look at Asia, and there's about $10 trillion worth of liquidity going into these markets. And the economy, when you look at the global economy, is 80 trillion. Okay, and we're basically a significant part of that, along with our friends in China. So yeah, we'll come back. I don't know when exactly, but we will come back.
You know, as somebody who has a 401k, I think my statement came today, and I just put it aside and said, you know what, I'm not going to look at that right now. Is there something that people who have just a basic work 401k should be doing? Should they do what I'm doing and kind of put my head in the sand a little bit and go, I can't even deal with it right now? What are some tips?
Yeah, I mean, it is difficult because you've got a lot of anxiety around what's going on, and you just know it doesn't look that great. I would encourage everybody to open those envelopes and take a look, because it's a time when we have to be responsible for the investments that we make. You know, because when we look at this, the money that is accumulated in 401ks, whether it be part employer, part ourselves, is the result of a lot of energy that every worker has put into making it. You know, they've expelled a lot of energy to make it. Mm-hmm. So it's very important that they do look at it, because that's the energy created for the future. It's easy to say, I don't want to look at it, it's gone down. It's important to do so because it's a time to really look and evaluate, you know, what are your objectives in your life? When are you going to retire? Are you going to retire? How much do you need? And then sit down and sort of go through it and make adjustments in line with a financial advisor or whoever, your tax person, etc., and shift it around. Maybe look at, you know, some of the future businesses that are going to grow, because it is going to be different. Choose where you've had concentration of stocks. Maybe get more diversification in. If you don't have international, get some international in there so you can get that diversification. Because at the end of the day, you're in wealth preservation. You know, you grow your wealth by your incomes or from your businesses, right? And so when you actually have the money in your 401k, your 401k is not going to make you rich, but it at least has to preserve capital and move with inflation or above, but without taking on too much risk. So yeah, absolutely, you should look at it, and the emphasis there really is diversification.
In previous conversations I've had with you, you've talked about having 18 months of money set aside to live on. That seems for the majority of people, I imagine, almost impossible when many live paycheck to paycheck.
Yep.
Is there, that's optimal, 18 months, a little nest egg. What's something more doable for the average person?
Well, the most doable thing actually is not to look at, you know, either you have the cash or you don't, right? If you don't, then there's no point pretending you do, because it's about survival, right? So what you would look at is you cannot project how much your 401k is going to grow. That's much. But what you can emphasize on is where can I cut expenses? You know, I mean, when was the last time we looked at our domestic budgets? How many times have we applied and paying for 23 different apps for our phones that we never use? Do we have credit card debt? Do we have mortgage debt? There's no harm in picking up the phone and trying to renegotiate and bring costs down so you can become as efficient as possible.
Right.
Then, if you're really short, then you do have to look at, you know, how do I get the money to put food on the table? And that's a completely different game there, because you have to effectively borrow if you can.
Well, and I have heard there were some offers that if you borrowed against your 401k, you wouldn't be penalized as much. I'm sure you don't encourage people to do that.
Right.
Is there ever a reason that you would want to do that, or that it would make sense?
It makes sense if you really have a liquidity crunch. I mean, in the sense of if you've lost your job, you've been furloughed, you don't have cash, and, you know, it's stressful enough, then you have to be realistic. I mean, you have to deal with today, and then we'll figure out tomorrow when it comes. But, you know, if you're lying in your bed and you're not sleeping at night because you don't know whether you're going to be feeding people tomorrow or meeting your obligations, then you really have to make the adjustments. And there's nothing wrong with it, because everybody is feeling that. It's a very difficult position.
You know, it seems to me, Stuart, that maybe in the tech crunch, or, you know, you talked about having survived the Asian currency crisis, the '87 crash, those hit segments of the population or a country or a region. This is a rare one where it is hitting the whole world. And obviously it's tragic. Does that make it any better or worse? I don't even know. How does that make it different?
Yeah, I think it forces us to reflect very closely on who we are as a globe, you know, as a planet, and who we are as individuals in that role. I think what people have woken up to is we are interdependent. We are a globe. I mean, something happens in China and it affects people in Ohio or in Paris or wherever. We can't ignore that fact anymore. And people say, well, if we cut down global trade, don't have to deal with it. No, trade is always going to be there. Movement of people is always going to be present. So what we've got to determine is at the policy level is where is it we're going to help each other out? Is it on health? Is it on environment, peace, global strategies, etc.? I think that's where it changes. But I think when it gets to the day-to-day living part, we are going to see a lot more localization. I can't imagine us having China produce all our medical equipment, for example. And there's going to have to be strategic decisions to bring that back. Communities, the good news on this is coming together. Local communities, we're actually becoming interdependent on each other. So I think some positive things will come out of it. And it's going to depend very much on how we open the economies again. You know, how does Europe open? I mean, Italy, for example. China is open, but, you know, we'll see what happens. Is there going to be another round of the virus coming through? So I think there's a lot of moving parts to this.
Well, and you're watching more of the global economies. How are you seeing any examples where you think, they're actually doing a pretty good job at it, or that's not working?
I think, you know, and it's been pretty well publicized, places like South Korea, Israel, in the sense of the virus, you know, defense, in the sense of how they've dealt with it. But they were prepared, they were equipped for it. I think basically because South Korea has the neighbors next door and Israel has their neighbors next door. So they're sort of more equipped for a crisis situation. The Western world, we were really caught unawares. So where are the opportunities here? I think the digital telecommunications and communication side of it is here to stay. I mean, that's an area where there's a lot of investment that's going to continue. You're going to see healthcare, you know, boom in the sense of, different ways we're going to do healthcare. You know, our hospitals cannot handle pandemics anywhere in the world. You know, and that's why we have this stay at home and self-isolate. So we're going to have to look at more technology and dealing with things in the domestic field at home and locally. So, you know, I think there's lots of areas that are going to develop from this. And it's going to be the same people. You can't take, you've got the two largest trading blocks in the world that really do matter right now, and that's China and the United States. That's 50% of the world economy right there.
Yeah.
And we're going to have to figure out how to get on with each other better. And that's the opportunity. So if I was investing, I would invest, I'd look at emerging markets in Asia, for example, still. I would look in the US at companies that have good, strong balance sheets and a good product going forward. Europe's a difficult one. Europe is a very difficult one to determine where to invest.
You feel that Europe is in for a long slog trying to get out of this, and it may not look the same?
Yeah, I think Europe have got some, you know, structural challenges. You know, what is the role of the European community versus the sovereign states? You know, Italy, Spain, France. And it's like when this crisis came up, the Italians were Italian and the French were French and the Germans were German. And there was sort of reluctance to support, certainly financially, Italy and Spain from the European community. They took a long time to respond, and I think they're battling with that. And at the end of the day, is a German taxpayer going to pay for the overspending of the Spanish in their debt? You know, they've got some complicated issues. It's great if it works, but I think they're going to be very slow at coming through this.
We're definitely seeing some cracks in this whole globalist idea of the globalist agenda, you could say. I mean, you could see that before this with the election of Donald Trump and with Brexit, even though that has been kind of a difficult coming through. Do you think the globalist agenda kind of moves forward, or do you think that's crumbled?
No, I think it's under review. I think it will be reviewed. You know, what exactly does that mean? You know, trade will always be global, always has been, always will be. Immigration, migration is going to continue. How do we handle that? You know, I mean, there's 248 million people in the world that don't live in the country that they originate from, me included. So, you know, it's a pretty large movement of people. That's going to happen. So how do we deal with those policies? What are immigration policies? Where do we have, free travel in and out of countries, etc.? So globalization will be there. It can't be avoided. It's just in what dynamic is it going to show up? I think the role of government is going to be more crucial now than it's ever been, purely from a strategic and public policy issue, not just in the United States, China, throughout Asia, throughout Europe. And, the initial blame game has to stop. And then it's like, okay, let's have some brain power and creative minds on how we're going to deal with this. How are we going to deal with the global health issue? How are we going to deal with the environment issues? I mean, they are big issues.
Yes, definitely. Seems like that's going to be difficult during an election year. I mean, the worst time for a pandemic to hit during an election year when you have just a lot of this going on.
Right.
Maybe we can move beyond that, hopefully by November. If there was somebody out there who did have a pot of money sitting around and they said, you know what, I'm looking for some really good deals, maybe some fire sales, things like the airlines, the cruise industry, places that have really been hit hard, would you ever suggest that they buy something like that? Or are there some things you would suggest?
Well, it depends on the background of the person. Okay, I mean, it depends whether they're entrepreneurial or not. I've always taken this belief that you make money in your own business. You don't look to the public markets to make you money. There will be opportunities. And I don't think the cruise industry is finished, and I don't think the airline industry is finished. But yes, you could take some positions in there, but they are speculative. What you could pick up at the moment is what we call the high yield bond market, where there's been a defragmentation a little bit, where yields there have pushed up because of the deleveraging effect that happened. Because where people had leverage, they had to sell, and they sold everything. When the markets went down that 35%, we actually at that time were buying, and you have to be pretty, the stomach twists at that time. I don't care who you are. You think, oh, I got this right, what's going to happen? But there are true bargains that are out there. Now, the market's recovered quite a bit, and volatility is still going to be present. So I would err very much on, diversification, keeping conservative, and then look for opportunities. I would not be a buyer of the cruise lines right now. And I think it's hard to do the airlines right now until we know what's happening with this virus, what's going to happen when it phases out. I think the recovery of money flowing in will be very quick because there's a lot of money out there.
I've had a moment, I'm sure, just like everybody else, where I've woken up in the middle of the night worried what's happening with the economy. Are we going to continue to see it? Then we'll have a couple of really good days on the market. And, you just have this back and forth where you're panicked about things. What do you tell someone if it was a stranger on the subway or a loved one who's really stressed about this yo-yo back and forth and the oil market dropping? Is there a bit of therapy or advice to maybe make people feel better about it?
Well, I can tell you we'll get through it, that's for sure. I mean, the world economy has gone through wars and it's gone through disease and pandemics before. It's hard to predict exactly the time frame from it. So it's really, we will get through it. What you've got to do is protect yourself between now and when that is. And that's why I always say the 18 months. Now, people don't have 18 months a lot of time, but the families we do, they think it's a lot, but it's like you want to be able to maintain your lifestyle whilst this gets sorted out. And maybe you have to cut back and reduce your lifestyle if you don't have the funds. But you get yourself to a position where, okay, I can live with this, I can breathe, and I know the markets will recover. And I would encourage people, yes, you do look at your 401k, don't bury it. It's very important to take a look at it. It's not pleasant, but it's like, you got to own that was your money, that you earned that. You got to look after it and keep an eye on it.
I'm actually surprised that we didn't go down more. I guess I was expecting it to continue to fall. Is there any surprise to you that we're seeming to kind of hold right around 23,000, I believe. I haven't checked today.
Yeah. Yeah, on the S&P, around 2,800. The whole issue really came out in the sense of this is not a 2008 crisis. 2008 crisis was a financial crisis, and you could see clearly where it was. So there was a reluctance and slowness about providing liquidity to the markets and to the industries, etc., because it was a self-inflicted wound, if you like.
Mm-hmm.
This was not. This was a virus. You can try and blame people, but the reality is who knows where it started, but it became a global health issue. And the speed of response by countries around the world immediately to put money into the system to make sure the financial markets could smoothly operate and money could flow around. The fiscal stimulus effect.
Yeah.
In a sense, I mean, that's big money. And we all criticize our government, but Congress actually, when the chip was down, actually did deliver, maybe about a few days too late. But, you can always criticize. But they did it. They did their job. They got the money out. The Federal Reserve were, in my view, superb throughout this. I mean, they were quick, responsive. And what that happened is then we effectively also nationalized our payroll. I mean, the government the government is backstopping payroll right now for a lot of small businesses. That's really sort of unheard of. So people have that confidence that, I'm possibly going to be all right. They're actually caring for me. The question is how long does it go for?
Yeah. Okay, I've got two more questions for you. One involves opening up, and we're starting to see states look at opening up. Some states are saying they're like Georgia, I believe next week. Do you think that's a good idea? Do you think we need to get things moving? Your thoughts on that? Well,
I mean, it's a tough one because you've got this decision between health and the domestic, individual families' economics. I mean, in the sense of, well, yeah, I don't have the money, I need to get back to work to pay. Okay, if I keep the social distancing and we get the things that we need in measure, will that be okay? I don't think anyone has really worked out which is the right way to go, but we've got to start doing something and start moving it forward, because it's like anything else. Someone has to be the first to open, right? I mean, and we don't know whether the virus kicks up again, and time will tell. Europe are being very cautious about it. France is still stuck inside. Italy, I'm not sure where they are with it now, but they'll start to open, because you don't want to keep the economy shut down for too long, but you also don't want to create a huge health crisis again with overcapacity, over demand of the hospitals, etc. So I think state governors and mayors, etc., have a very challenging job. It's not easy to work that out. You want to be able to get that balance. I don't think the virus is going to be going away. I think there's a chance that we might have to have intermittent shutdowns again, until we have the vaccine.
I think for me, the frightening part is we don't know this virus, and okay, we're all kind of getting used to the world we're in right now, but what if we were to get some really bad news about the virus and we found out it behaves in a different way that's more frightening? To me, that's what keeps me still awake at night. And I'm sure for investors, that's in the back of your mind.
Well, I think also it's when we're in a state of fear, there's this philosopher. He actually wrote a good book. It's a gentleman called Thomas Hobbes, and this was in 1651. He said, "Fear and I were born twins." Okay, so basically there's me and there's fear. And we live in that space of fear because that's our instinct. So the danger is we project so far into the unknown, and it's very rarely positive when we project.
Yeah.
No, it's very negative. All I would say is just people just stick to where we are right now, stay in the moment. We don't know what happens, and we'll deal with the virus if it comes around a second time. But I'm pretty optimistic we will find vaccines. We have very smart people in this world.
Yeah.
They will figure it out. Not me, but they will.
Well, like you, Stuart, like you. Somebody once told me, don't worry, you probably don't even remember what your biggest worry was 6 months ago. And I thought, wow, I'm sure I do. And then I thought about it and I couldn't remember what I was worrying about 6 months ago. Yeah. I do think we will remember the pandemic.
Oh, that I have no doubt, because it's like anything that's a shock in the system. But it's you know, I would just say worry about the things you're going to do today, get the schedule right, you know, be in the sense of logical as much as you can. And if you're fearful, just remind yourself you don't have to react. The biggest mistakes are made is when you react. Market's going down, sell, you know, or do that. And it's usually the worst thing to do. And it's the hardest thing. And we're professionals and we do it. And it's like, we don't like that feeling either. Nobody does. But it's just, we've just gone through enough of these things to know, okay, I'm worried as much as everybody else, but I have to be cool in the sense of calculating what this is. And if you can get to that state where you're not making reactive changes to your financial situation by panic or thinking you're going to survive, then you know, then you're in a good position to move forward. But the staying awake at night worrying about the pandemic, my advice on that is just, if you can do it, get a good therapist.
Early on, I think a lot of people were, and then you go, wow, we're several weeks into this. I need to sleep at one point. Stuart Adam with Adam and Partners, thank you so much for joining us and helping us, I guess, feel a little better about the situation we're in, at least that we're going to survive it.
I hope so. Thanks very much, Perry.
Thank you.
Appreciate it. Bye-bye.
Once again, that was our very own, right here from in-house Fox 10 Phoenix, Carrie Lake, interviewing Stuart Adam, and he is with CEO Adam Partners. All right, so we are taking a live look from our South Mountain Tower cam at the beautiful city lights in Phoenix, Arizona. Getting my map set up here for you so that we can take a live look once again here at the latest numbers here in the United States. Now, we have over 890,000 cases of COVID-19, but President Donald Trump earlier today was saying that we are seeing more tests come back negative rather than positive. He said New York's are down as far as positive tests go about 50%, and he said deaths there also down 40%. So that is some good news that's coming from our coronavirus updates here today. Unfortunately, across the U.S., we do have 51,017 deaths, and more than 124,000 people in the hospital. I just saw a story, and of course, it gets emotional when you read about everyone's different stories, where they're coming from, what they're dealing with. But a little boy, 4 years old, in the hospital dealing with coronavirus. So you can always go and get stories and updates and interviews, all from coronavirusnow.com. That is a place that you can check into 24/7. That's where our stream runs 24/7 as well. So we do have you covered all day and all night. Now, I know one thing that many parents are concerned about are what kind of stress is this putting on my child? And we do have a great interview with a Fox 2 San Francisco talking about what signs to look for to see if this really is affecting your child.
I'm Alex Savage from KTVU, Fox 2 News in the San Francisco Bay Area. And of course, as everyone is staying at home right now, this can be a very stressful time for parents as well as for kids. Joining us now with some advice on how to handle all of this is Dr. Hansa Bargava, pediatrician and senior medical director at WebMD. Dr. Bargava, it's a very, very good to have you on. Always nice. What do you think is happening in a lot of homes in terms of the stress level?
Yeah, I think it's unprecedented times. We are seeing probably a lot of stress because of all the various factors that parents really have to handle. So whether it's a stressful job or you lost your job, you have kids at home, whether they're school age or they're little. And so you have all these balls that you're juggling in. It seems like a pressure cooker that a lot of families are facing right now.
Well, what are some of the ways to lower the anxiety in a home? Because we do have a lot going on. I have a lot going on, in my home. Every day it's just nonstop. It feels like it doesn't end. Whether it's it's online classes for my son, it's online work for my wife or I. It doesn't seem to end. What are some of the ways that we can manage the stress and lower the anxiety level?
Absolutely. So I think that, first of all, recognizing it is a good thing, right? Because that's a great place to start. But essentially, I would probably put in two buckets. One is the bucket of yourself, and the second one is the system-wide bucket, the system of home and work and trying to manage all of that. And let me just approach the system-wide first. So I think that one area that people are, losing control over is really the structure, right? So kids tend to not have rules. They don't have to go anywhere. They don't have to get dressed. They don't have to go to school. They don't have to go to activities. And so it's almost like a free-for-all. But maintaining that structure is just really important. So whether it's for you or for your kids, getting up at a proper time, going to bed at a proper time, and shutting those screens down at a proper time, having some semblance of structure can actually really help kids kind of know that they have some expectations, and you as well.
It sounds like from what I've been reading that there's a lot of parents who are noticing that their kids are regressing in the midst of this crisis, falling back on some of the old habits that maybe we as parents thought they grew out of. What types of things what might that look like?
Yeah, and so I totally agree with that. There is regression that could happen. So I'm just going to divide it up into a few age groups. So if you have kids under the age of 4, what that might look like is that all of a sudden a potty trained child is not potty trained anymore, right? They're having accidents, and gosh, that's even more pressure to add to your plate, right? You're managing home, you're managing work, you're managing the kids being there all the time. And then all of a sudden there's regression of habits. So yeah, potty training, tantrums, acting out, they want your attention. And you have to realize that for their world, everything is out just floating in the air. There's no grounding at all. And for kids, they don't deal with that very well. They actually need that structure because they feel safe when there is structure and there's rules. So again, just going back to, trying to maintain some level of structure. I'm not saying, be somebody who's so rigid, but having a structure. And then the second thing is, which is going to be contradictory or may feel contradictory, is actually letting some of that go, to not lose your temper with the kids if that happens, to understand that it is happening for a reason, and to manage it from that perspective.
So, I mean, these are normal reactions during a stressful time for a kid, right? I mean, this is a coping mechanism.
Absolutely. And so I talked about the young kids. I'm going to talk a little bit about the older kids. The older kids have different ways to manifest that. So the age group between 6 and 11 or so may not even come to you and say, hey, I'm feeling like this way, or crying. They might say, hey, I have a stomach ache, or I have a headache, or I don't feel like eating, or, sleeping for a longer time. And they may not even come to you with tantrums or regression, but they might have soft signs like that. And then, of course, there's the teenagers who I sometimes joke about, and I can say this because I have teenagers myself.
Yeah.
And it's almost like going back to the toddler stage where you kind of have those tantrums again, right?
Yeah.
I mean, storming up the
Strong emotion.
stairs and slamming those doors. Yeah, absolutely.
And so the best way to respond is to sort of acknowledge the emotions that your kid is feeling, right? It's not necessarily to come down hard on them.
Absolutely. And so I'm telling you something that's really hard to do.
Yeah.
And I can say it as a parent, I can say it as a pediatrician, but it's not easy. But it is the best response you can have. And that really is to take a deep breath and know that your kids are trying to tell you something, not in a great way, but not to react anger with anger. So if you can just calmly deal with it, and then to also go one other step and step back in the situation and say, hey, what is the deal that my child actually is regressing with the toilet training? Is that something that is a killer? No, it's not, right? So let's just let it go this one time, and then we'll just start again tomorrow and see if we can fix that, if that makes sense.
Yeah, no, it does. But as you said, that's the hard part is trying to take that deep breath and to stay calm in that situation.
And that's why I think I go to the second part. We talked about the system-wide stress, right? And managing that. But then what about the other really important thing is to manage your own stress, right?
Yes.
Because you can't really parent and take that deep breath. I mean, I'm sure, there's people who are listening to this, they're just laughing. Oh yeah, right, I'm gonna take a deep breath. Well, I'll tell you, the deep breath is not the first thing you do. The first thing you do is you take care of yourself so you can actually get to that point where you can take the deep breath. You can't lift 150-pound weight without lifting 8-pound, 10-pound, 20-pound weights. So you kind of have to almost train yourself to take care of yourself, and then you'll get to a point where you can manage those other stressful situations.
Yeah.
If that makes sense.
Self-care first, absolutely. Yeah. I'm sure I can't be the only one who is thinking, well, I have younger kids. They're not watching the news. How are they picking up on the fact that our world is in the middle of a crisis? Is it through us? Are we projecting that anxiety about what's happening in the world onto our kids?
That's a great question. Kids have the unbelievable and uncanny ability to pick up your stress level, without a doubt. So if you're stressed, the kids know it. It's not what you're saying. It's not what you're doing. They can just feel it. They're like little sponges who just know about your emotions. So again, I would say, it's really important to know that if they are acting out, if they're not watching the news, they may have heard things from you, talking to your friends or your partner or whoever else it is on the phone. Is it that you're stressed out? Is that you're not sleeping? Is it that you're not eating? Or is it that you're acting even a little bit edgy? They pick up on all of that.
Yeah, it's true. Sometimes we don't give them enough credit, but you're absolutely right. And then there's the whole idea, and you talked about it, that the routine is completely different. And parents are home the entire an entire day now, working from home, and so every they obviously pick up on the fact that something's a little bit off, not to mention the fact that people are going outside, we're going outside and wearing masks, and so there are telltale signs. How much of when you talk about the parents working from home and then kids being at home and trying to do distance learning, how much are kids, you think, trying to just get younger kids especially just try to get their parents' attention when parents are trying to, their attention is focused on work while they're at home?
Yeah, another really good point. And yes, the wanting your attention spans from the age of 1 to probably 18. I mean, they do want your attention. I mean, whether it's crying about, a toy when you're young, or the 11-year-old who just wants to like interrupt your meetings constantly and wants to be in your office all the time, or the teenager who acts out like my own son did yesterday, which it suddenly dawned on me that he just wanted my attention because I was busy all day with work.
Right.
Who's just coming there and asking random questions that are not relevant to that point in time. We have to, as parents, acknowledge that, this is really hard for them. It really is. And it's hard for you. And I know that those words are not, it's not easy to take that away. There's no magic pill, but really to understand that it will be okay, that it'll get better, and trying to let your kids know that as well.
Yeah, and I think that's the hardest part too, is because I think maybe when you get kids that are a little bit older, they kind of do. I don't know, maybe your kids, they kind of want to know, when is this all going to end? And that feels like that's a tough question for a parent to answer, because that's it's nearly an impossible question for anyone to answer, right?
Yes, absolutely, Alex. I think so. And we're all stressed about that ourselves, right? Like, we're anxious about that because it's hard to manage something emotionally when you don't know when the end is in sight, right? But this is a great time to actually point them towards the fact that, look, let's talk about what we do have, first of all. And, let's talk about history and stories of the past. So we know that this is not the first time that we've seen a pandemic. We know it's not the last time we'll see a pandemic, right? And if you could actually, it's interesting because we actually ended up, my kids are 13, and my husband actually ordered the book, The Plague, for them, which was really interesting, right? Because the plague happened, right?
Yeah,
the Spanish flu happened. And so if you have older kids, it would be great to actually talk about stories. Maybe there's a grandparent who can talk about, some of the times they went through. Were they alive in World War II? I mean, could they talk about some of the stories and the difficulties they had, and where they may have been? Were they in Europe at the time? I mean, that was a very stressful time. Or is it that they saw some sickness go through? And this is where we talked about stories last time, Alex. Yeah. The stories really help, actually, for them to know that we have gone through this before, and it will be fine ultimately. But it is stressful, there's no doubt, but we will all be fine ultimately. And then also point out what you do have, whether it's the fact that we're all healthy, or we have food on the table, or just a nice place to stay in, all of those things.
Yeah, it's important to focus on those positives. As you try to manage all of the stress kind of swirling around us. I would say this is one of the greater challenges I've faced as a parent. I don't know how you feel about that. I mean, do you think this is up there? I mean, having a newborn baby is stressful in its own way, but this is kind of, for me, it's a very unique challenge.
It is really a unique challenge, I think, for all of us, and especially for us who have children and we're managing all of those things. But I think, as I said, I think the 3 pillars are to really be grateful for what you have, to know that there will be end to it. And the last thing is really to take care. I know I keep saying this, but I cannot emphasize how important it is to take care of yourself, because if you are tired, you will be cranky. If you are watching too much news, probably, and I understand news.
Or doing too much news. Yeah.
Yeah, but if you're,
It's true. It's true.
Yeah.
Oh,
but,
you're absolutely right.
A media fast is great, right? And sometimes picking up that phone and doing FaceTime with your friends and just having that venting session really helps. I mean, it really does. And then you can get some renewed energy to tackle your kids and your job and everything else on your plate. Does that make sense?
Yeah, no, absolutely. Absolutely does. Great advice. I will take it to heart. I hope folks watching this will take it to heart as well. It's always really good to chat with you. Appreciate you coming on. Dr. Hansa Bhargava, pediatrician and the Senior Medical Director at WebMD. Take care of yourself and your family.
Thank you,
Alex. Be well until we talk next time, okay? Thank you. And
all right, we're going to turn things on down to Florida. Our sister station, Fox 13 in Tampa Bay, has a coronavirus special.
Well, these aren't the types of masks you would wear, but nevertheless, they've been popping up all over the town of Gulfport. The small signs of hope and inspiration started out as a local woman's simple
art project.
Well, word spread online as it does. Now they're showing up in other states and even other countries. Fox 13 photojournalist Corey Beckman shows us what the movement's all about.
So I made a sign and I posted about it on Facebook, and it just kind of took off from there. It's something to make people feel good, to get some creative juices flowing, just to try to get a little normalcy back in our lives. Some of the messages are about the caregivers. Some of them are just go away COVID-19. You know, there's a lot of compassion. It's been pretty amazing. The page has been up 11 days today, and we've got right at 100 signs and masks. We've got over 500 members of the group. We have 2 in Canada. We have about 5 in Oklahoma. We have 1 in Missouri. We have 2 in Ohio. And I understand there's a couple coming up in California. But there's about 85 here in Gulfport. Every morning it's just like Christmas, waking up to Christmas, because you never know what's going to be the next sign. And the creativity. So some of the artists are truly professional, wonderful artists, and their creations are out of this world. And some of them are like me that just putz around with things. And the beauty was you didn't need any supplies. You didn't need anything, just stuff that you had at home, whether it's Crayolas, whether it's paint, markers, whatever. It's been such an organic, free-flowing, pure thing. It's just been, I've done nothing. The only thing I did was put it on Facebook. And then Gulfport took over, because this is Gulfport. We want things that make people smile.
All right, you know, over the past few weeks, we've seen a lot of Bay Area businesses really transform themselves to keep from going under. We know what sort of financial stress they've been under. For one St. Pete business, making that transformation means making a difference as well. Fox 13's Dan Maddox says the business is able to stay open, pay its employees, and provide a solution for thousands of people.
Tom Cody fought for his country during the Vietnam War.
You could see your enemy there. Can't see him here.
He's stepping up again, making sure hundreds, if not already thousands, have the personal protection gear to fight the coronavirus.
I mean, we're trying to make a difference. We're not just trying to stay afloat.
He's part owner of Island Nautical in St. Petersburg. They previously made cushions and fabrics to fit on boats. That is, before COVID-19 brought their sales to a halt.
I have this cutting machine, and we decided to, try to help.
A lot of the materials recommended for masks, gowns, and shields they already had.
Yes, we use it to make window covers.
They're somewhere in between a surgical mask and N95.
It's not about profit, but making just enough money to keep them above water.
The goal is just to keep us floating through this process.
So far, they've sold 400 masks to restaurants, and they have more than 1,000 of them ready to go.
Trying to get the word out.
And it's working. This customer heard about their new products on social media.
I think it's fantastic that they're trying to protect their local people.
In St. Petersburg.
Thank you.
Dan Maddox, Fox 13 News.
Parents are finding some creative new ways to keep kids active.
And that's why a kids yoga instructor in England has become a global sensation. 8-year-old Reagan O'Neill is homeschooling like the rest of the country. Right now, she's in a gym class of sorts.
That's our PE now.
Sometimes her mother, Danielle, joins in as well.
She's my little workout partner, so we enjoy doing these together.
It's called Cosmic Kids Yoga.
Welcome to Cosmic Kids.
It's the creation of British woman Jamie Amor. Her videos intertwine popular children's stories with real yoga poses.
And Elsa stands with her hands behind her back.
Jamie's been making videos for 8 years, but views have skyrocketed during the global shutdown.
It is kind of mad. It's just gone whoop like that.
Her videos, which usually garner 100,000 views a day, are now getting 1 million on all platforms, including their own app. Total views exceed 150 million.
Just to get your head around those numbers is just kind of a bit mind-blowing. You know, when you start seeing peaks in places like India or even China, you're like, Wow.
The content is fulfilling a great need of healthy screen time for families on lockdown.
It's a great way for her to get out the wiggles, get out the frustrations of being inside all day.
So many people have been in touch and sent lovely messages about, you know, I'm like the third parent in their household now because I'm sort of doing my thing on the screen, and like that's really helping.
Jamie says the benefits are not purely physical. The mindfulness approach helps kids cope with anxious feelings during uncertain times.
The fear and the anger and the worry, we notice them, we accept them, and then know that they will pass, you know, like all feelings do.
I think it helps with some of the anxiety that maybe our kids aren't able to express, but we know that they're feeling.
But when lives return to normal and kids like Reagan can do what they want again,
jump in my friend's pool.
Jamie says she hopes kids continue to apply what they've learned.
This connection with yoga, with their bodies, with their minds, that they can practice, they can work on, and they can dip into whenever they want.
Helping in building a massive audience in a time when crowds are hard to come by.
So tonight, it would have been senior night for the softball players of Braden River High School in Bradenton. Well, it was canceled. So were all their games. But the coaches and the team members, they wanted to make this a day they'll always remember. And Fox 13 photojournalist Beth Weber shows us how.
4 years of their lives have been dedicated to Braden River softball, and this is one of the best senior classes we've had in the history of the program. This is a really tight-knit, close team. Coaches and I have been devastated by the news that our senior season and the season in general is over due to COVID.
But obviously it was very sad, and no one wants their season to end like this, especially their whole high school career.
Today would have been senior night for our 6 seniors.
Surprise you on senior day! Our coach paid a little tribute to the seniors because today was supposed to be our senior night. Smile pretty! So she came to all of our houses and brought our senior banners and yard signs and flowers.
We want to recognize them and all of their efforts throughout their career of high school.
Surprise! We brought your banner from the field.
So not having that to recognize in a traditional way, we thought we could do that by creating this day of celebration for them.
Congrats on getting Snapchat. And it was very special. I was so not expecting it. It was such a big surprise.
Every girl has a different story as to how we surprised them. Some have cried, some have been, you know, just super, super excited and completely caught off guard.
But I'm so glad that they came. Just think about all the good times you had and all the fun times with your teammates. At the end of the day, you won't remember the wins or the losses, but you'll remember the people that were there for you and the people that were by your side.
Hand sanitizer is as good as gold these days. You try not to waste it because it's so hard to find. So why is a Winter Haven woman giving it away? Fox 13's Ken Suarez has the answer.
And then your bracelet? Yeah, and did you get the mask?
Home Remedy has always created a lot of the things it stocks. Oils and creams and things that make you feel good. It just began selling something that almost everyone wants these days.
I've gone to drugstores and places like that, and they've not had it.
About 3 weeks ago, the UPS guy came in and said he was looking high and low for hand sanitizer, but he just couldn't find it, and a light went off. The owner, Marilyn Lacey Amaral, who already has a license to produce her own line of cosmetic and health products, added hand sanitizer to her list. Since then, sales and scents have blossomed.
We have Orange Blossom, which is probably our best seller in the store. We have one that's a beachy scent, one that's a gender-neutral scent.
The small bottle sells for $8, the big one for $20. But others are free if you're a first responder or on the front line in the war against COVID-19.
They need it, and they need it right now.
Home Remedy has given hand sanitizer to a nursing home, a homeless shelter, healthcare workers.
Since I started my business, I've been a firm believer in giving back. I feel, you know, you give back, it comes back to you.
And it has. Sales across the board are up. Essentially, Home Remedy is cleaning up because it's helping others do the same. In Winter Haven, Ken Suarez, Fox 13 News.
What does it seem like every kid wants to be? If you said YouTube star, you and I are on the exact same wavelength. And how many of you have let them start their own YouTube channel during this time? Well, that's what I thought. And you are not alone.
welcome. Welcome to our channel. Today I have some breaking news. While everything is shutting down to stop the coronavirus, it's important for us to stay safe and calm, people. I see buying on a toothpaper at Walmart.
Postenia sent me an email about her son's most recent video inspired by, news anchors. Though she didn't list anyone specific, I would say this is a pretty dead-on Chris Cato, if I had to pick someone to model it after. Jacob Fletcher posted this video to his YouTube channel, Jacob's Empire, and not only does he give you a good laugh, he also gives you good information like Chris Cato does. So there you go. Nicely done, future news anchor. Well, it's true. Some of us are starting to go a little stir-crazy being at home every day, but Lito Acevedo, well, you can literally watch the crazy set in. That's because since about day 4 of his own safer at home stay, he's been entertaining himself and his Facebook friends with daily videos. Toilet paper has a recurring role, along with general buffoonery and even a few tricks that just might get you at first. All of his videos are visible to the public, whether you're his Facebook friend or not. So if you feel like perusing his nearly 40 funny clips and counting, all you got to do is search his name. That's Lito Acevedo, Litoacebedo. And if you think Lito has gone a little cuckoo, you ain't seen nothing yet. For our final Funny Friday, I submit to you this set of gentlemen.
All right, I'm calling another important quarantine meeting. We have to discuss our next plan. What should we do, fellas? Hey, I think we should go beat up the socias. Where in my deep subconscious did you come from? Hey, man.
Come on, let's spar, man. Let's spar. Come on.
Tempting. Very tempting.
Let's make bad decisions.
Gosh, no, we're not going to make bad decisions. Not making bad decisions. No.
Come on, man. Spar me like you spar your alcoholism, man. Come on.
Enough. Everyone is literally gone.
I'm the troll under the bridge.
Crazy, I'm not crazy.
Ty Brett's quarantine videos began with a single shot of him in his backyard trying to trick himself that it was the beach. From there, several, let's call them personalities, emerged, and he has put them all to good use through entertaining his own Facebook friends, and, like Lito, all of his videos are publicly posted. So if you're curious what Ty and the gang get into during the rest of their stay at home, you can follow along for all the fun. Ty, T-Y-E, Brett, B-R-E-T-T. Well, Linda, I feel like we are just scratching the surface of what Tampa Bay has to offer when it comes to this Funny Friday. So if there is anyone else out there that has made a funny video, or perhaps you've got just a straight-up joke that you want to get a video of yourself telling to send my way, please do so. You know how to do it. Fox 13's Chip Brewster on Facebook or chiptips@foxtv.com. I hope to have some more Funny Friday fun for you guys next week.
All right, guys, just want to say thanks so much for being here with us on News Now. If you're with us on the YouTube side, unfortunately, we are going to be shutting things down. But if you want more stories, we are going to be streaming them on coronavirusnow.com. Now, that stream is going to take you all the way into the weekend. Some of the upcoming interviews, not only do we have Minneapolis interviews, a Mayo doctor, but we also have some best of packages, interviews with TMZ, and even care for essential workers, and that can include dental care, emergency care. So it's all going to be coming up again on coronavirusnow.com. Just want to say thanks again and hope you guys have a great weekend. We, of course, will be right back here on Monday morning on the YouTube side, but once again, we are going to continue to give you more stories here in a few minutes on coronavirusnow.com.